Tabling of documents, dépôt de documents. The Honourable Parliamentary Secretary to the Government House Leader.
Thank you, Mr. Speaker. Mr. Speaker, pursuant to Standing Order 36.8, I have the honour to table in both official languages the government's responses to 7 petitions.
Dépôt de documents.
Tabling of documents.
Introduction of government bills. Déclaration.
Statements by ministers.
Reports from interparliamentary delegations.
Presenting reports from committees.
The Honourable Member for Dufferin-Caledon.
Thank you, Mr. Speaker. I have the honour to present in both official languages the first report of the Standing Committee on Citizenship and Immigration in relation to the supplementary estimates C 2009-2010, vote numbers 1C and 5C under Citizenship and Immigration.
Présentation.
Presenting reports from committees.
Introduction of private members' bills. Premier lecture.
First reading of Senate public bills.
Motions. Présentation.
Presenting petitions.
The Honourable Member for Elmwood Transcona.
Well, thank you, Mr. Speaker. I'm presenting 2 petitions today. The first is signed by dozens of Canadians calling on Parliament to adopt Canada's first air passenger Bill of Rights. Bill C-310 will compensate air passengers with all Canadian carriers, including charters, anywhere they fly. The bill provides compensation for overbooked flights, canceled flights, and long tarmac delays. It also addresses issues such as late and misplaced bags. It requires all-inclusive pricing by airlines in all of their advertising. The legislation has been in effect for 5 years now in Europe, and the question is, why should Air Canada passengers receive better treatment in Europe than in Canada? The airlines will have to inform passengers of any flight changes, whether they're delays or whether they're cancellations. The new rules have to be posted at the airport, and airlines must inform passengers of their rights and the process that they have to file for compensation. If the airlines follow the rules, it will cost them nothing. Mr. Speaker, the petitioners call on the government to support Bill C-310, which would introduce Canada's first air passenger Bill of Rights. The second petition, Mr. Speaker, is signed by many Canadians calling on the Canadian government to match funds personally donated by the citizens of Canada for the victims of the Chilean earthquake. The Chilean community has been quite active in fundraising. They had a social in Winnipeg on March 6th where they raised $10,000. This past Saturday on March 20th at the University of Manitoba, 1,000 tickets were sold to a follow-up fundraiser. The question is, when will the Prime Minister give the same treatment to the Chilean earthquake victims as he did for the victims of the Haitian earthquake and match funds personally donated by Canadians to help the victims of the Chilean earthquake?
Présentation.
Presenting petitions.
The Honourable Member for Burnaby New Westminster.
Well, thank you, Mr. Speaker. I'm tabling today a petition with hundreds of names from the coast of British Columbia, from the Pemberton Valley, Surrey, Burnaby, BC, Seychelles and the Sunshine Coast, Nanaimo, Gabriola Island, the north end of Vancouver Island as well, Mr. Speaker. These are all British Columbians who are asking Government of Canada to move, given the collapse of the sockeye salmon fishery in the Fraser River, given what we've seen in the past with the Atlantic cod stocks, which collapsed on the east coast, given the great concerns that have been issued, Mr. Speaker, about the lack of concern and neglect of the Pacific fisheries. They've been calling on the government to take immediate action to move to put in place a system that would provide a report on the sockeye salmon fisheries collapse of the Fraser River, British Columbia, within 6 months. Mr. Speaker, this is the first. This is just yet another situation where hundreds of British Columbians are asking this government to take action on the collapse of the sockeye salmon fishery. Here, here.
Presenting petitions. Questions inscrites.
Questions on the order paper. The Honourable Parliamentary Secretary to the Leader of the Government in the House.
Here, Mr. Speaker, I ask that all questions be allowed to stand.
Agreed. And so ordered. Orders of the day. Order du jour.
Government orders the business of supply.
And child health, standing in the name of Mr. Ray.
Aujourd'hui étant la dernière.
Since today is the final allotted day for the supply period ending March 26, 2010, The House will go through the usual procedures to consider and dispose of the supply bills. In view of recent practices, do honourable members agree that the bills be distributed now?
D'accord?
Agreed?
D'accord.
Agreed.
Ray, seconded by Mr. Martin, Esquimalt Wanda Fuca. Yes, there he is. Okay, sorry, I see. Moves that, in the opinion of the House, the government's G8 maternal and child health initiative for the world's poorest regions must include the full range of family planning, sexual and reproductive health options, including contraception, consistent with the policy of previous Liberal and Conservative governments and all other G8 governments last year in L'Aquila, Italy. That the approach of the Government of Canada must be based on scientific evidence, which proves that education and family planning can prevent as many as 1 in every 3 maternal deaths, and that the Canadian government should refrain from advancing the failed right-wing ideologies previously imposed by the George W. Bush administration in the United States, which made humanitarian assistance conditional upon a global gag rule that required all non-governmental organizations receiving federal funding to refrain from promoting medically sound family planning. Debate. The Honourable Member for Toronto Centre.
Thank you very much, Mr. Speaker. Mr. Speaker, the House is discussing today a question of considerable importance to Canada and indeed to the world. Members of all parties will know the frightening statistics which we've now become only too well aware, that every year 500,000 women die as a result of bearing children, either during childbirth or after childbirth, which in turn means in many cases, Mr. Speaker, that children die as well. The statistics are terrifying. As I've said, 500,000 women worldwide, 25,000 children a day are dying as a result of malnutrition, as a result of disease, as a result of not having enough support, not having enough care. And it's entirely appropriate that the Government of Canada, along with the other G8 countries and the G20 countries, should recommit itself to dealing with this problem and with this challenge. This question is one of the key goals that's set out by the United Nations in the Millennium Goals, which Canada has signed on to, which we've agreed to participate in and to support. It has the focus and support, I think, of all parties. And I think it would also be fair to say, Mr. Speaker, that one thing that we've all learned from the Olympics and the Paralympics is that we're proudest as a country when we're setting a standard for the rest of the world. There was no question during the Olympics and the Paralympics that's exactly what we did, and the sense of pride that we all shared as Canadians was shared because we were indeed setting such a standard. The trouble, Mr. Speaker, is in a sense it's the reason we're having this debate is because the government's own ambiguity on this issue has made it necessary for us in the official opposition, and I hope we're joined by all members of the House in expressing the common view of Canadians on this subject, is that the government's various pronouncements, non-announcements, disannouncements, various commentaries that have been made have left us with the impression that in adopting this important initiative at the G8, which is a continuation of the commitments that we made last year at the G8, not a new initiative, but a continuation of a commitment. The government itself has shown some considerable inconsistency, and this is an opportunity for the government to clear the air and to vote for the resolution, making it very clear that we're not going to allow ideology to trump science, We're not going to allow a narrow view of what the problem is to make it more difficult for Canada to be successful. And the reason that we mention the previous example of the Bush administration, Madam Speaker, is that the evidence is very clear that both with respect to the fight against AIDS and with respect to this question of maternal health in the United States in those Bush years, that's exactly what happened. Ideology trumped science, and we found example after example where in applying for NIH grants, for example, having to do with AIDS, scientists were discouraged from using the words gay, homosexual, condom, or prostitute. They were not supposed to mention these facts of life as being part of the reality of this horrible pandemic which has taken hold of the world over the last 30 years. Mr. Speaker, we don't want any such gag orders in Canada. We don't want any such ideology entering into the situation. We believe very strongly that we have to be clear about what the policies of Canada are, that we understand the world consensus which is developed, and it's very powerful and very clear. The consensus is absolutely crystal clear and is stated in all the international documents that says very clearly that family planning and effective family planning is going to, even by itself, reduce maternal deaths by as much as 30%. And it's important for us to be clear on that. And it's also important for us to understand that in so doing, Madam Speaker, we are going to be, in fact, advancing this cause and this issue very clearly. Madam Speaker, there are several ways in which this government, I think, has so far failed to clear the air successfully. The answers in the House over the last few days could be perhaps summed up with a modest adaptation of the phrase which was supposed to have been used by Mr. Mackenzie King when he said, conscription if necessary, but not necessarily conscription. That's now been replaced by this government with the phrase, contraception if necessary, but not necessarily contraception. And that isn't good enough, Madam Speaker. That isn't good enough for Canada. That isn't the standard which we expect to be applied. My colleagues here will all understand that in African countries, the public advertising on the subject of AIDS and on the subject of the impact of AIDS on the community is very direct and very blunt. There's no ambiguity about it. There's no reluctance to use the word condom. There's no reluctance to understand that it's only in making condoms widely available and there for everyone that, in fact, we will ensure that we will not be transmitting sexual diseases and we will not see young people and older people and family people and people of all backgrounds being affected by AIDS. In Africa, Madam Speaker, married women are the main victims of AIDS at the present time. And this issue cannot be separated out from the issue of maternal health. We can't pretend that it isn't part of a spectrum of issues that we have to be blunt and candid and direct in talking about and in dealing with. So that's the first contradiction, Madam Speaker. And the reason it's a contradiction is because the Conservative Party has decided that this issue is too tricky, it's too difficult for some of their own base to have to deal with. And so they are trying to send out code words and code language that will satisfy things. We've been told, we're reliably informed that in the Department of Foreign Affairs, you're not allowed to use the phrase international humanitarian law. The word equity is not supposed to be used or applied. Women were taken out as a target group with respect to the provision of Canadian aid by the Canadian International Development Agency, by CEDA. So we have a series of contradictions. We still have a party that can't quite come to terms with the full impact of death and destruction in the poorest countries, which can't really come to terms with why women are being being put in this position and in this situation, and the number of steps that have to be taken to ensure that women's lives are protected and children's lives are protected, and it's women and children first should be a code word for all of us as we look and try to understand how it is that poverty, ill health, poor nutrition all go together to create a circle, unfortunately and tragically, a circle of death. This is a challenge of our time, Madam Speaker. We talk often in this House as to what are the key issues of our time. I have no doubt this is an issue for our time. And to members in all parties, I say, it is not a question of Canada preaching to other countries. It is not a question of Canada telling other countries how to deal with problems. It is a question of Canada itself coming to terms with our own problems. We're now in a situation, Madam Speaker, where Cuba is more successful at dealing with maternal health than we are in Canada. Our statistics are worse than those in Cuba. Explain that. Explain how it would be that a country of our wealth, a country of our standard of living, would still have a situation where 5.2 women out of 100,000 are losing their lives when the lowest numbers are 1.5 and 2 in the developed world. Why is that? Well, we don't keep the statistics carefully enough, Madam Speaker, but we know that one of the reasons is because of the appalling conditions on our reserves in the north of this country. That the First Nations people are the third world in our own country. That the poverty and deprivation which can readily be seen simply by visiting reserves across the north of all of Ontario, all of Quebec, on va partout pour le voir.
And we can go everywhere to see it. Poverty is not something that exists only in Africa. Poverty is not something that exists only in Latin America. Poverty is not a problem that belongs to others. It's a Canadian problem. It's a Canadian challenge. It is a challenge that unfortunately we share because we have not managed to really address the issue of poverty. And poverty is what is responsible for the major issues and challenges of women, as we can see in our First Nations communities.
So that's the inconsistency that we see, and that's what we're trying to deal with. The second major inconsistency that I see, Madam Speaker, is the policy of CETA itself and the policy overall of the government. In the last 4 years, CETA has changed its policy of saying that women and children are the priority. Women and children are not the priority, and women and the equality for women and advancing the cause of women is no longer seen as a Canadian initiative of which the government wants to take charge and take responsibility. And if you don't face up to the fact that the promotion of the rights of women is what is going to improve maternal health, if you don't understand that connection, then you simply don't understand the issue. And to stand up and say, well, Canada is going to be launching this important initiative, but we're not going to talk about women, we're not going to talk about condoms, we're not going to talk about contraception, we're not going to talk about what really matters and how we're going to do this. Oh, and by the way, we're going to cut $200 million from the budgets of the poorest countries by Canadian transfers, and we're going to increase Canadian money that's going to the middle-income countries and higher-income countries, because that's the new CETA policy of the government, cut off those who are the poorest and pass on that money to other people. That's the inconsistency. That's where we see a government that, in fact, does not seem to even know its own mind and has not been clear enough with Canadians about what it is that needs to be done to address the issue. And I think, Madam Speaker, if I may say so, I think it's time for this House to be very clear that we understand the connection between things. You can't cut off money to Africa one week and then the next week say, and by the way, we're going to be launching a real strategy on maternal health. Il n'y a pas de sens dans ça.
There's no logic to that. You can't cut our investments to Africa, our humanitarian investments, our investments for the poorest. We cannot cut countries simply off from the CETA system from one day to the next, and then make an announcement in Davos. We'll start with something good for women, because we believe in women and children.
The government has been going around in circles on this issue for the last 2 weeks, almost in a state of embarrassment. And I'm beginning to understand, Madam Speaker, that the reason why they're flying around in circles as much as they are is that they have two right wings. And when you have two right wings, that's the only direction you can go, is around in circles. And the fact of the matter is that's why the balance has been lost. Are you there? Oh, God, I thought you were asleep. Oh, thank you. I was running awake. It's important, Madam Speaker, for us to focus on this question because it requires consistency. There is a transparency in the world which the government cannot avoid. Our fellow G8 countries know what the CETA budgets are. Our fellow G8 countries know what the policies of Canada and how the policies of Canada have turned. They know that women, the promotion of the rights of women, is no longer a priority for this particular Canadian government. They know what is inconsistent and what doesn't make sense in this regard. And so they know what Canada's own problems are. They know what's happening to our record. The question of how we're doing in the world tables with respect to infant mortality and to maternal mortality, these statistics are public. They're published. They're known. They know that we're falling behind in some critical areas. And so they know, Madam Speaker, that when the Prime Minister makes an announcement like the one he made in Davos, he is not being consistent with the foundations of what, in fact, his government and his party have been doing. And that's why it's so critically important for this House. If the government isn't going to be clear, and if the government isn't going to be transparent, it's so critically important for this House to state what the policies of the Government of Canada should be and how Canada should present itself to the world. Madam Speaker, I started my remarks by pointing out that we are indeed proudest as a country when we are setting a standard. We have to set a standard. And if we're going to set a standard, it has to be one that is clear. It has to be one in which we say with all humility, we've not been perfect. We have work to do. We have work to do as a country. We're not going into African villages and simply saying do it the way we do it. We understand that we've got work to do. We understand how these issues are connected. We understand that AIDS and maternal health and what's happening to kids and the overall level of poverty in a country, that these things are all connected. We understand that, and we also understand that we have to be consistent if we're going to set a standard. I think it's important for this House to take a stand, for this House to say very, very clearly, yes, half a million deaths among women every year is unacceptable. What should be, and what we all see and what we've all known in our own lives as a moment of extraordinary happiness, which is the arrival of a child, instead is a moment of tragedy. Instead is a cause of hardship. Children abandoned, and they in turn die in those circumstances. And yes, the House needs to take a position. And yes, the Prime Minister is right when he says Canada should do this. But I say to the Prime Minister and I say to my friends in the party opposite, be consistent, be true, speak proud, and be consistent in how we're going to take this issue on as Canadians. Because it is simply not good enough for Canada to say, here's our initiative, and then start getting all mumbly-mouthed and unsure and unclear about how it is we're going to achieve the great goals that we're setting for ourselves. Let's be proud as Canadians of setting this standard. Let's set it for ourselves, and then let's spend the money that we need to spend to make it consistent with what we're saying needs to be done. Let's work with other countries in candor and honesty and openness, and let's talk to the world directly about why this is such a critical question and why it requires a consistent approach. We need to be clear on the rights of women. We need to be advancing the cause of equality and what that means in the world. We need to be fighting discrimination against women. We need to be working hard to make sure that women have the same rights and the same responsibilities, not only in Canada but around the world. We need to be consistent and understand that this effort starts at home and starts in Canada. No child and no mother should be left in danger because of poverty, in danger because of their circumstance, and that is the case today, Madam Speaker, and it's something we need to deal with. We need to be consistent with our aid policy. We need to make sure that our aid policy is entirely consistent with what else we're saying with respect to maternal and child health. We can't be cutting the help for the poorest countries and then turning around and saying we're going to deal with it in this way. And we have to get away from this situation where ideology trumps science, where ideology trumps what's in place. One only has to look at the Texas textbook situation to understand that the conservative movement, which the Prime Minister has called his personal source of inspiration, is transforming much of education and much of science in America by its determination to make it respond to ideology and not respond to facts. I don't want to see that imported into Canada, Madam Speaker. I want to see us stand strong as Canadians for the values which we uphold, and then we can indeed be proud because we are indeed setting a standard for the rest of the world. Thank you, Madam Speaker.
Questions and comments? The Honourable Parliamentary Secretary to the Minister of National Defence.
Well, thank you very much, Madam Speaker. I did listen with interest to my honourable colleague, and he did raise some good points that all Canadians are concerned about, no matter which side of the House you're on, and that's maternal care, child care, and making that the best it can be. But I would offer a couple of comments and then one for him to respond to. And one, if he thinks we have difficulty flying with only right wings, it may be because he's got the corner on left wings marketed or cornered. The other one he talks about as being mumbly-mouthed on and being inconsistent. Madam Speaker, that's simply not true. In this case, it illustrates the difference between hearing and listening. They just don't want to listen, and that's politics, and we understand that. But I would offer a concrete example for my honourable colleague to perhaps comment on or not about the work that Canada has done around the world and the impact it has had, and very, very concretely, and that's in Afghanistan, where 5-6 years ago, less than 10% of Afghans had access to health care. Now, 80 to 85% have access to health care, and most of the ones that were missing that health care were women and children. And there's 40,000 Afghan babies who don't die in childbirth every year now because Canada and our allies, like the United States, are there. So I would offer those two examples to my honourable colleague to comment on or not, that we are, in fact, making a difference around the world.
The Honourable Member for Toronto Centre.
Well, I appreciate my friend from Edmonton making those comments, because I do think it's in fact that's a good example of where, when we put our minds to it and say yes, this is an issue, and frankly in Afghanistan we've also said women are an issue. We've also said women's rights are important. We've also talked about what needs to be done. Now, there are far too many, as my colleagues will know, and as the member opposite knows because of his many trips there, maternal mortality is still a significant issue in Afghanistan. The stats are still very, very high. But yes, it's true. We have made a difference, and frankly, if you look at the effort in Afghanistan, it's been a 10-year effort in which all parties have participated in talking about the aid element. I think all parties are agreed on the aid component of our work in Afghanistan. We might have other disagreements in the House. So that's a good example, Madam Speaker, of where in fact we can go. My problem is that approach is not consistent with what's happening in policy in Africa. On policy in Africa, we're seeing a complete change from the government, and that, I think, is troubling us a great deal.
The commentaire.
Questions and comments?
The Honourable Member for Vancouver Kingsway.
Thank you, Madam Speaker. Madam Speaker, last Thursday I had the opportunity to go to a breakfast in Vancouver sponsored by the West Coast Leaf Equality Breakfast, and is sponsored by a wonderful organization in Vancouver that focuses on women and the issues facing them. And they spoke about the continuing presence of inequality facing women, not only in Canada but around the world. And they spoke of the fact that every policy of government needs to be placed through a gender lens, because policies usually often have a different impact on women than on men. And they spoke directly about contraception, family planning, and reproductive health choices, and the direct connection that these issues have on the health of women and girls. And we were struck by, in listening to these women, the introduction of ideology in government decisions into these matters of basic health and basic equality. And I'm wondering if my honourable colleague could speak about what he's noticed in his career about, and with his government, about the introduction of ideology into questions of fundamentally sound policy choices and health issues.
The honourable member for Toronto Centre.
Well, Madam Speaker, I think one has to say International Planned Parenthood has received monies from the Government of Canada consistently since the early 1980s, including the Mulroney government. Never any question. Now it's an issue. They haven't been funded this year. First time they haven't been funded since the early 1980s. I don't think that's an accident. I don't think that's a happenstance. I think that's a fact that their efforts have been promoted and helped and assisted by CETA for 30 years, and suddenly their people are in the dark as to what's the source of funding going to be. Look, we all understand that these are not easy issues to talk your way through, and there are of course going to be differences between members on some of these questions. But we should be focusing on the things that we are clear about and we do know about, and about which we have reached a powerful consensus as a world on these questions. And we understand perfectly well that the reason that promoting women's equality promotes women's health. There's a direct connection and a direct link. And I would even argue, Madam Speaker, that the fact that there are not more women in this House of Commons is part of the reason why these debates are even taking place. And that, I think, is something we have to come to terms with as a country.
Questions and comments? The Honourable Parliamentary Secretary for the Minister of Heritage.
Thank you very much, Madam Speaker. I listened with great interest to the member's speech because I thought this is an incredibly ambiguous motion. He talked about government ambiguity, but I mean, we've been pretty clear that this is all about providing health care. It's about clean water. It's about providing basic nutrition. We doubled the aid to Africa since we've taken government. I know that's something our government's very proud of. Bob Geldof, the lead singer of U2, Bono, has specifically came out and heaped praise on this government for keeping our commitment to double the aid to Africa. I don't think we've been ambiguous at all, but this member sure has been. This is an incredibly ambiguous motion. I think it was written in a fairly, I don't think it's an upfront fashion. I don't know, maybe it was just hasty. But perhaps the member could do us all a favor and define what does family planning mean to the member. I'd like to know that.
The honourable member for Toronto Centre.
Well, I think family planning, Madam Speaker, means giving and providing women and men with information about reproductive health care. It means giving people access to contraception so that they can have access to an ability to plan their families and to deal with it in a way which they want. It means working with other governments and with host governments in a very direct way about the impact that a lack of family planning can have on people and the impact that it can have on family health. I don't think there's any ambiguity about it at all. And with respect to the question of Africa, the honourable member has to look at the budgets that the minister has tabled for this year. She has to look at the estimates that are there for this year. The estimates show a reduction of over 8%, for the poorest countries, and an increase of 11% for middle-income countries. That's what the government is doing. They're also reducing by 8% the CETA budgets for fragile states, and again increasing other transfers in other areas. They've moved their priorities away from women. They've moved their priorities away from maternal health at the same time as they're announcing that this is some kind of brand new Canadian initiative. It's a nonsense, Madam Speaker.
Questions and comments? A brief question. The honourable member for Esquimalt-Wanda-Fuca.
Thank you, Madam Speaker. I just want to ask my honourable colleague the following question. When it comes to being pro-life, isn't being pro-life enabling women and men to have a full access and array of family planning options? including the ability to access safe abortions in those countries where it's legal, the ability to access condoms, the ability to access the education and knowledge they need to protect themselves, because the failure to do that will only allow the 63,000 women who die every single year from septic abortions to continue. It will not enable us to deal with the HIV/AIDS pandemic that's killing over 2.2 million people a year and is leaving a sea of orphans. So does not my friend, in connection to the Conservative member's comments, does he not think that family planning is to allow women and men to have that full range of family planning options so they can save their lives and the lives of their children and their families?
The member for Toronto Centre has 1 minute to respond.
All I can say, Madam Speaker, is that I agree entirely with the comments of the honourable member, and I think that perhaps the debate will give us a chance to hear from him and from other members who have been so knowledgeable on this issue. I'd mentioned particularly my colleague from St. Paul's, with whom I've worked closely, my colleague from Esquimalt Wandafuka, and other members of the House who are very concerned about this issue and who have, I may say so, been very consistent in their advocacy. Thank you, Madam Speaker.
Resuming debate, the Honourable Minister for International Cooperation.
Thank you, Madam Speaker. And I will be splitting my time with the member for Edmonton Mills, Mill Woods, Beaumont. As the Minister for International Cooperation, I am proud that this government's initiative to champion a very important cause at Canada's G8 Summit. It's estimated that 500,000 women die each year from complications during pregnancy and childbirth. In the developing world, a woman dies in pregnancy or childbirth every minute of every day. What makes it worse is that of the bulk of the deaths during pregnancy, experts claim as many as 80% are easily preventable. The number of on-child mortality are equally concerning. According to UNICEF, the World Bank, and the World Health Organization, approximately 9 million children die each year before their 5th birthday. In developing countries, they are dying from illness and diseases such as diarrhea, pneumonia, and HIV/AIDS. And nearly 750,000 children under the age of 5 die of malaria, most of these deaths in Africa. This is simply unacceptable, especially considering that the solutions are relatively inexpensive. The cost of clean water, inoculations, and better nutrition, as well as the training of healthcare workers to care for women and deliver healthy babies, is within the reach of any country in the G8. Madam Speaker, this government understands the urgency on this issue. Over the past decade, we have seen the least progress made in improving maternal and child health, and in some developing countries, we see these mortality rates even increasing. As pointed out at the Canadian Conference on International Health last fall, a society has little chance to thrive if it fails to keep its mothers and babies healthy. For this reason, maternal and child health is one of the 3 key paths in CETA's priority of securing a future for children and youth. This means that starting with the mother and ensuring women are able to have a safe, healthy pregnancy so that they can take care of their children. Canada is already fulfilling these objectives in a number of ways. For starters, we recognize that our initiative is just one part of improving maternal and child health. The United Nations Population Fund estimates that fulfilling the unmet need for modern contraceptives could lead to 150,000 fewer maternal deaths and 640,000 fewer newborn deaths every year. For example, in Tanzania, CETA supports, in collaboration with the government of Tanzania and the Marie Stopes Tanzania. It has reached more than 400,000 Tanzanians in 6 project centers with services such as antenatal care, immunization, treatment of sexually transmitted infections, counseling, and maternal and child health care. Increasing access to health services is also a key programming area for CETA, supported in its international work. In addition, responding to the needs in developing countries, healthcare is integrated with other CETA-supported health-related activities. Madam Speaker, many experts in international reports, such as UNESCO, have reported the single most effective way to reduce maternal mortality is access to healthcare systems and trained healthcare providers. In Western Mali, CETA's support has helped to ensure that skilled healthcare workers attend almost half of all deliveries. And through CETA's support of the Society of Obstetricians and Gynecologists of Canada and its partners in Guatemala, approximately 733 health professionals have been trained to improve the health of mothers and newborns during childbirth. Madam Speaker, the other part, but equally important, of our maternal and child health path is to promote a healthy start for infants and young children so that they may later attend school and become active and contributing members in their communities. We are working to ensure children have access to proper nutrition, clean water, and medical services like immunization and neonatal care. We are helping to provide vitamin A, iodine, and other micronutrients, which play a crucial role in the health of young children and mothers. As a founding partner and principal donor of the Micronutrient Initiative, Canada is well known for its leadership on vitamin A and iodine. Indeed, UNICEF has said that Canada's support for iodized salt programs has saved 6 million children from mental impairment. Each year, waterborne diseases contribute to the death of over 10 million children under 5 years of age, particularly in Africa. That is why our government has invested approximately $208 million in the area of clean water supply and sanitation worldwide between 2006 and 2009, resulting in better access to clean water for hundreds of thousands of people. Canada is also saving children's lives through the Catalytic Initiative to save 1 million lives. In fact, CETA was the first to support this UNICEF initiative in the training and equipping of frontline health workers to deliver modern malaria treatments, bed nets, antibiotics for infections, and other key health services to children and vulnerable groups. Madam Speaker, the need is great, and we have an opportunity to make a real difference. This government has given long and careful thought to this. We have gone to great lengths to ensure that our efforts are guided by sound evidence, and CETA has already started work with our G8 partners in order to develop the most effective approach. I have personally met with a wide variety of experienced partners, stakeholders, and practitioners in the field of maternal and child health in developing countries, including organizations such as Care Canada, UNICEF Canada, World Vision Canada, Save the Children Canada, Results, and Plan International. I met with representatives of the Canadian Partnership for Maternal, Newborn, and Child Health. Their collective experience and knowledge represents potential and hope. Potential for Canadian leadership and meaningful action. In fact, the G8 countries, development organizations, and non-governmental organizations have all expressed their support for the Prime Minister's focus on maternal and child health for this year's G8 Summit. Over the next few months, we will continue to work in order to find the best approach. A development ministerial meeting will be held in Halifax on April 26th to 28th to further develop the initiative in preparation for the June Leadership Summit. Madam Speaker, we will be voting against the motion before the House. This motion is a transparent attempt to reopen the abortion debate that we have clearly said we have no intention to getting into. By voting against this motion, we are proving that we will not open the abortion debate. In addition, the motion contains a rash, extreme anti-American rhetoric that we cannot, as a matter of foreign policy, support. Improving the health of mothers and children under the age of 5 is important. It's urgently needed and not an option. It's an obligation. We owe it to our Canadians, and we owe it to the millions of women and children who need our help the most. Thank you, Madam Speaker.
Questions and comments? The honourable member for Esquimalt-Wanda-Fuca.
Thank you, Madam Speaker, and I thank the Minister for her comments, but let's get to the heart of the matter. This is about saving lives. Let's talk about some facts, Madam Speaker. The fact of the matter is that if you want to save babies, mothers, and men's lives, you've got to enable people not only to have access to, as the Minister correctly said, trained healthcare workers and health systems. But crucial to the ability of those workers to be able to do their job is for them to be able to have the tools. And one of the fundamental tools for saving women's lives is, in fact, their ability to access a fuller range of family planning, condoms, birth control, and access to safe abortions where it is legal. That, Madam Speaker, is the medical consensus amongst the Society of Obstetricians and Gynecologists, FIGO, the Partnership of Maternal and Child Health. This is a medical issue, Madam Speaker. Those are the medical facts. On the abortion issue, let's not reopen the door on abortion. Let's make sure we can honor what exists. Women in Canada have a right to abortions. Why not allow women in other countries to also have the same right? The absence of that was resulting in 63,000 women dying of septic abortions. Half of their children under the age of 5 will also die. Families are destroyed, Madam Speaker. Will the Minister do the right thing and allow women to have a full range of family planning options, including access to safe abortions where it is legal in those countries? Thank you.
Minister.
Madam Speaker, as clearly just demonstrated, here is again, as we said, a transparent attempt to open an abortion debate in this House. We've clearly stated from the beginning that we have no intention of opening the abortion debate. What we've said is that we are open to considering all options, including contraception, in order that we are going to be addressed. A measure, statistics, that, as I said in my presentation, are making very little progress, and in many countries, particularly in Africa, are increasing those mortality rates. We cannot stand by. We have to ensure that we're effective and we actually make some results in increasing the health of women and children.
Questions et commentaires? Questions and comments? Member for Vancouver Kingsway.
Thank you, Madam Speaker. Madam Speaker, according to the World Health Organization, quote, the first step for avoiding maternal deaths is to ensure that women have access to family planning and reproductive health choices. Family planning, they say, could prevent 25% of maternal and child deaths in the developing world by preventing risky births that are too close together, too early, or too late in a woman's life. And modern contraception helps fight the spread of HIV and AIDS by allowing HIV-positive women to space births for optimal health and access services to prevent mother-to-child transmission. And as my colleague just stated, my figures are an estimated 74,000 women around the world die as a result of unsafe abortions that could be prevented with contraception and access to safe abortion facilities. So I'll stay away from abortion for the moment, just talk about contraception. I'm glad that the government is talking about contraception now, but I'd like to know from the Minister why this government was reluctant to include the word contraception or that concept when it first announced this program. What was the problem with discussing contraception or making that a part of Canada's foreign policy?
The Honourable Minister.
Thank you, Madam Speaker. Let me just be very, very clear, and I appreciate that the member is demonstrating also that this is not the time or place to open up a debate on abortion. I want to also make sure that we have stipulated very clearly that we are open to all options, and is specifically clarified, including contraception. As the member knows, and as many of us know, there are many, many ways and many paths we can follow to improve the health of mothers and babies. Right. What our government has been committed to from day one is to make sure that its international assistance is effective, is going to get results, make a difference in those lives of women and children. And again, I refer you to the UNESCO report that states clearly the single most effective way to address maternal and child mortality is access to health care systems and trained professionals. That's consistent with our attempt to try and analyze and see how we can be effective, use taxpayers' dollars in a meaningful way, and get real results.
Well done. Resuming debate, the Honourable Parliamentary Secretary to the Minister of Industry.
Well, thank you, Madam Speaker, and it is my pleasure to address the House today and highlight Canada's G8 priorities with a particular focus on the flagship maternal and under-5 child health initiative promoted by our government. Under the theme of recovery and new beginnings, Canada is promoting a focused, results-driven agenda for the G8 that follows up on its past commitments and sets clear goals for G8 leadership going forward. We are focusing the G8 on areas where it can make the most difference, and we are putting a strong emphasis on accountability. Canada believes that holding the G8 accountable for results lies at the heart of the G8's credibility and effectiveness. For this reason, Canada is leading a 2010 initiative to report on the G8's achievements and commitments to date, the first in what will be an annual exercise. Madam Speaker, let me say a few words about our thematic priorities in 2010. With the emergence of the G20 as the premier forum for international economic coordination, the G8 will focus on areas where it has the greatest value added: international peace and security and development. These are central to the values and interests of the G8 members and are areas where the G8 can make a real difference. On international peace and security, the G8 summit will focus on critically important challenges such as addressing the proliferation of weapons of mass destruction and developing supportive ways to help vulnerable states and regions further build their capacities to address peace and security, to strengthen institutions, prevent conflict, and better mobilize civilian and military capacities. These are areas where the G8 and Canada have shown leadership in the past and where, under Canada's presidency, the G8 will show leadership in the future. Let me turn now to our core development priority for the G8. The developing world continues to face important challenges, which have only been exacerbated by the global economic crisis. From lack of adequate resources and services to tackling infectious diseases, the developing world continues to face a daunting array of challenges. The G8 can help the developing world meet these challenges. Indeed, the sustained leadership and commitment of the G8 to global health over the last several years have transformed the lives of millions of people in the developing world. Through substantial investments targeted where they can do the most good, impressive results have been achieved. For example, in the scale-up of HIV prevention and treatment programs, the significant reductions in child morbidity and mortality achieved through child immunization, micronutrients, and other interventions, including a major reduction in measles mortality and the rapid expansion of effective malaria interventions that has led to significant reductions in malaria cases. Increased access to diagnosis and treatment of tuberculosis, and substantial progress towards the eradication of polio. While considerable resources have been mobilized in recent years for combating infectious diseases, significant gaps remain for mothers' and children's health. The statistics are shocking. Each year, nearly 9 million children die before they turn 5, and 500,000 women die in pregnancy and childbirth. More than 1/3 of child deaths are attributable to undernutrition. Many of these deaths can be prevented with improved access to health care, better nutrition, and by scaling up proven interventions such as immunization. As I've noted, the G8 has made significant investments in addressing the health challenges experienced in developing countries, including supporting efforts such as the African Health Systems Initiative, the Global Fund for AIDS, Tuberculosis, and Malaria, and the Global Polio Eradication Initiative. While significant progress has been made on many health indicators, there is a pressing need for global action on maternal and child health. It is where the Millennium Development Goals 4 on child health and 5 on maternal health are the least likely to be met by 2015. The Millennium Development Goal 4 target on child health calls for a 2/3 reduction in the under 5 mortality rate by 2015. While there has been significant improvement in the rates of child mortality, it is uneven within and across countries, and overall gains are far too slow. As I mentioned a little while ago, nearly 9 million children in developing countries will still die each year before their 5th birthday, 37% of these in the first month of life. Little progress has been made in sub-Saharan Africa. Millions of these deaths are from preventable causes such as pneumonia, diarrhea, malaria, and undernutrition. The Millennium Development Goal 5 target aims at a 75% reduction in rates of maternal mortality and at universal access to reproductive health by 2015. The 500,000 women dying in pregnancy and childbirth annually is a figure that has hardly changed in 20 years, Madam Speaker. 99% of maternal deaths occur in developing countries. Half of all deaths occur in sub-Saharan Africa, 1/3 in Southern Asia. Complications from pregnancy and childbirth are the leading cause of death in young women aged 15 to 19 in developing countries. For every woman who dies, 20 to 30 suffer short or long-term illness or disability, such as severe anemia, damage to the reproductive organs, severe postpartum disability, chronic pain, or infertility. Yet research indicates that approximately 80% of maternal deaths are preventable if women have access to essential healthcare services through to delivery. In recent years, maternal and child health have been on the G8 agenda, including commitments to scale up maternal and newborn health efforts and to close the funding gap for maternal and child health. G8 commitments on strengthening health systems and increasing user access to health services also help make a substantial contribution to maternal and child health. The Muskoka Summit provides Canada with an opportunity to mobilize G8 members and assume a leadership role in setting the global agenda for improving maternal and child health. Canada is well positioned to respond to maternal and child health as a Muskoka priority. In fact, Canada has provided leadership in several health areas, including the areas of major diseases, for example, HIV and AIDS and polio, and nutrition, for another example, the Micronutrient Initiative, in addition to providing financial support through multilateral and bilateral programming. Maternal and child health also directly aligns with the Government of Canada's development priority of securing a future for children and youth, as articulated by the Minister of International Cooperation in May of 2009. There is also an interest in moving forward on nutrition, building upon last year's G8 food security announcement by targeting interventions to young children and mothers. By championing a major initiative to improve the health of women and children in the world's most vulnerable regions, we believe that G8 members can make a tangible difference. There is a strong interest amongst G8 countries and non-governmental organizations in addressing global maternal and child health issues in the coming year. Our G8 partners recognize that through concerted action, we can achieve demonstrable results for women and children around the world. That is why Canada's proposal to build international leadership and action on maternal and child health has been fully endorsed by our G8 partners, the United Nations, and the World Health Organization. Through outreach activities, Canada is also benefiting from strong support by private foundations, as well as domestic and international civil society organizations. Canada continues to be engaged in proactive outreach with key partners, exploring ways to mobilize and leverage financial contributions to improve maternal and child health. Proud of the strong endorsement we have received from partners and stakeholders alike on our choice of this signature initiative, we are continuing to work very closely with our G8 partners to come up with ways to best address maternal and child health. As you know, there is no cookie-cutter approach, and there are many ways and areas where we can work to improve maternal and child health. As mentioned by the Prime Minister on Thursday, March 18th, quote, "The government is looking to work with G8 countries to save lives, to save mothers and children throughout the world. We are not closing the door on any option, including contraception," unquote. But we are not reopening the abortion debate. Together, the G8 will forge a comprehensive approach to the issue of maternal and child health. Madam Speaker, to conclude, I would note that despite advances, the task of bringing greater health to all the world's people is far from done. Sustained political leadership and commitment are needed to maintain momentum in global health, and particularly on the areas where needs are the greatest. Canada is showing great leadership in mobilizing G8 governments, non-governmental organization, private foundations, and the private sector to participate in setting a global agenda for improving maternal and child health. Thank you, Madam Speaker.
Questions and comments? The Honourable Member for Esquimalt-Juan-de-Fuca.
Thank you very much, Madam Speaker. I want to ask my colleague, it's good that the government is actually pursuing reducing maternal and child health, but the path that they've taken is completely bizarre, illogical, and utterly unscientific. Health systems and trained workers are important, but they're only as good as the tools that they have in their hand. And what do they need? Yes, they need diagnostics. Yes, they need power. They need access to medications. And they need access to a full range of family planning options in their hands so they can treat the patients. Madam Speaker, I'm a physician. I've worked in Africa. I've delivered more than 200 babies in my life. Women we've had in our hospitals have died. Why on earth, Madam Speaker, is the government not giving these women, these men, and these children the option to life that we have in our country? One of the reasons we have reduced our maternal and childhood mortalities in Canada is that Canadian women and men have access to a full range of family planning options. That's the reason why this has occurred. And why do women need this? If you're too old, too young, if you have the babies too frequently, you run the risk of, as he said, 63,000 women a year dying. 20 times that number suffer life-altering injuries, including obstetric fistula. The only way that these people can deal with this is that they have in their hands the family planning tools that they need to save their lives. Will the government do the right thing and will they honor the commitments they made last year in Italy to allow that to happen?
The Parliamentary Secretary to the Minister of Industry.
Well, thank you, Madam Speaker, and I thank the honourable member for his question. And I would say that my family and I know firsthand the expertise of the Canadian medical community when it comes to mother's health and children's health. My wife, I have two kids, 14 and 10 now, but both of our kids were born by emergency C-section. In fact, 3 weeks after my 10-year-old daughter was born, my wife had complications, and I won't go into great detail, but had a life-saving emergency hysterectomy that did, in fact, save her life. I wouldn't have two kids, I wouldn't have a wife if it wasn't for the expertise in the Canadian medical community, and I really appreciate that. That said, Madam Speaker, what this is about is ensuring that other people around the world have access to very, very basic medical expertise, clean water, nutrition, inoculations, to save 9 million children's lives, to save 500,000 mothers' lives. And it's completely unacceptable that we can't come together on a motion that brings 100% of Canadians virtually together around an issue this important. Madam Speaker, thank you.
Comments, the Honourable Member for Elmwood-Transcona.
Well, thank you, Madam Speaker, and I want to thank the Parliamentary Secretary for his address to this Liberal motion today. Madam Speaker, while we in the NDP welcome this newfound interest in the health of mothers and children in the developing world, we'd also like to bring back the focus to the situation of women and children in Canada. Canada is among the wealthiest nations in the world, yet, Madam Speaker, 70% of Inuit preschool children live in homes where there's not enough food. There are many mothers in Canada who live in unsafe places, who are going without food, electricity, or heat because of persistent deep poverty. Now that the government is committed to catching up with other wealthy nations on maternal aid, will they commit to putting women and children first in Canada as well?
The Honourable Parliamentary Secretary.
Well, Madam Speaker, this government has taken many significant measures in the areas that the honourable member mentions. Of course, though, as I mentioned in my speech, 99% of the maternal deaths that occur in the developing world. Again, we're talking, let's just frame this issue and focus this issue. We're talking about 500,000 mothers who will lose their lives this year. 9 million children under the age of 5 who will lose their lives this year, again, for want of very basic needs, clean water, inoculations, basic medical services, and proper nutrition. Very, very basic needs. Some have indicated that the cost of this in some cases is pennies a day. And it is completely unacceptable that the G8 in the past, that countries in the past have not been able to come together to actually make a difference in this area. There's been a lot of talk, but what we're focused on this time around is actually coming forward with a motion, with a plan of action that's actually going to make a difference in these people's lives, Madam Speaker. And I think that's what's critical as we have this debate today. Critical to maintain our focus on those 500,000 mothers, those 9 million children who will lose their lives in this next year if we don't act.
Reprise du débat.
Resuming debate, the honourable member for Laurentide-Labelle. Thank you very much, Madam Speaker. Madam Speaker, on March the 8th, it was International Women's Day, and that was an opportunity to call for equality, to take stock of situations, and to examine the condition of women in society. It was also an opportunity to reiterate the importance of protecting the gains that have been made by women. Well, there is a battle today that is still being fought, and it is the one we are fighting today in the House. It's unthinkable to think that in 2010 there are some hundreds of thousands of young women who are deprived of adequate health care that would allow them to experience the joy that's involved in what is probably the most formidable moment of their lives, that is to deliver a child. In 2000, the directors of the world, the whole world, committed to making maternal health one of the 8 Millennium Development Goals. But unfortunately, in 2010, the objective, that is, of 75% improvement by 2015, is still very far from being reached. According to the 2009 United Nations report on the Millennium Objectives, each year 536,000 young women and women die because of the complications of pregnancy, of giving birth, or during the first 6 weeks following birth, following delivery. The grand majority of these maternal deaths are avoidable. According to Anne Veneman, the DG of the UNICEF Fund for Children, 80% of these deaths could be avoided if women had decent health care. It is on this positive note that the Bloc Québécois will support the motion put forward by the Liberal Party. The Bloc Québécois will support any initiative that will counter efficiently problems like this, just like the Bloc would denounce and fight any initiative that would imperil the health of women and children. The Bloc is in favor of an initiative in the area of maternal health and child health, which would include family planning as well as sexual and reproductive health, including contraception. We support the motion because we are very concerned about the ideological drift that is apparent with the Conservatives in the area of women's rights. And we deplore once again the fact that the House has had to deal with retrograde policies put forward by this insensitive government. For the Bloc Québécois, all women from all origins and all social conditions are entitled to a full range of health care. All services that are connected to it and interrelated to health care. In addition, the factors responsible for death, for maternal death and the consequences that follow on pregnancy or delivery vary from one region to another in the world. But there is a great need for a continuum of health care that would cover all these areas, access to health personnel that is trained and qualified, access to adequate health establishments, access to contraception, medication and emergency care, qualified care during pregnancy and delivery, and ad hoc services after abortion, as well as the possibility to have an abortion in conditions that are safe, where it is authorized by law. Given these services, the international community should supply the tools necessary to peoples that need them to reduce the rate of maternal death. More than 80% of these deaths in the world are directly linked to 5 major causes: hemorrhage, infection, abortion in dangerous conditions,
difficult labor and conditions like preeclampsia. We have seen last week that there are many contradictions with respect to the Conservative government as to a strategy on maternal health. The Minister of Foreign Affairs stated to the members of a committee that his party's policy has nothing to do with respect to family planning. 2 days after the statement, the Prime Minister and the Minister of International Cooperation said just the opposite. The Prime Minister stated that contraception was part of a scenario, was going to be part of a scenario, but there was not going to be a debate here or elsewhere on abortion. It's not a matter of reopening the debate on abortion, Madam Speaker. In Quebec and in Canada, people have achieved legislation which authorizes all women to interrupt a pregnancy. It is an acquisition that is extremely important for women, and it will never be reviewed except by a very right-wing government. Thus, it's very logical that Quebecers and Canadian women support any measure to help women in developing countries. Contradiction, ambiguity, confusion, that's the cocktail that the Conservative government has been serving us since they came to power. The members, civil society, and the people in general are totally confused. The government opens the doors, but it doesn't make any type of firm commitment. All we get is ambiguity. Canada will be hosting the G8 in June 2010. The Prime Minister, the Conservative Prime Minister, would like to establish a priority for maternal health and health for children, and child health rather. This is an initiative that is praiseworthy, but it must be based on a continuum of services. The Prime Minister should benefit from his position as host to rally the other countries around a program for maternal health that would have an immediate impact on access, for example, to drinkable water, vaccination, nutrition, training of workers. We have to be able to do this. The Bloc Québécois is very concerned about the Conservatives' intentions when we have learned that family planning, contraception, and abortion would be taken out of the strategies used to fight child and maternal mortality rates. The government can't go back on the commitments that were made in the past. In Italy, at the G8 in 2009, the member countries, including Canada, committed to speeding up the progress in this whole area. That included voluntary family planning. If you want to be able to effectively combat this type of problem, we in the Bloc Québécois are somewhat, indeed very skeptical about the real will of the Conservatives to effect these changes. Madam Speaker, civil society in Canada has favorably supported the government's statement that it was going to make maternal and child health a priority in coming summits. Given the G8 and the G20 that approach, Canadian NGOs have made a series of demands with respect to the subjects that will be dealt with the member countries. In its program, civil society in Canada is explicitly including maternal and child health. Is the Conservative government ready, finally, to set aside its ideology and finally agree to meet with and listen to organizations from civil society that have worked in this area, that have the expertise and care for women and children's health? In addition to the meetings of the G8 and G20 in June, the world leaders will also be meeting at the United Nations in September 2010 to look at the record of progress that has been achieved under the Millennium Development Objectives. The Bloc Québécois feels that development aid should be based around certain principles, general principles and objectives, but defined principles. The international community agreed to 8 goals to reduce the extreme poverty and hunger that exists, to ensure primary education for everyone, promote equality and self-determination for women, reduce child death, improve maternal health, combat AIDS and other diseases, ensure a sustainable environment, and have a world partnership for development. As you can see, there is work to be done. When Canada adheres to its goals, it also implicitly is embracing the fight against child and maternal mortality. What we want to have is a strategy that is efficient and effective, that will have a direct effect on all other goals.
So, in order to implement those objectives, the UN called on member nations to set their development aid at 0.7% of GDP by 2015. However, in the 2010 conservative budget, the government announced that it would limit development budgets to $5 billion a year. According to budget forecasts, the ratio for 2010-2011 would be 0.29%. This represents an assistance envelope of $5 billion. In comparison, an additional amount of $7.2 billion would be needed to reach the 0.7% target. As well as the 2015 deadline comes closer, we are forced to admit that the inaction of successive federal governments makes it difficult for Canada to be able to respect this goal of 0.7% of GDP, which is the means that the international community had agreed on in order to reach the Millennium Goals. The government is fulfilling its promise of doubling international aid in 2010-2011 compared to the 2001-2002 levels, but this does not mean, however, that it has reached its goal of 0.7% of GDP. This year, it's 0.29% of GDP that will go to international aid, 0.29%. At the very least, we can say that the government is not even close. And so we have questions. We would question the government's will to deal effectively with infant and maternal mortality. The government has said in its budget that it would make maternal and infant health a priority at the G8 and G20 summits. What credibility will Canada have in convincing the G8 and G20 countries to make maternal and infant health a priority when Canada itself is not investing the funding needed to ensure that it can meet the Millennium Goals, which includes maternal and infant health? Is the Canadian government aware that a number of G8 heads are already asking for much greater openness than Canada with regard to the issue of maternal health? Among other things, as soon as he came into power, American President Barack Obama repealed the Mexico policy established in 1984 by President Reagan, which prohibited the U.S. International Development Agency from granting funding to organizations that included termination of a pregnancy among family planning measures. It believed that the excessive conditions imposed upon donations and aid were not justified and impeded efforts to promote effective family planning measures. The American Congress recently allocated $648 million in aid to family planning programs around the world, as well as for reproductive health. The United States have also launched a new program that will be the masterpiece of their foreign policy, global initiative on health, and is committed to investing $63 billion over the next 6 years, a large part of which will be invested to reduce maternal mortality and avoid unwanted pregnancies. British Prime Minister Gordon Brown hosted the event Healthy Women, Healthy Children, Investing in Our Common Future, an event that was held at the UN on September 23rd, 2009, and that led to the consensus on the health for mothers, newborns, and children. Maternal health is a matter of human rights, as recommended by Amnesty International Canada. Canada must present an approach based on human rights that will address ways to reduce maternal mortality throughout the world. This approach, according to Amnesty International, should include the following: fighting discrimination, injustice, and violence, all of which women and children face throughout the world. Actions to eliminate traditional practices such as female genital mutilation, early or forced marriages, which reinforce the subordination of women. Guaranteeing access to birth planning, contraception, information on reproductive and sexual rights, and information on health. Eliminating financial barriers as well as other obstacles to access to quality maternal health care, and as well as access to sexual and reproductive health care services, including emergency obstetric care, equitable distribution of health care facilities, products, and services, as well as parity access to essential health care for women and girls who are marginalized. Family planning and the use of contraception are part of the fight against infant and maternal mortality in developing countries. On July 11, 2008, during the World Population Day, Secretary General of the UN, Ban Ki-moon, said that family planning was an essential element of reproductive health care because it had allowed women to space out their pregnancies. We cannot separate family planning, contraception, and abortion from the issue of maternal and infant health. In this regard, the UN Secretary General was clear. Political leaders throughout the entire world have said that it is the fundamental right of every individual to decide freely and responsibly the number of children they want, as well as when those pregnancies and births should take place. Goal number 5 of the Millennium Objectives was to improve maternal health, and this affirms that right. By responding to the needs of developing countries with regard to contraception would help to avoid millions of unwanted pregnancies and therefore save human lives, both those of the mothers and the children. According to the UN Population Fund, an estimated 215 million women want to avoid pregnancy but are not practicing effective contraception. Furthermore, each year, 19 million abortions take place in dangerous conditions in developing countries, and this leads to 68,000 deaths. Many of those deaths could be avoided if information on family planning and contraception were available and applied. The needs in terms of contraception are high. In 9 sub-Saharan African countries, more than 30% of married women need but do not have access to contraception. If those needs are not met, it is clearly not because the women are not asking for it, but rather it's the fact that the majority of them would like to have the means to ensure family planning. In fact, approximately 200 million women want to delay their next pregnancy, but 137 million women are not using any contraception whatsoever, and 64 million are using traditional but less effective methods. As a result, more than 63 million women become pregnant every year without wanting to become pregnant. Furthermore, in addition to assuring access to family planning, you're telling me that I just have 1 minute left? My goodness, the time goes by so quickly. So by ensuring access to family planning without obligation to women in developing countries, it is estimated that we could reduce maternal mortality by a third and infant mortality by 20%. Madam Speaker, in Quebec and in Canada, the majority of women have access to the appropriate medical care, including contraception and abortion, so it's rare to see a woman die during her pregnancy or childbirth. But we have to recognize that in developing countries, these means can mean the difference between life and death for thousands of women and children. The Conservatives must recognize this and put those methods into their strategy. We must not remain blind to what is happening to the poorest women and children in the world. Questions and comments?
The Honourable Member for Vancouver Kingsway.
Thank you, Madam Speaker. Madam Speaker, of course, when we talk about foreign aid and development, words are cheap, but what really matters is whether governments put the resources, financial and otherwise, behind it. We know when it was in power, the former Liberal government promised their famous target of contributing 0.7% of GNP to international aid, but of course never met that. Canada today contributes less than half the 0.7% of the gross national income that we and other rich nations have pledged to developing countries 40 years ago. And of course the 2010 budget announced just a while back contains a freeze on foreign aid levels, and officials have said that this maternal health program announced by this government will have to come out of existing budget funds. So my question to my honourable colleague is, I'd like her to comment on whether or not she thinks Canada is actually fulfilling its pledge and its promise internationally by promising these programs but never developing or delivering the money and resources needed to carry out its lofty goals.
The Honourable Member for Laurentides-Labelle. I want to thank my colleague for that question, and in fact in the question there was practically the answer. There is a kind of incomprehension with regard to what the government is announcing and in its actions. We have seen that the government is prepared to freeze its funding as of next year, or to maintain it at $5.1 billion. However, you know that in order to reduce the debt, it will do it on the backs of the most vulnerable members of society. So when we're saying that the donor countries have to invest more, and Canada made commitments again last year in Italy, how can we imagine that the government is going to be able to deliver the goods when we see that funding is cut, frozen, slashed, cut within programs and services in terms of what Canadians and Quebecers had access to and no longer do? And so obviously we can wonder then how Canada, which will be the host country of the G8 and the G20 in June, will be able to be credible and to be able to have or play a leadership role in this area. We have a lot of questions in this regard. Questions and comments? The Honourable Member for Laval. Thank you, Madam Speaker. Madam Speaker, I listened very closely to the very eloquent speech given my colleague from Laurentides-Labelle, and I would like to ask her how or what she thinks about the fact that the government over the last 4 or 5 years has cut by 90% amounts allocated to the Canadian Sexual Health Foundation, which was directly tied to the International Family Planning Foundation. So with regard to the speech that was given, and given the quick turnaround of the government this week concerning contraception, when we know that barely a week ago the government denied the using of contraception, and often people think that Quebecers and Canadians are naive, and they want to make them understand now that the contraception will be a part of this strategy. What do you think of this, Madam Speaker, the Honourable Member for Laurentides-Labelle? I want to thank my honourable colleague for her remarks. and for her question. Obviously, since the Conservatives came to power, we are no longer surprised to see that in each throne speech or in each budget tabled, there is a hidden agenda. And once again, despite the fact that the government has made a commitment to make during the next G8 summit maternal and infant health, well, what are we discovering behind the commitment, Madam Speaker? Well, once again, lobbyists against abortion, lobbyists against contraception are pressuring the Conservative government. And they are saying one thing, but their friends, the lobbyists, are still not seeing a change. Questions and comments?
The Honourable Member for Winnipeg Centre.
Thank you, Mr. Speaker. I appreciate the presentation from the member opposite, and thank you, Madam Speaker. And I appreciate the eloquent speech from the member opposite. I too agree that we as a country should achieve 7.7% of GDP. I just want to perhaps get her to expand one part of her speech where she referred to pregnancy interruption legislation that existed or was passed in Canada. If she could perhaps just give some examples of that, I would appreciate that. Thank you.
The Honourable Member for Laurentides-Labelle. Well, I'd like to be able to answer my colleague, Madam Speaker, but obviously I have some difficulty understanding the essence of the question. He said that his government will reach the Millennium Goals of 0.7% at some point, and I don't know where that's written, but the figures are clear and quite conclusive that we are far behind. We're far from reaching those objectives, and we are in no way expecting to be able to reach that goal by 2015. I do not understand how they want to ensure that infant and maternal health is a priority if ultimately the services and tools are not provided to women in order to prevent pregnancies because their health status does not allow them to be pregnant, or to allow young girls aged 12 and 13 in countries in conflict who have been raped being allowed to have an abortion in safe conditions. If these young girls have children, then there are two victims, a child who will no doubt live in poverty, and the woman. So I think that in order to help women, we have to start at that point when they can decide by having the tools at their disposal, contraception, assistance, trained staff, and assistance for those women, and so that the women themselves be allowed to choose. Questions and comments? The Honourable Member for Burnaby New Westminster. Thank you very much, Madam Speaker. And I really liked the speech given by the member for Laurentides-Labelle. We know full well, Madam Speaker, that today, in just a 24-hour period, there are 30,000 children around the world who will die because of famine and lack of healthcare services. We also know, Madam Speaker, that we will lose pregnant women. Approximately 1,400 will die in that 24-hour period. So obviously there is a crisis, and it is important for Canada to respond to those crises that exist. There are people dying every 24 hours, Madam Speaker, and what is happening around the world is terrible, but we have a government that seems to want to play politics on this issue. by including their ideology in this crisis situation. So I would like to ask the member who gave a wonderful speech earlier, why does she believe that the government is responding to these crises with this kind of ideology? The honourable member for Laurentides-Labelle has a little less than 1 minute in which to respond. It's clear, my dear colleague and friend, that the conservative ideology is out of date and very right-wing, which puts women back 100 years or so. And we see it in everything that they're putting forward. We see this ideology everywhere, and they're against abortion. They're against same-sex marriages. They are under the influence of very religious right-wing groups. And this is seen in everything they put forward in all their programs. They ensure that this ideology is present in everything. Yes, Madam Speaker, you are telling me that my time is up. Yes, resuming debate.
The honourable member for London Fanshawe.
Well, thank you, Madam Speaker, and I welcome this opportunity to participate in the debate regarding the Liberal opposition motion. I'll be sharing my time with the member for Ottawa Centre. I believe it's essential to clarify what's happened both outside and inside this House over the past few weeks. I think a good starting point would be the declaration by the Prime Minister in regard to the agenda of the upcoming G8 and G20 meetings that will be hosted by Canada. On or about January 26, 2010, the Prime Minister told the world that the lack of the most basic services can lead to dire consequences, especially for the world's most vulnerable populations. Each year, it's estimated that 500,000 women lose their lives during pregnancy or childbirth. Further, an astonishing 9 million children die before their 5th birthday. The United Nations had hoped to reduce the number of deaths related to pregnancy by 75% by 2015 as part of its Millennium Development Goals. It now appears this target will go unfulfilled. What makes it worse is that the bulk of the deaths during pregnancy are easily preventable. There's a pressing need for global action on maternal and child health. The Prime Minister went on to say the solutions are not intrinsically expensive. Madam Speaker, a laudable statement. And as the Prime Minister said, the solutions are not intrinsically expensive. The problem is that the Prime Minister left out one of the key actions if we're to make a difference in the lives of women and their children. He omitted any reference to contraception. We might have been willing to believe that this was a mere oversight, except there is much evidence to the contrary. Government ministers made it abundantly clear that the omission of contraception was a deliberate policy decision based on an ideological agenda. Hansard and a variety of media reports provide some assistance in this regard. On March 18th, my leader, the member for Toronto Danforth, asked the Prime Minister if the Conservatives were indeed excluding contraception from their plan to improve maternal health throughout the world. The Minister of International Cooperation responded, but did not answer his question. She evaded him by talking about plans to provide clean water, vaccinations, better nutrition, training for healthcare professionals. The minister was much more direct the month before when she told the media that Canada's focus on maternal and child health will not address unsafe abortions in developing countries or support access to family planning and contraception. The Minister of Foreign Affairs was equally blunt in his statement that family planning would not be included in the G8 maternal child health initiative. Since that time, the Prime Minister and his ministers have fallen over each other like Keystone Cops in their efforts to backtrack or save face. The question is, why on earth would the Prime Minister and members of his government make such shamefully ill-informed statements in the first place, unless, of course, they were playing to their socially conservative base? What is more troubling is that they're supposed to lead. They're supposed to use the best evidence they can find to make intelligent, reliable decisions for Canada. They are not, Madam Speaker, entitled to make ideological, irrational decisions that can only be categorized as completely devoid of any real concern for women and their children. They played the game of seeming to care about these people. The reality is, and this was stated by Dana Vodig of Marie Stopes International, an internationally recognized reproductive health care organization, they were only able to demonstrate a new low for political pandering to social conservatism. Ms. Hovig went on to say there's no question that family planning saves lives by preventing unwanted pregnancies, including those who would otherwise lead to complications and death or injury of the mother or child. The World Health Organization has been equally clear about the need for contraception if maternal and child health is to be addressed seriously and effectively. Every day, 1,500 women die from pregnancy or childbirth-related complications. In 2005, there was an estimated 536,000 maternal deaths worldwide. Most of these deaths occurred in developing countries, and most were avoidable. Improving maternal health is one of the 8 Millennium Development Goals adopted by the international community at the United Nations Millennium Summit in 2000. Goal 5 commits countries to reducing maternal mortality. Madam Speaker, we have a long way to go to achieve the objective of reduced mortality, and the conduct of this Prime Minister and his ministers undermines the role Canada has to play to achieve this reduction. The WHO is very clear about what is needed. The first step for avoiding maternal deaths is to ensure that women have access to family planning. This will reduce unwanted pregnancies because women in developing countries have many pregnancies on average in their lifetime, and they're very often at risk. The Planned Parenthood Federation is equally clear on the subject. Planned Parenthood, another international organization that provides education and services in particular to the poor, the underserved, and marginalized in parts of the world where public and private healthcare facilities do not exist, has a mandate to work at the community level with local leaders to overcome barriers based on misinformation, prejudice, and gender discrimination. Madam Speaker, the research and expertise of Planned Parenthood and the United Nations tells us, and I'm sure would have told the Prime Minister had he done his homework, that despite significant progress over the last 3 decades, access to sexual and reproductive health services and information remains beyond the reach of much of the world's population. 120 to 150 million women worldwide want to limit or space their pregnancies, but are still without the means to do so. Allowing a reasonable space between pregnancies allows women the chance to regain their health, look after their children, and decreases the chance of maternal mortality and child death. Most children who perish before age 5 die because they've lost their mothers. Tragic numbers of women continue to die or suffer lifelong injuries because they lack access to sexual and reproductive health information, education, and services. And young people face the barriers of cost, stigma, and fear of going to a clinic. The lack of information limits young people's awareness of the issues of sex and sexuality. High rates of unwanted pregnancy and sexually transmitted infections are powerful evidence that more programs are required to meet their needs. The goal of Canada's G8, G20 agenda should be to ensure that all people, particularly those who are young, poor, marginalized, underserved, or victims of gender discrimination, have the opportunity to exercise their rights and to make free and informed choices about their sexual and reproductive health. This concern for sexual and reproductive health brings me to the issue of HIV/AIDS. As you know, Madam Speaker, the scourge of AIDS is destroying the very fabric of many African communities. The best defense against the transmission of HIV is the condom. And yet, when the member for Toronto Danforth questioned the Minister of International Cooperation about providing condoms to African men and women, she was utterly silent. Madam Speaker, the government should know the importance of condom use to the effective prevention of sexually transmitted diseases like AIDS. This House has many times paid tribute to the grandmothers who are raising orphans of their own dead children. They are the multitude of African grandmothers looking after their orphan grandchildren with little money, little food, and little help. Some 14 million children have been orphaned by AIDS in Africa, and the number continues to rise. To put that into perspective, that's more than all the children in Canada, Ireland, Sweden, Norway, and Denmark combined. It's estimated that in the next few years there could be as many as 40 million orphans from 19 African countries. These children suffer the privation of trying to manage in poverty, and their grandmothers are the overlooked members of society, and the unrecognized heroes. Canadian Stephen Lewis, the United Nations Special Envoy for HIV/AIDS in Africa, describes these grandmothers as the silent victims of the disease. Stephen begins his book, Race Against Time, with the words, "I have spent the last 4 years watching people die. Nothing in my adult life prepared me for the carnage of HIV/AIDS. He goes on to say, "Every time I go back to Africa, I visit the huts where women are dying in the presence of their children. What the Western world has failed to do is to respond to a human apocalypse. There is no way of describing it other than in those words. The grandmothers, who Lewis says are so impoverished and so frantic for support that they are emotionally decimated, often bury their sons and daughters and become mothers again to the children left behind, many of whom who also suffer AIDS." Madam Speaker, as I said, I am indeed glad to participate in this debate. It puts into clear and jarring focus the need for veracity and humanity from this government. In the wake of all this suffering, we as a nation of compassionate people must show leadership and humanity. I just wish I could trust this government to provide the direction that such humanity demands and needs to take.
Questions and comments? The Honourable Member for Vancouver Kingsway.
Thank you, Madam Speaker, and I'd like to congratulate the Honourable colleague from London Fanshawe and thank her on behalf of all Canadians, particularly women, for the wonderful work that she does on behalf of the women of this country and, in fact, around the world. Madam Speaker, while we in the NDP, of course, welcome this interest, however newfound it may be, in the health of mothers and children in the developing world by this government, we'd also like to bring the focus back to the situation of women and children in this country. Being one of the wealthiest nations of the world, it is shocking that 70% of Inuit children preschool age live in homes where there's not always enough food. There are many mothers and children who live in this country who live in unsafe places, who are going without food, who don't have electricity or heat because of persistent, deep poverty. Now that the government is committed to catching up with other wealthy nations on maternal health aid in foreign countries, I'm wondering if my honourable colleague will comment on what she feels is needed in this country to help put women and children first in Canada as well.
The Honourable Member for London Fanshawe.
Well, thank you, Madam Speaker, and I thank my colleague for his question. And there is absolutely no doubt that while this government talks a game about maternal and child health in the third world and developing nations, they're quite prepared to undermine anything in terms of the aspirations of the women of this country to live in a healthy manner and provide for their children. And we've seen it over the last 4 years. In fact, we've seen it over the last 15 years from this government and the previous government. Cuts to the services for women, cuts to Status of Women Canada, cuts to the organizations who advocate and do the research that tell us that women in this country have not achieved equality. And I'm thinking about the fact that there is no affordable housing in this country for the women who are desperately trying to leave abusive situations. There is no regulated childcare for all of the women who would desperately like to get back into the workforce so that they can look after their families, so that they can provide for their children. This government has turned its back on the women of Canada, has tried to pretend that it's interested in the women of the world, but we know better. We know differently. I say it's time for women and children first in every country, in every nation, and that includes Canada.
The comments of the Honourable Member for Sault Ste. Marie.
Well, thank you very much, and I also want to thank the member for her comments here this morning on this important initiative. If the government truly indeed does follow through and do the kinds of things that we all know in this place needs to be done, both in other countries and at home. It's always telling to me in trying to figure out whether somebody is sincere in their commitment to doing something when you look back at their track record. And the member from London Fanshawe will remember when we were government in Ontario together in the early 1900s, the kinds of things that we did to improve the lot of children and women and families in those very difficult recessionary times. However, subsequent to that, and this is what gives me concern here and why I asked the question of her this morning in light of the motion that's in front of us, following our time in government, we had then a Conservative government come to power in Ontario, and one of the first things they did was cut welfare by 21.6%. Matter of fact, it was the first thing they did in order to send a message to anybody else in that province who might challenge the government in terms of their agenda where the at-risk and marginalized are concerned. And with that, and shortly following that, they cut many programs that were targeted at poor women. One of them was a nutrition program that would give pregnant women money, little extra money to buy milk so that they might have a healthy child. I'm just wondering if she remembers that, and if she might want to comment on that. But they cut that program.
Well, member for London Fanshawe has less than a minute to respond.
Thank you, Madam Speaker, and I thank my colleague for the question. I do indeed remember those cuts. I remember being on the street because they were such desperate and cruel cuts. And when he speaks of cutting nutrition programs for pregnant women, the excuse of the day from the premier of the day, such as he was that he was depriving these women of beer. They'd only go out and spend it on beer. I think that it's very clear that the attitude towards the people in this country who are struggling is one of derision. From this government, from previous Conservative provincial governments, people need support and help. They need understanding. They need to be able to help their kids. They don't need the backhand of this bunch.
Reprise du débat. Resuming debate, the honourable member for Ottawa Centre. Thank you, Madam Speaker. Here are a few statistics with respect to maternal health that are very important. Every year, over 500,000 women die from pregnancy-related complications, and 9 children die under the age of 5. According to the World Health Organization, access to family planning services and abortion that is safe is the first step toward reducing the rate of maternal deaths. Modern contraceptive methods help fight HIV/AIDS and the spread of that virus by enabling HIV-positive women to space out births in order to recover more fully from childbirth and have access to health services to prevent the transmission of the virus from mother to child. In countries with comparable levels of economic development, maternal mortality is inversely proportional to the status of women. What we want is for the Maternal Health Initiative to include a full range of family planning options. The government must make a firm commitment with respect to funding, the content, and the duration of the project. The Prime Minister is coming late to this debate. Other countries have been involved in the maternal health sector for years and have shown leadership in the area of funding. We just have to look at the history. The Prime Minister, though, is still in catch-up mode. I have a question for this government. The Conservatives have very little credibility concerning issues of women in developing countries. This government, after all, banished from its vocabulary terms such as gender equality, gender-based violence, impunity, and justice with respect to trying to end sexual violence in Democratic Republic of Congo. But maternal health issues are a huge problem because women cannot decide when and with whom they will have a pregnancy or how many children they want or how to space them.
Of the indicators of maternal health, right across the board, they prove where countries have invested and ensured that the investments are adopted by the needs of the countries that you're trying to help, they're successful. What is not successful is trying to tell those countries, those communities, those people who you're trying to help when it comes to maternal health, how to do it. I hope, and I sincerely hope, Madam Speaker, that we have got past this kind of social conservative ideology when it comes to maternal health, when it comes to development in general terms, that we saw with previous administrations, both here in Canada and elsewhere. What we need to see is not only the commitment in words, but the commitment in deeds and understanding. If you take a look at where other countries have made commitments to the Millennium Goals and said not only would they support them in words, but in actions, they've seen tremendous success in the projects they've invested in when it comes to maternal health. Just take a look at, over the past 3 years, other countries that have been deeply involved in the issue of maternal health. Last year alone, other countries pledged $5 billion to a new global consensus for maternal health, newborn and child health. In 2007, Norway and Holland pledged $1.2 billion over 10 years for maternal and child health. When I said just earlier, we're coming to this conversation late, I think it bears the statistics that I just read into the record would show that. We have other countries who have not only said they're interested in this, but they've actually said, here's the money down on the table to invest. So what we need to see is not just, someone who's come late to a debate and understanding of an issue. And we welcome that. Make no mistake. We welcome, we embrace that this government wants to deal with maternal health. But you need to understand the issue profoundly. You can't just come to the table and say, we want to do something, and walk away without putting money on the table, and with what some have concerns about, and I share, with some idea that there's going to be tags on dollars that are sent to help with maternal health. If that's the case, if that's what we're looking at, that's not going to help women who need it the most right now. That's just an ideological game that is being played by this government. So what we would hope from this government is that I'd actually support this motion, that they would say, we want to embrace maternal health. We want to ensure that the statistics that we see repeat themselves year after year, that women are the ones who suffer the most. Why? Because they're the ones on the front lines when it comes to third world economies. In fact, I referenced the Democratic Republic of Congo. Right now, Madam Speaker, there is a war going on. It's a gender war. And the ones who are on the front lines aren't soldiers. They're women. Rape is used as a weapon of war right now in the DRC. It's happening in other locations. These women are having to raise children whilst they're being subjected to rape, to intimidate communities, to move them out from where they live so that mining companies can go in and get their coltan and other minerals that end up fueling the conflict. If we don't understand the role of women and gender, and I'm not talking about, let's just give them some clean water and things will be fine. I'm talking about centering women in the decision-making. Then we will have abandoned women, as I said, who are on the front lines of conflict in the third world, who are on the front lines of making sure that kids have enough, who have always been on the front line throughout history to ensure that our species actually exists. Then we will have just given lip service to an issue that is so profound. Madam Speaker, if you take a look at what the government stated recently for its intention to have maternal health as a key issue for the G8 and presumably G20 talks, and then you take a look at the budget, there's a bit of a gap here. We've got the government saying, on the one hand, we want to embrace maternal health and we want to make sure we invest and help women in terms of development and make sure they have all they need to help their children. And then when you look at what their intentions are with the budget, What do you see, Madam Speaker? What you see is in the next couple of years, what are we going to do? You'd think that this government would be saying, we're going to raise our contributions for foreign aid. We're going to make sure that maternal health will be funded, not just this year, but for the next at least 5 years, because at 2015, that's the end of the Millennium Goal agenda. But what do we see? We see a government that's cutting foreign aid.
Shame.
Now, what do you say if you're someone on the front lines dealing with maternal health issues, and you want to see those women in the Congo actually take some initiative, be able to take initiative and power over their lives, and to give them the tools that they need, because they know how to turn things around. They need the resources and help from us. Do you think they're going to say, oh, we've got an honest broker here. We have someone who actually wants to help. When you look at the budget and you see they're cutting. So, Madam Speaker, we embrace the idea of maternal health as a priority. We want to make sure it comes without tags on dollars and where this money is going to be spent. We want to make sure it helps women around the world. We don't want ideological lenses put on this. We want to make sure that the money is going to the people who need it. But finally, Madam Speaker, to do that, our government has to commit to it, not just in words, in deeds. And when it comes to the budget, they've failed. So if they're going to embrace this, they need to change their economic priorities. They need to make sure we have money for this year, next year, and for the years following. Madam Speaker, the NDP will support this motion. We will support this motion not just today, but as we always have from now and continuing years to make sure that women who need the help abroad will get it. Thank you, Madam Speaker.
Questions and comments? Questions and comments? The honourable member for Vancouver Kingsway.
Thank you, Madam Speaker. I'd like to thank the honourable member for his very thoughtful and well-reasoned and consistent message. And I emphasize the word consistent because, as we have found when we talk about commitments to women or commitments to alleviating the effects of poverty or health impacts on people that are caused by poverty in this country, words are cheap and hollow. And what we really need in this country is a government that will back up those words with the resources necessary. And I wanted to focus a little bit on the economic underpinnings of the health problems facing women, because I believe that there's a clear connection between poverty and lack of opportunities and the health outcomes of women and children in our country. And I'm wondering if my honourable colleague might comment on that for us and tell us what he thinks needs to be done in this country and around the world economically to help improve the health outcomes of women and children.
The honourable member for Ottawa Centre.
Thank you, Madam President. And I want to thank my colleague for the question, because this is about investments. It's also about what those investments can do. You know, we know the 1 to 7 equation. We know that when you invest early in childhood development, $1, it saves you 7 later. That study's been done and referenced many times before. It applies, you know, not only in development, but also abroad, but also domestically. If you look at family planning, and if we invest in family planning, you're looking at preventing about 25% of maternal and child deaths in the developing world. And that's by making sure that you're preventing risky births that are too close together, that you're allowing women to actually have power over their reproductive systems, and that they are able to actually plan their families. Those are the kinds of investments that we can make. And it gives you a multiplier effect, Madam Speaker, because what it does is it invests, by investing in the present, invests in the future. It alleviates costs in the health system. It substantially supports women in terms of being involved in the economy, which, as we know in developing countries, they play a key role. So there's a multiplier effect, and that's why it's so important we invest.
The honourable member for Burnaby, New Westminster.
Thank you, Madam Speaker. And given the crisis that exists, 30,000 children dying in this next 24-hour period, 1,400 pregnant women dying in the next 24-hour period, there's no doubt that this is a crisis. I enjoyed the member from Ottawa Centre's speech, as I always do. He brought some very very insightful observations into this whole question of the motion that is before us today. I wanted him to comment on Stephen Lewis' reference to this government's approach as crass political opportunism. That what we have here, and this comes from a former UN ambassador, a deputy director of the UN's Children's Program, the special envoy on HIV/AIDS, a man of incredible depth and knowledge of what is actually happening in the Third World, happening in Africa, who's characterized the Prime Minister's approach as crass political opportunism. Does the member share this view, that this government is simply trying to window dress its hard-right ideology?
The Honourable Member for Ottawa Centre.
Thank you, Speaker. Thank my colleague for the question. And it's important to note that Mr. Lewis was someone certainly who was associated with this party, but also was appointed by a Conservative government to his position at the UN. And when he speaks on these issues, I think it's safe to say he's speaking about the genuine issue and not a political partisan perspective. And I think he's right, because what Mr. Lewis has looked at is the numbers and follow the money. When you see a government that claims it wants to invest in maternal health and wants to be involved, and then on the other side of the equation shows that it's going to be cutting foreign aid and running in the other direction, you've got to be called out on that. And so if you want to be credible on the global stage and saying you actually want to make a difference in maternal health, two very basic things have to happen. One is you can't put tags on the money. It has to be decided at source. In other words, where people are and where the investments are being made. And finally, you have to show up with the money and not cut the budgets, which are actually going to help you invest in helping in maternal health.
Resuming debate. The
Honourable Member for Laval-les-Îles. Thank you very much. Mr. Speaker, I'll be sharing my time with
today in Parliament to speak with the privileges given to me by the constituents of Laval-les-Îles as a parliamentarian on this motion, which calls on the Government of Canada to include the entire package of maternal and child health initiatives on the agenda of the upcoming G8 Heads of State Summit scheduled for June this year in Canada. I also speak today as chair of the Canadian Association of Parliamentarians on Population and Development, CAPPD, with members from all political parties in both houses of Parliament. This association was formed in 1997 to promote and advance the signed commitments made by successive Canadian governments, Liberal and Conservative, to uphold the 15 principles outlined in the 1994 Cairo Programme of Action. And the first principle is everyone has the right to life, liberty and security of the person. Those rights are intrinsic rights set out in the Universal Declaration of Human Rights, and they are followed by the right to food, clothing, water and sanitation, equality, the right to reproductive choice, education for women and the girl child, the right not to be sexually abused, the right to feel safe from trafficking, and much more. We are all familiar with these rights and those commitments, yet we choose to ignore them. Mr. Speaker, years later in 2000 in New York, Canada again committed itself to the Millennium Development Goals. Further, in 2002, we gathered in Parliament Hill in an international conference of parliamentarians hosted by our own association, CAPPD, recommitting the Canadian Parliament. On June 4, 2009, less than 1 year ago, legislators in the same chamber unanimously again recommitted Canada to reducing maternal and newborn morbidity and mortality at home and abroad through an all-party resolution. Instead, Mr. Speaker, I rise today to speak on a motion that in the 21st century should not have to be debated yet again in the Canadian Parliament, given the commitments we as parliamentarians have made time and time again, as I have just described. Canadian legislators are now preparing to host international parliamentarians on June 10th and 11th in Ottawa for the 6th Annual International Parliamentarians Conference. As we prepare for these summits, the international community is appalled at what is happening in Canada. Our CAPPD association is also a member of the International Network of Parliamentarians, which includes Asia, Africa, Europe, Latin America, and the Caribbean. Legislators all over the world are concerned that Canada is deliberately turning its back on women in developing countries. Our government will deepen the divide for those millions of women that die each day in childbirth. Mr. Speaker, we have promised women and girl children a way forward out of poverty and hunger. We have promised life and security of their person instead of rape and violence. We have promised education and jobs instead of illiteracy. We have promised sanitation and clean water instead of open cesspools breeding malaria and other diseases. We have promised access to health services. All of this, Mr. Speaker, is what we mean when we talk about gender equality. It is simply the right for women to choose life over death in childbirth because they can access what the majority of Canadian women take for granted. It is the right to development. What we have committed to is about giving families the ability to choose the spacing of their children. And what does this mean? It means that G8 and G20 summits can be global leaders who will put in place, under Canada's leadership, policies that provide women and men with the ability to practice responsible family planning as an integral part of healthy conjugal relationships.
High birth rates also mean that a woman may well succumb to causes that are linked with pregnancy and childbirth. Even if these pregnancies mean a risk of death, it can increase with a new birth. High rates of birth also add limited access to services in the area of primary health and obstetrics. All of these have consequences on the survival of women and on their life expectation. The risk is very high.
Condoms for men, not only to protect women from contracting HIV/AIDS, but to also help protect them from unwanted or low birth pregnancies. With
good nutrition for women, spacing births, that is one of the pillars of the approaches that will allow for avoiding premature birth and resulting problems and even death. If there is less than 24 months between childbirths, there is increased risk. It is therefore imperative that girls have adequate nutrition and adequate health care from birth through childhood and adolescence until they reach the age of procreation. For each newborn that dies, 20 others endure complications due to birth, to premature birth or neonatal conditions.
Clinics within a short distance of women's homes.
The discrimination founded on gender, often transmitted from generation to generation by cultural tradition and social economic standards, it has many perverse effects. Girls and women can be denied access to education, as has been shown in many studies. They can be exposed to greater rates of mortality. Also, they can be prevented from obtaining adequate health care and adequate preparation for life that would include knowledge about HIV/AIDS and how to prevent it, as well as insufficient spacing between birth, violence, and exploitation. Discrimination is a way of restricting their ability to earn their own lives and also of reducing them to servitude when they marry.
Throughout the world, parliamentarians remind me that Canada has had an excellent reputation as a leader in upholding its international commitments. But that reputation is slowly being eroded by irrational ideologies that are not grounded in any scientific research, human understanding, or a clear understanding of the needs of women and their families in developing nations. A 2009 Conference Board of Canada report said our country now has the highest infant mortality rates in the developed world. Within First Nations, Inuit, and Métis populations, these rates are even worse. According to a report on Indigenous children's health published in 2009, infant mortality rates for status First Nations remain approximately twice as high as general Canadian infant mortality rates. Infant mortality among Inuit is 4 times higher than for the general Canadian population. Mr. Speaker, right here at home, HIV/AIDS has a significant impact on Aboriginal women. The presence of this disease significantly impacts their reproductive health. The outcomes will be given to Canada's Prime Minister as he gets ready to preside over the G8 and G20 Heads of State summits in Huntsville and Toronto. I'm speaking here of the outcomes of our own parliamentarian summit. We are therefore asking this House today to send a message to the world, to send a message to women in Canada and in developing countries. Mr. Speaker, the world is watching Canada as we get ready to host international parliamentarians in Ottawa on June 10 and 11th to again review the Millennium Development Goal with an emphasis on maternal and reproductive health. In conclusion,
Mr. Speaker, the Liberal Party unequivocally supports access to a complete gamut of methods that would cover contraception, sexual health, and
is unequivocally supportive of access to the full range of family planning, sexual and reproductive health options, including contraceptions. Thank you, Mr. Speaker.
Questions and comments? Questions and commentaires. The Honourable Member for Elmwood Transcona.
Thank you, Mr. Speaker, and I want to thank the member for her comments. Certainly over the last 40 years of Liberal governments, those successive governments have promised 0.7% of gross national income that would be contributed to developing nations, and in fact the governments of the day never did meet those targets. Earlier today, the government minister said she and the government couldn't support the resolution because she said it was anti-American and it reopened the abortion debate. I just wanted to ask the member if she'd like to comment on that, about the government's excuse that it can't support the resolution today because it's anti-American.
The Honourable Deputy de Laval-les-Îles.
Honourable Member for Laval-les-Îles.
We're not in America here, we're in Canada. And although obviously the members across and the ministers across think that they're living in the United States of America, they're actually living in Canada. They've been elected by Canadian electors, and I'd like to think that perhaps they might look to what their own electors are thinking on this issue.
Questions and comments. The Honourable Member for Portage-Lisgar.
Thank you very much, Mr. Speaker, and I want to thank my honourable colleague for her comments. I wasn't able to hear the entire speech, but I came in when she started to mention the plight of Aboriginal women and women in Canada having babies, and I can agree with her. I lived in a First Nations reserve for 3 years, had my second baby while on that reserve, and had to travel 6 hours away, and so I think she makes a very good point, and I think it's important. Our government is looking at ways that we can help and improve access to health care for women and men living in remote communities. But I do want to bring her back to this motion and ask her if she does believe that the women who are in these impoverished nations where there is not access to adequate health care and where the government support is not there for nutrition, for clean water, does she believe that this will help mothers and young children if we can increase and have a real concerted effort as a G8 group to help these women and these children?
Member for Laval-les-Îles. Thank you, Mr. Speaker.
What our Prime Minister has said in Davos is that he has chosen 2 of the MDGs, the Millennium Development Goals, 2 of those, maternal health and early childhood babies' health, as the major focus. But in fact, all the other MDGs, if I can use the short form, are interrelated. And what the honourable member opposite has mentioned about access to clean water, access to clinics not too far away from their homes, access to the right birthing conditions, and particularly nutrition, these are all linked all together. What the Prime Minister has decided, and I support him on this, is to focus on 2 of these, but all the others are absolutely essential if women are to have babies in safe and sanitary conditions.
Questions and comments. Questions et commentaires.
Questions and comments.
Resuming debate. The Honourable Member for Beaches East York.
Thank you, Mr. Speaker. I rise today to speak on a motion that thing, as other members have said, I wholeheartedly wish we didn't have to be debating at all. This government doesn't understand the issue of infant and maternal health in the slightest. In fact, the Conservative ministers have been directly contradicting each other on this issue all over the place, which suggests to me that they're trying very hard to fudge something which they're worried will upset the base that they represent, because they believe very much that reproductive technology is taboo. Mr. Speaker, I was shocked, absolutely shocked, when I learned the Foreign Affairs Minister of this country stated it does not deal with in any way, shape or form with family planning. Indeed, the purpose of this is to be able to save lives. To save lives, does the Minister of Foreign Affairs not understand that the very thing he's denying women in developing countries is a thing that will in fact kill those women? He is, by virtue of saying that, he had to have known that by the government doing that and saying that, they were literally condemning certain numbers of women to death. I mean, that sounds horrible, that sounds harsh, but that is reality. And that is what Mr. Bush did in America. The purpose is to save lives, but this government's plan will not save any lives. Instead, it will condemn, as I said, women to death. No maternal health policy can be effective without proper family planning and the ability to space out pregnancies. Everybody in the developing world knows that. Everybody in our country knows that. As former Minister of CEDA, I have seen that in countries that I've visited. We know it's a fact. But the CEDA minister, the current CEDA minister, then said, we have chosen to focus the world's lenses on saving the lives of mothers and children, but not birth control. Does the minister really think that she's doing her job? How can the Minister of Development of Canada say that by denying contraception, she is saving lives, and by denying birth control, she is saving lives, when she knows full well that if she bothered to visit any of the developing countries and to look at any of the programs, that she is doing exactly the opposite? And as a former minister of CEDA, I suggest, Mr. Speaker, that that minister resign her job, because she is not looking out for the people that she is supposed to be representing and protecting in this country. The issue of promoting infant and maternal health is an admirable one. We all acknowledge. But when ideology trumps health policy and politics trumps common sense, the Conservative government only accomplishes to relegate Canada to the backbench on the international development and causes us a great deal of embarrassment, and that is totally unacceptable. Mr. Speaker, let's look at some of the facts. Improving the lives of women and children in the developing world requires more than immunization, access to clean water, better nutrition, and improved training for health care workers. All options must be made available to promote educated family planning and gender equality. All of these things are needed, but, Mr. Speaker, we need that and more. The reality is that 80% of maternal deaths are caused directly by complications during pregnancy, delivery, and after delivery. The four major killers are bleeding, infections, unsafe abortions, and obstructed labor. Contraceptive services in developing countries could avert 52 million in unintended pregnancies. I'm not talking one or two. This is huge. Could save 1 million lives and prevent 505,000 children from losing their mothers. Investments in family planning could slash maternal deaths by 70% and cut newborn deaths by nearly half. Mr. Speaker, children without mothers are 3 times as likely to die before their 5th birthday. They often enroll in school late and leave school early. Spacing between pregnancies is important for health of mothers. 215 million women would like to delay or avoid childbearing, do not have access to modern contraception. 20 million have unsafe abortions every year. 8.5 million need hospital care for complications, but not available to 3 million of those. The government is concerned that we're talking about abortion. Everybody wants to stay away from that word. But by denying birth control, they are forcing women to either abort or to die. And many of them do die, including their children afterwards. That is the reality. I saw it on the ground. I've lived with it. I've seen the data. It's there. That is the reality that we're dealing with. And that this government should ignore that reality because of its own personal ideological beliefs is totally unacceptable in this country. And we have signed agreements at the international level with respect to women that commit us to do exactly what this government is denying it's going to be doing. Women who cannot access reproductive health services are more likely to obtain an unsafe abortion, as I said, and more likely to die as a result of pregnancy, childbirth, or unsafe abortion. 90% of maternal deaths are preventable. They are preventable. Yes, nutrition, but also spacing out. Main reasons for infant and maternal deaths, Mr. Speaker. Poor quality of care with unsafe, outdated equipment, and lack of midwives and untrained professionals. I have traveled to many of these countries and I've seen, and I've met with the midwives. I've met with them and I've seen one midwife or two, or sometimes just one, responsible for thousands of women with very little medical equipment available. So yes, we need to provide more medical assistance, and yes, we need to provide better nutrition and better health supports to ensure that there no longer is just one. Absolutely. But we also need to provide contraceptive birth control assistance because those mothers do not choose, because what I've been told sometimes by people is, oh, well, they should abstain. Well, you know, it doesn't work. Women in these countries do not have the option of abstaining, just as they don't, young women in some parts of Africa do not have an option of abstaining and end up with AIDS, which is a whole other issue, which we're not even talking about. But of course, contraception would also help in preventing deaths in the other direction as well. It helps women who are already malnourished, who are already anemic in many ways because they're very, very poor, and who are not able to withstand a pregnancy that close and end up dying at childbirth. And that is why birth control has got to be part of the program. And by denying and eliminating that, it is unconscionable that a government would even consider it. And to me, it is nothing but pandering to a certain political level in this country. And it is totally unacceptable of a government that purports to lead a modern, progressive nation in this world, which I consider Canada to be. Cost of care. Women bear the brunt of the fees of the cost of care, Mr. Speaker. Their reproductive roles mean that they have the greatest need for health care. Even in places that health care is free, they still have to get to the facility and sometimes must pay for the equipment and supplies needed, which they don't have money for. The Millennium Development Goal number 5 to reduce maternal mortality by 75% before 2015. That was a commitment we made. And if this government thinks it's going to accomplish that without birth control and contraception, then it is wrong. And even the abortion, which is not something that nobody advocates for, it is still part of the program and it should be allowed. Those women have a right to choose and a right to survive. It is not for us to impose our situation on them. Canada, Mr. Speaker, has a long-lasting support for contraception and reproductive health services through CEDA. Government's ideology is getting in the way of good health care and gender equality. Doing this both here in Canada and now pushing its ideology abroad. Because as you know, Mr. Speaker, they have eliminated equality for women in this country, shut down offices that serve women in this country, and now they're trying to impose their ideology on women abroad. Mr. Speaker, I could go on for a long time on this issue, but what's most important to me is this, is that if the Minister responsible for development, and if the Minister of Foreign Affairs, and if the Prime Minister of this country know, because I believe full-heartedly that they do know, that in fact, without the contraceptive program and birth control and that being part of the program, it will in fact cause deaths. It will in fact condemn 500,000 to 1 million women in this world, in the poor developed countries, to death, and are still prepared to put forward that kind of policy and then only backed off slightly after they were pushed by the House and by the media. It is unconscionable, and it is irresponsible, and it is not Canadian. They, as leaders of this country, I expect better from them. I expect them to represent the values of this country and to support us abroad. Thank you, Mr. Speaker.
Questions and comments. The Honourable Minister of Sport.
Thank you very much, Mr. Speaker. I want to ask the member a question, what I believe is unconscionable. And we let her go on a rant, and we don't need to take advice from the Liberals on any of these issues. But if they had one genuine interest in women around the world, why would they put in this motion? Why would they attack a previous U.S. administration, previous, current, whatever, our strongest neighbor, our strongest ally? We've stood side by side in every major conflict. Why? Why wouldn't you keep your motion just in the positive? Why wouldn't you focus your motion on what you're trying to achieve? Why did you have to put in your motion to attack a previous U.S. administration? You can pick up the Globe and Mail today. You can see two previous U.S. presidents, President Bush and President Clinton, working side by side, doing humanitarian relief together in Haiti, yet your Liberal Party wants to attack U.S. President.
I'll just remind the Minister of Sport to address his comments through the chair, not directly at other colleagues. The Honourable Member for Beaches East York.
Well, Mr. Speaker, the Honourable Member conveniently forgets that it was the President of the United States, Mr. Bush, not the current one who's actually reversed the situation, but Mr. Bush, who declared that the money for families could not go to family planning, period, at all. In fact, it only went to faith-based organizations that did not do contraception, that did not do any of that thing. He actually denied, and it was around the world, women, in fact, were affected. Other countries had to move into the breach. And that's exactly what this government is doing. The exact same thing that its previous, the previous administration of the United States did. Then otherwise, why put this particular caveat on this program? Why deny these women the right to birth control, which would save their lives? This is exactly the same ideology, exactly the same practice as the previous. Is following the same practice as the previous administration.
Questions and comments. The Honourable Member for Vancouver Kingsway.
Thank you, Mr. Speaker. Mr. Speaker, I think one thing we all can agree within this House is that the health of women and children, not only in this country but around the world, is of paramount importance to all of us. And I think the key to the member's comments and the comments of everybody in this House is trying to agree on what the most effective measures and means for ensuring that health really are. And I'm happy, to be honest, that in this House we saw a change of course, whether that was forced onto the government or whether they came to their conclusion on their own, that contraception and family planning is a critical component in ensuring the health of women and children, particularly in developed countries. And I'm glad that we have joined together to recognize that. And I'm just wondering if the honourable member can comment on what percentage of the GDP she feels and her party feels is necessary in order for Canada to fulfill our international obligations to help ensure maternal and child health in this world.
The Honourable Member for Beaches East York.
Thank you, the Honourable Member, for this question. Obviously, I have always supported, and I believe that we support to reach the 0.7 percentage that we had committed to some time. In a matter of fact, we doubled aid to 0.8, and you have now frozen. And in fact, the Conservative government has just frozen the money, which means that in the next couple of years it would actually be cut. We had doubled it. We were doubling it to 8% every year to get there, but the current budget, in fact, freezes it, which means a reversal of policy, which in fact will be a cut in future. Therefore, we're not going to get there, not for a while, Mr. Speaker.
Questions and comments. The Honourable Parliamentary Secretary, the Minister of National Defence.
Well, thank you very much, Mr. Speaker, and I appreciate the time. And you know, most of what, or a lot of what the Honourable Member had to say about care of women and children and so on is true, and we agree with. But my simple question is, you know, we're not, my point and my question, you know, we're not going to get anywhere by misleading the House and by misrepresenting government position. She continually misrepresents the government position with respect to contraceptives. We've made it very clear that you know, is going to be part of the process at the G8 if the G8 wants to go there. We're not standing in the way of that at all. So I wonder why she continues to misrepresent government position and thereby mislead Canadians. And she has to raise the specter of, you know, people dying and so on to get people's attention. It's very disingenuous. It's not helpful at all.
The Honourable Member for Beaches East York.
First of all, Mr. Speaker, the fact that the spectre, as the honourable member refers to people dying, is not a spectre, it is true. Second, is very, very much a fact. Secondly, the honourable member, the government only changed its version when it said, well, of course it is, if the G8, as the honourable member just said, wants to go there. There's no such thing if the G8. Canada takes should take a leadership role. We don't go in and say, well, if the G8. Well, the G8 is already there. We know that. We know that they are there. It is Canada that has changed its position, not the G8. And the honourable member knows that very well.
Order. 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 Shh, 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 shh. Shh. The honourable member for Portage-Lisgar is about to address the House, and I think we should all give our attention. The honourable member for Portage-Lisgar.
Thank you. Thank you very much, Mr. Speaker. I would like to thank you for the opportunity that I have today to address this issue, and I would like to inform the House that I will be splitting my time with the member for St. Catharines. The motion before this House deals with what we do internationally in terms of our development assistance and our desire to focus on maternal and child health at this year's G8. We will be voting against this particular motion. This motion is a transparent attempt, a very clear attempt to reopen the abortion debate that we have said we have no intention of getting into. By voting against this motion, we are proving that we will not open the abortion debate. In addition, the motion contains rash and extreme anti-American rhetoric that we cannot, as a matter of foreign policy, support. As members opposite should know, the mandate of the Canadian International Development Agency is to reduce poverty in developing countries, especially among the most vulnerable populations, including women and children. To do so, the Government of Canada has committed to making Canada's international assistance more targeted and effective, and to improve the reporting of results to Canadians. We are untying aid, we are becoming more focused, and we have identified and are implementing thematic priorities that guide development work. Mr. Speaker, it was common practice for decades for donors to pledge their aid with strings attached, requiring that goods and services be acquired in the donor country. The Organization for Economic Cooperation and Development estimates that tied aid makes international contributions 30 to 35% less effective. In April 2008, Canada fully untied its food aid. Agencies such as the World Food Programme can now use Canada's money and buy the appropriate food at the best prices in areas closest to the need. In addition, Canada announced last September that it will fully untie all aid in 2012 and 2013. Mr. Speaker, as well, for far too long, Canada's bilateral aid was spread so thinly among so many countries, and results were very difficult to assess. That's why CETA committed to invest 80% of its bilateral resources in 20 countries. Our intent is to improve coordination, achieve greater results, and provide more targeted resources to those who are in need. Our countries of focus are developing countries where we thought Canada could have the greatest impact, including a limited number of states in crisis and transition, like Afghanistan, Haiti, and Sudan. Overall, the government chose these 20 countries based on their real needs, their ability to use aid effectively, and alignment with Government of Canada priorities. We are also decentralizing more staff to the field, giving us direct access to our partner governments and organizations. At the same time, other countries continue to receive Canadian development assistance in various ways, through humanitarian assistance, through multilateral channels like United Nations organizations, and through the support of Canadian NGOs with a presence in many developing countries. Mr. Speaker, to give our international assistance greater impact, CETA is focusing to work on three main themes: stimulating sustainable economic growth, increasing food security, and securing the future of youth and children. In fact, this last theme, children and youth, is central to the motion before us today. Economic growth is the key to self-reliance. There is no doubt that developing country economies need access to the global economy and the infrastructure to bring their products to market, whether it is in other parts of the country, the region, or internationally. Regarding food security, Canada has shown consistent leadership in responding to food security needs in the developing world. The announcement of CETA's new food security strategy on World Food Day last October 16th by the Minister of International Cooperation demonstrates a renewed and strengthened commitment to this critical issue. Yet food insecurity is also one of the most important and preventable obstacles to alleviating poverty. That's why CETA's food security strategy will focus on increasing availability and access to quality, nutritious food, as well as increasing the stability of food supplies and supporting improved governance of the global food system. To achieve these goals, CETA will concentrate its efforts over the next 3 years on sustainable agricultural development, food assistance and nutrition, and research and innovation. CETA's third thematic area is children and youth. Canada recognized that children and youth are key agents of change in these developing countries, but they also shoulder some of the world's most pressing challenges. Focusing on children and youth is one of the best ways to achieve long-term development and poverty reduction. CETA's aim to achieve concrete results that will make a significant, sustainable difference in the lives of children and youth. Special attention will be focused on young women and girls, because investment in girls and women brings great social and economic returns to these societies. On Universal Children's Day last November 20th, our government unveiled CETA's Children and Youth Strategy that identified 3 paths for action: child survival, including maternal health, access to quality education, particularly for girls, and safety and security of children and youth. Helping developing countries achieve their educational goals has been a key part of CETA's work for many, many years. Going forward, CETA will promote access to basic education of good quality so that children can complete the first 10 years of school and gain the knowledge and skills they need to contribute to their families and communities. CETA's new strategy also includes measures to create a safe and secure environment for children to learn and grow and become productive members of their society. All children have the right to be healthy, receive quality education, and grow up in a safe and secure society. CETA is committed to helping children and youth in developing countries to attain their full potential to become the strong, positive, and engaged citizens of tomorrow. Regarding maternal health, Mr. Speaker, we will work with G8 members and partner countries, as well as with Canadian civil society and international organizations with expertise in this area to develop the best approach. A developmental ministerial meeting will be held in Halifax, April 26th to 28th, to further develop the initiative in preparation for the June Leaders Summit. Fundamental to any approach is to ensure that our development dollars are being used efficiently and effectively in order to maximize and achieve tangible results. Together, working with other nations and aid agencies on the ground where the need is greatest, we can make this an achievable goal. We owe it to our Canadian taxpayers, and we owe it to the millions of women and children who need our help the most. Mr. Speaker, CETA will refocus programming to support efforts that ensure that children have the best possible start in life by putting in place programs and projects that have a positive impact on child survival and maternal health. Thank you very much, Mr. Speaker.
Questions and comments, the Honourable Member for Esquimalt-Juan-de-Fuca.
Thank you very much, Mr. Speaker. I'd like to ask my colleague a couple of questions. The first thing, let's align her government's position with reality and this motion. The reality, the government wants to reduce maternal mortality, childhood mortality. They want to have a strategic and effective investment of the taxpayers' money. In order to do this, Mr. Speaker, you've got to enable women and men to be able to be in control of their own reproductive health. The only way to do that is to give them the tools to be able to do that. That includes condoms, birth control, and access to do abortions safely in countries where it is legal. The failure to do that will result in the death of the mother because they can't space out their children. They have children too early. They can't have them too early or too late. They have to be in control over their reproductive health. Secondly, if the mother dies, then more than half of her children under the age of 5 will also die. And also, for every woman that gets that dies of pregnancy, 20 times that number sustain life-altering injuries, including obstetric fistulas. So I want to ask my colleague, if she believes in life, if she wants to be pro-life, will she give women in other countries the same tools that women in Canada have, which is to be able to have access to a full array of family planning options, including having access to safe abortions where it is legal? Thank you.
Very much.
The Honourable Member for Portage Lisgar.
Thank you very much, Mr. Speaker. I want to thank the member for his question. I guess he just mentioned access to abortion. Let me be very clear with my honourable colleague. We are not willing to, and we will not reopen the abortion debate. We realize that members opposite want to open up that debate. The Leader of the Opposition said it. This member just said he wants to talk about abortion. We will not talk about the abortion issue. This is about helping women and children in some of the poorest countries in the world who are dying. We want to be able to give them food. We want to help them with clean water and with health delivery. Mr. Speaker, the motion that is before us is a rogue, it is transparent, and the honourable member actually just brought to light exactly what they want to talk about, and that is abortion. We won't go there.
Questions and comments? The honourable member for Elmwood-Transcona. Well, thank you, Mr. Speaker. And the government members today, several of them have been talking about the reason why they won't support the resolution, because it reopens the abortion debate and it's anti-American, and I think they've got to quit having Ann Coulter write their lines for them. They're basically looking for excuses. They're looking for excuses to vote against a resolution which is eminently reasonable, which they actually say they really support the goals behind the resolution. I'd ask them to reread the resolution. Even on their supposed anti-American line, it's basically they're talking about what Bush did. Well, Bush isn't there anymore. Obama is there. They seem to be wanting to do more about what Obama wants to do than Bush anyway. That's their newfound positioning. So I think they're just trying to look for ways to criticize this resolution.
The honourable member for Portage Lisgar.
Thank you very much, Mr. Speaker. Actually, I would suggest that my honourable colleague from Manitoba, he needs to read the motion. Not only does it have anti-American sentiment in it and rhetoric, but also refers to failed Liberal policy and talking about supporting Liberal policy. The Liberals did nothing to help women. We've increased funding under CETA. And so there's so many things in this motion that are incorrect. It's a transparent motion that wants to dredge up an old debate. But apart from that, it's a bad motion. If the members opposite would read the motion, they would be able to see very clearly it's a bad motion. We're not supporting it.
Questions and comments? The honourable member from Kamloops, Thompson.
Thank you, Mr. Speaker. And I'm a nurse by background and spent a lot of time was devoted to maternal child health care in many remote communities in Canada. And certainly I recognize the importance of supporting mothers in some family planning options. Now, I read that motion that the Liberals put out, and certainly when I hit paragraph number 3, I was absolutely astounded at how they would bring that into the debate. We have neighbors to the south, and it was absolutely a terrible, inappropriate piece of a motion to bring into this debate. So I would like to ask my honourable colleague what would have possessed them to actually include paragraph 3 in the motion.
Does they want to open the motion?
The honourable member for Portage Lisgar.
Well, unfortunately, the only thing that seems to occupy the minds of the opposition is political expediency, and if they think that they can score a point, they don't really care what price has to be paid, at whose cost. They want to score a political point. It is too bad. But, Mr. Speaker, we will stay focused on helping women throughout the world who need help and help their children. Thank you.
Resuming debate, the Honourable Parliamentary Secretary of the Minister of Citizenship and Immigration.
Thank you, Mr. Speaker. Mr. Speaker, we in fact will be voting against the motion before the House. This motion is an extremely transparent attempt to simply reopen the abortion debate that we have clearly said we have no intention to get into. By voting against this motion, we are proving that we will not reopen the debate. And in addition to that motion, it contains rash and extreme American rhetoric that we simply cannot, as a matter of foreign policy, support. Mr.
Speaker, I'm rising today to speak to this motion and more specifically to outline how important food security is in the context of maternal and child health. But before I go into the details, let us first look at the present landscape. More than 1 billion people around the world have too little to eat or are malnourished, the result of a number of factors. These include population growth, volatile food prices, transportation and agriculture costs, as well as a struggling economy and reduced global investment in food and agricultural development. Mr. Speaker, while we are focusing on this, the Liberals are focusing on something else. Instead of supporting the Prime Minister in his efforts to make the lives of women and children in third world countries better, the Liberals see only an opportunity to cause controversy when there is none and slam our neighbours to the south where they should not be doing. For the Liberals, this statement is simply business as usual. For the men and mothers and children who go to bed hungry every night, a lack of access to sufficient, safe, and nutritious food can have a devastating impact on their health and severely limit their ability to learn in school, earn a living, and otherwise live well on the basic necessities of life. This makes food insecurity a central obstacle to reducing poverty and to keeping mothers and children healthy at the most critical points of their lives. For mothers, during pregnancy and in the years that immediately follow, and for children during their early years of life. Mr. Speaker, within the global context, Canada is among the leading donor countries committed to countering food insecurity. In fact, our government has made the issue a major focus of the Canadian International Development Agency, whose very mission is to lead Canada's international effort to help people living in poverty and to do so in a way that is efficient, focused, and accountable. Since the 2008-2009 food crisis, the number of people living without access to sufficient, safe, and nutritious food jumped from 923 million to over 1 billion, Mr. Speaker, 1/6 of our world's population. The majority of these individuals are farmers living in rural areas and, of course, women and children. This is particularly significant, Mr. Speaker, for two reasons. Number one, worldwide, approximately 500 million small-scale farmers cultivate food for more than 2 billion individuals. And number two, women account for a large proportion of agricultural production in the developing world and are therefore important agents of economic development and food security. We cannot hope to reduce poverty if the very individuals who bring food to the world are incapable of even feeding themselves. From national and regional perspectives, Mr. Speaker, we know that governments must strengthen their ability to address food security. And we know as well that in the global context, difficult economic forces continue to aggravate the stability of food systems. The same goes for volatile energy prices, which make food more difficult to access, given that its production, transportation, and distribution rely heavily on energy markets. Likewise, for the unpredictability of a changing climate, including changing intensity and frequency of rainfall, which can negatively impact and influence the global food system. As a government, our imperative is to help the world's poorest and most disadvantaged to overcome these challenges and to make it less likely for them to be affected by food shortages and constraints to agricultural productivity. To help navigate these waters, the Canadian International Development Agency has a food security strategy that clearly outlines the three priorities: sustainable agricultural development, food aid and nutrition, and third, research and development. Mr. Speaker, most poor people living in rural areas earn their income from agriculture. In fact, according to the 2008 World Development Report, agriculture programming is 2 to 4 times more effective in reducing poverty than investments in other sectors. CEDA's plan for sustainable agricultural development, therefore, include doubling agriculture investments by supporting national and regional agriculture strategies, which support the ongoing efforts of the World Bank and the International Fund for Agricultural Development and supporting agricultural research. These measures, Mr. Speaker, will translate into progress on many fronts. More small rural farmers will increase their agricultural production, and CEDA's partner governments will develop stronger policies, make their institutions more accountable, and design better processes to provide stable, local sources of nutritious food. In terms of food aid and nutrition, it bears remembering that worldwide more deaths are attributable to hunger and malnutrition than to HIV/AIDS, malaria, and tuberculosis combined. Nutrition is therefore obviously essential to early childhood development and to building a healthy population for the long run. Given that malnourishment leads to serious illness, blindness, mental disorders, and death among the world's most vulnerable. In terms of addressing the food needs of these high-risk populations, emergency food aid, social safety nets, and the nutrition are example of key interventions that contributed to addressing food insecurity. Mr. Speaker, CETA's work to improve access to sufficient quantities of nutritious food, and enhance the quality and effectiveness of food aid programming will result in more lives saved and better overall health for all developing world citizens, including mothers and children. The final priority in the food security strategy is research and development. As investments in agriculture, research and development have declined over the last 30 years, so too has growth in global agriculture productivity. Based on present estimates, the global food production must increase by 70% by 2050. Investments in agriculture, research and development are essential if production is to keep pace with increasing demand. As a significant donor to the Consultative Group on International Agriculture Research, and through contributions from Canadian academia, private sector and non-government organizations, Canada is putting its considerable experience in agricultural research and development to use on a global scale by sharing knowledge and resources with developing countries. In fact, our government also contributed $62 million to the Canadian International Food Security Research Fund. We put our money where our mouth is, Mr. Speaker. The purpose of this joint initiative between CETA and the International Development Research Centre is to increase the contribution of Canadian organizations towards solving global challenges regarding food security through applied, collaborative efforts and results-oriented research in partnership with developing country-based partners. Mr. Speaker, the work CETA is doing to facilitate research and development within the developing world will give farmers in partner countries better access to the new technologies and specialized expertise they need in order for their farming operations to keep pace with the growing demand for food, and also to withstand the ongoing effects of the changing climate. The triple challenges of meeting the food needs of tomorrow, of staving off hunger today while doing this sustainably, illustrates the enormity of our task and the need for concerted and coordinated action. This is critically important as we keep working to reduce poverty. While we are here to debate the important issue of women and children's health, the Liberals continue their history of making inappropriate and disrespectful remarks about the United States, and this statement and their motion is just more of that same. Our government has made much progress in trying to undo some of the damage caused to our relationship with the U.S. by the party opposite when they were in government over the past few years, yet they continue to undermine and continue to try to damage that relationship. But, Mr. Speaker, we are going to ignore their provocations and continue to make progress on food security for at-risk populations in our world. Mr. Speaker, there is no doubt that food security ties itself closely to our government's objectives on maternal and child health. Without it, we cannot hope to keep mothers and children healthy at the most critical points of their lives. Thank you.
Questions and comments. Questions and commentaire. The honourable member for Esquimalt-Juan-de-Fuca.
Thank you very much, Mr. Speaker. I want to ask my colleague a question. Last year, the Prime Minister at the G8 meeting in Aquila, Italy, signed on to allowing women and men to have access to a full array of family planning options. I'm going to read, Mr. Speaker, what family planning is as the WHO, World Health Organization definition. It's this, and I quote, "The World Health Organization's definition of family planning is that family planning allows individuals and couples to anticipate and attain their desired number of children and the spacing and timing of their births. It's achieved through the use of contraceptive methods and the treatment of involuntary infertility. A woman's ability to space and limit her children is crucial to her ability to be able to ensure the safety of her health and that of her children." So I'd like to ask my colleague, that's the WHO definition of family planning. The Prime Minister signed on to last year in Italy that he would support women's access to a full range, women and men's access to a full range of family planning options. Does he support the World Health Organization's definition of family planning, and will his government support that definition and achieving those goals at this year's G8 summit in Ontario?
The Honourable Parliamentary Secretary.
Mr. Speaker, the answer is quite clear. In fact, we do agree. In fact, that is the honourable member makes point of stating what the Prime Minister led in terms of the last time that this came on the table. He stands by his word. We stand by our word. In fact, he is making it a priority when the G8 and G20 meet here in our country, in Toronto and Muskoka. It is a priority for him. It is a priority for this government. But to turn this issue of trying to help mothers and children in poverty across this world into some political issue that they feel will drive some sort of message or try to divide this House in terms of dealing with an issue that is completely nonpartisan is unacceptable, and it's why we're not supporting this motion today.
The honourable member for Vancouver Kingsway.
Thank you, Mr. Speaker. Well, Mr. Speaker, what's interesting to me is what drove a rift in this House was this government's refusal to acknowledge that contraception and family planning played a role in maternal health, and they took that position for days on end in this House as I sat here until finally they changed their position, did an about-face because of the public pressure from Canadians across this country. That's what's created a rift. Now, I'm glad that we've actually come together on that and recognize that contraception and family planning are vital to saving women's lives and children's lives around the world. But I want to just focus just on this issue of attacking the United States. When I read this motion, it says that the Canadian government should refrain from advancing the failed right-wing ideologies previously imposed by the George W. Bush administration in the United States. That says nothing about attacking the United States. It's about attacking an ideology that hurts women. And I'm just wondering what specifically in that paragraph, if the member could help me understand, he finds objectionable or incorrect.
Parliamentary Secretary.
Mr. Speaker, any time that a resolution, let me just first say, the member who moved this resolution was a premier of the province of Ontario for 5 years. I've been here for 4 years. I have never introduced a motion in the House. I've never introduced a piece of legislation in this House, private member's bill, that indicated in any way, shape, or form some reference to what he did to Ontario. Now, he did a lot of bad things to Ontario for 5 years. But let me tell you something. I never, ever, when I'm dealing with an issue in the House of Commons, try to use a previous government from either another province here or worse, from another country. I do not understand why the member opposite asks a question, reads this, and says, in fact, that we are not trying to partner with our brothers and sisters in the United States. This is not what it's doing. It's driving us further apart. We don't accept it. We won't support it.
Questions and comments, the honourable member for Leeds Grenville.
Much, Mr. Speaker, and I've listened very closely to the Parliamentary Secretary's comments, and I currently am the House Chair of the Canada-U.S. Interparliamentary Group, and I know the Honourable Member serves as one of the Vice Chairs, and we all work very hard to work with the members of Congress down in the United States and try to advance Canada's agenda, and working with them very closely. I know the Honourable Member has been part of those efforts. Maybe he can tell us just a little bit more of what the damage that this type of motion can do.
There are 30 seconds left for the Honourable Parliamentary Secretary.
Well, I want to thank the member for his question and credit him for the work that he's doing as a chair of this association. In fact, let me point out very clearly, the Buy America policy that definitely would have had an impact on this country and did to some degree was resolved based on the hard work of our relationship with the United States. And what we agreed to, whether we are Liberals, whether we're Conservatives, or whether we're NDP and sit on this committee, what we did agree to, our relationship has to be strong with the United States. This does nothing to make that any stronger.
Resuming debate, the honourable member for Etobicoke North.
Thank you, Mr. Speaker. I'll be splitting my time with the member of Vancouver Centre. Mr. Speaker, every day almost 7,000 people become infected with HIV and almost 6,000 die, mostly because they have no access to HIV prevention, treatment, and care services. In Canada, someone in the country becomes infected with HIV every 2 hours. Women account for 1/5 of Canadians with HIV/AIDS, up from 1/10 in 1995. By the end of 2005, there were 58,000 people living with HIV/AIDS in Canada. Of those, an estimated 15,000, or just over 25%, didn't know it. Today, AIDS remains the most serious infectious disease challenge to global public health and undermines 6 of 8 Millennium Development Goals: reduce poverty and child mortality, increased access to education, gender equality, improved maternal health, and efforts to combat major killers such as malaria and tuberculosis. Mr. Speaker, my remarks will focus on what can happen when a government fails to implement evidence-based medicine, but instead invokes ideology over science, as happened during the early days of the AIDS pandemic and the United States' response to it. Mr. Speaker, protecting our children is personal to me. I taught infectious disease and women's health at the university. I used to have Casey House, the first freestanding HIV/AIDS hospice in Canada, come and talk to my students. But as the years passed, I stopped inviting the organization because I knew I had students living with HIV in the room and that the talk would be devastating to them. Mr. Speaker, we cannot, we must not. My students came to me when they had nowhere else to turn. They confided in me about being HIV positive. They were 17, 18, scared with no hope. They couldn't fathom how this had happened to them. They didn't want to go home, they didn't want to tell their parents, and they were afraid to get help. And I heard from the parents. I remember one parent who came to me in desperation. He just kept saying, if only I had talked about it. It shouldn't have been that hard. The ABCs, abstinence, be faithful, condoms. My baby might not have been infected today. How do I ever say I'm sorry? My wish no parent, friend, loved one, or teacher would ever have to hold a young person sobbing because they have received the terrifying, life-changing diagnosis of HIV positive. At that time, a death sentence. Mr. Speaker, we must not return to the fear and ignorance that once defined the world's response to the AIDS pandemic. I remember that first summer in the early 1980s. Radio reports from California and New York drifted in about a small number of men who had been diagnosed with rare forms of cancer and/or pneumonia. The U.S. Centers for Disease Control and Prevention first described the condition in 1981 by detailing the cases of 5 young gay men hospitalized with serious pneumonia and yeast infections. By the end of 1981, 5 to 6 new cases of the disease were being reported each week. By 1982, a total of 20 states had reported cases, and the disease was no longer solely affecting gay men. There were a small number of cases among heterosexual men and women. Initially, the American government completely ignored the emerging AIDS epidemic. In a press briefing at the White House in 1982, a journalist asked a spokesperson for President Reagan, does the President have any reaction to the announcement that AIDS is now an epidemic and has over 600 cases? The spokesperson responded, "What's AIDS?" To a question about whether the President or anybody in the White House knew about the epidemic, the spokesperson shockingly replied, "I don't think so." Mr. Speaker, while the government took no action, the numbers of infected and dying continued to increase. By the end of 1983, the number of AIDS diagnoses reported in America had risen to over 3,000, and of these, over 1,200 had died. Shamefully, it was not until September 1985 that President Reagan publicly mentioned AIDS for the first time. Mr. Speaker, this was unconscionable. Public health officials had a model for how quickly a sexually transmitted disease could spread. It was syphilis, which emerged 500 years ago in Western Europe during the late 15th and 16th centuries, quickly reaching a prevalence rate of 20% in many urban areas. The U.S. political sector's slow response to AIDS contributed to the explosive growth of the epidemic. Mr. Speaker, in some instances, federal officials actually ruined efforts to slow the epidemic. Former Surgeon General Koop stated, "Even though the Centers for Disease Control commissioned the first AIDS task force as early as June 1981, I, as Surgeon General, was not allowed to speak about AIDS publicly until the second Reagan term. Whenever I spoke on a health issue at a press conference or on a network morning TV show, the government public affairs people told the media in advance that I would not answer questions on AIDS, and I was not to be asked any questions on the subject." Mr. Speaker, President Reagan also refused to advocate for safer sex and condom use. Instead, he chose a ban on HIV-positive immigrants entering the States and then later sexual abstinence as the keys to preventing the epidemic. At last, in 1986, the Surgeon General's report on AIDS was published, outlining what the nation should do to prevent the spread of the disease. The report urged parents and schools to start frank, open discussions about AIDS. And finally, in 1988, the first national coordinated AIDS education campaign was finally launched in the United States. 107 million brochures entitled Understanding AIDS were mailed to every household across the country. Tragically, nearly 83,000 cases of AIDS had been identified in America, and over 45,000 people had died. Six other nations had set up similar leaflet campaigns before America chose to do so. A condom campaign was finally launched by CDC in 1994. It promoted condom use, a first among government agencies, state and local organizations, and through a series of advertisements on TV networks, cable, and radio. In 1997, for the first time since 1981, the start of the epidemic, the numbers dropped substantially. Mr. Speaker, Harvey Feinberg, then Provost of Harvard University and co-chair of the 2000 Institute of Medicine Committee, stated, "Thousands of new HIV infections could be avoided each year if we gave greater emphasis to prevention." The report also criticized government spending on abstinence-only education, as there is no evidence that such programs are effective in preventing the spread of HIV. Mr. Speaker, in closing, since the beginning of the pandemic, almost 60 million people have been infected with HIV, and 25 million have died of HIV-related causes. In 2008, 430,000 children were born with HIV. We have a long way to go to defeat HIV/AIDS and to protect maternal and child health. We must reduce HIV infections, increase access to treatment and care, and reduce HIV/AIDS-related health disparities. We must ensure that all people understand that HIV/AIDS is incurable, but that it is also 100% preventable. Far too many people have become infected because they lack basic information about how this disease is spread. Mr. Speaker, my last words. My thoughts and prayers remain always with my student, who is sadly no longer with us. And to the father, I honor the promise, namely to tell families how they can best protect their children. And now I call upon this government to respect the words of its public health agency, namely that condoms are a vitally important way to save your life and protect your health. This is a global public health issue to reduce the spread of HIV/AIDS and save lives. We cannot return to fear and ignorance, which led to infection and dying. Thank you.
Questions and comments. The Honourable Member for Kamloops, Thompson Caribou.
Thank you, Mr. Speaker, and I certainly listened to my honourable colleague, and I think we both traveled down that same path in terms of AIDS, HIV, and really have similar concerns about some things that happened. But I guess my question to the honourable member is how in paragraph 3, again, I look at their motion and the whole looking at another country and making comment on another country in the negative is in any way helpful to Canada and our relationship with them, and why is that part of the motion there? Thank you.
The Honourable Member for Etobicoke North.
I'd like to thank my honourable colleague for her comments. The material that I have presented is historical fact. The facts that I presented come from the World Health Organization and from the United Nations, and I will take this opportunity to talk about preventing the transmission of HIV/AIDS. Abstain from sex until you're in a relationship with one person, are having sex with only each other, and each of you know each other's HIV status. Talk about HIV and other STDs with each partner before you engage. Learn as much as you can about each partner's past behavior and consider the risks to your health before you engage. Get tested for HIV. Use a latex condom every time you have sex. If you think you have been exposed to other STIs such as chlamydia, gonorrhea, and syphilis, get treatment. These diseases can increase your risk of getting HIV. Do not have sex when you are taking drugs or drinking alcohol, because being high can make you more likely to take risks. And to protect yourself, remember the ABCs: abstinence, be faithful, and condoms.
Questions and comments. The honourable member for Vancouver Kingsway.
Thank you, Mr. Speaker. And I'd like to thank the member for, I think, a very thoughtful and well-prepared speech on HIV and AIDS with, I think, a lot of principles that I think we all should agree with. But I do want to bring up that when it was in power, her party, the former Liberal government, promised to meet its target of contributing 0.7% of gross national income to international aid. Yet, year after year after year, that party and that government failed to do so. And this has got to be something of a laughingstock, as I think over a period of decades, the Liberals made a habit of making that commitment and then never actually keeping it. Now, I'm just wondering, bringing the matter forward to today, were her party to be in government again, will she stand in this House and give a commitment to all Canadians that one of the first things her government would do would be to reach that 0.7% figure, or would it be just more words again?
The honourable member for Etobicoke North.
I thank the honourable member for his comments, and this is not a laughing matter. And of course, we support the increase in ODA, or Official Development Assistance. And I also want to take the opportunity to explain when a condom campaign was finally launched by the CDC in early 1994. The campaign promoted condom use. It was a first involving government agencies, state and local organizations, through a series of advertisements on national television networks, cable networks, and radio stations. The advertisements were frank about sex. In 1997, it was reported for the first time AIDS decreased in the United States since the start of the epidemic in 1981.
There's time for one more quick question. The honourable member for Simcoe North.
Thank you, Mr. Speaker, and to the member opposite. And I appreciate she's been engaged in I think, a very important comments in terms of public health. There's no question about that. No one doubts the efficacy of her comments this afternoon. But, Mr. Speaker, back to the real question and the motion in front of us, and as was enunciated by the member here from Kamloops, Thompson Caribou, in the third paragraph, the comments in this motion are almost incendiary in terms of our relationship to say things like refraining from advancing right-wing ideologies. In the general sense, I mean, I must say, would the member please clarify why those kinds of comments would show up in a motion like this?
Honourable member for Etobicoke North.
Mr. Speaker, I'll repeat my comments earlier, which is the material that I presented is based on historical fact. CDC, the Institute of Medicine, and the World Health Organization recognize the history that took place in the United States. If action was taken in 1981, the epidemic could have been slowed. Sadly, the word AIDS was not even mentioned until 1985.
Doing debate, the honourable member for Vancouver Centre.
Thank you very much, Mr. Speaker. I rise to speak on this issue because, having been a member of Parliament in this place for 17 years, I still have not lost my roots, which is in medicine, having delivered 800 babies during the course of my time as a family physician. This issue is of extreme importance to me because when I look at my own country of Canada and I realize that 1 in 11,000 women die in childbirth here, and that in the developing world there is 1 in 3 parents dying in childbirth. There is an enormous number of stillborn children, and there are many children who are born and who within 42 days fail to thrive and actually die. I do not believe that a country like Canada, which professes to care, and this is at the root of the decision to sign on to the Millennium Goals for 2015, is the fact that we do care about others. It is first and foremost that we do not apply quality of care to other countries or to developing nations that is less than that which we will give to our own people. And so it is with that sense of being a physician and of accepting that we cannot do second best for the people of the developing world, then I think we have to consider that this motion here speaks exactly to that. The concept of the Millennium Goals 4 and 5, and to some extent 6, are all about maternal and infant health. It is about preventing the toll of extraordinary death. And you know, Mr. Speaker, I just want to cover a couple of facts quickly for you here. Every minute of every day, a woman dies of pregnancy-related complications. That means more than 500,000 women each year. And 99% of those deaths in pregnancy and childbirth occur in the sub-Saharan region. Almost half of all women in developing countries deliver their babies without a nurse, midwife, or doctor present. And we know, Mr. Speaker, that that actually has to do with pregnancy itself. But for those of us who have delivered babies and who have studied this issue of obstetrics all of our lives, we know that actually mortality and morbidity meaning the illness accompanying it, does not begin the day a woman becomes pregnant. It begins actually, Mr. Speaker, when the woman is at her childbearing years. The number, let us look at the Millennium Goals, and they're pretty clear. In 2000, they were developed by 189 countries. Some of them developed, some of them developing world. But all of these countries came together, and they decided that by 2015, they would look at a set of measurable and concrete goals, specifically under Millennium Goals 4 and 5, for decreasing maternity-related deaths, and for decreasing perinatal deaths, and for decreasing infant death. And in fact, Mr. Speaker, that commitment was made and sworn to by all of the countries attending. Canada was one of them. And they swore that they would uphold and commit to those goals and to the action plan for getting there. Now, this is not an action plan that was drawn up out of somebody's head because they felt it sounded good. This was based on good practice. This was based on knowledge of evidence-based medicine. This was based on knowing what contributes to maternal mortality and to child death. And it therefore was looking at clear guidelines that are based on knowledge, evidence, and scientific information. And one of the first pieces, Mr. Speaker, of the concrete measurable goals was that by 2015, 50 million couples will have access to contraception and family planning. That was one of the goals, a clear measurable goal, access to contraception and family planning. Because, Mr. Speaker, it's not rocket science. If a woman has many pregnancies and they're spaced less than 2 years apart, the ability for that woman to remain healthy, the ability for that woman's nutritional status and her body to be able to carry pregnancies is immediately compromised by that frequency. In Canada here, I myself used to have 1 or 2 patients who would want to coalesce their births all in about 3 years. They'd want to have all their kids as quickly as possible. And I would have to tell them that, in fact, if they wanted to have children under 2 years between the last one or under 1.5 years between the last one, given, of course, that women's health here is a lot better than in the developing world, that it would, in fact, create a higher level of risk for them during childbirth and, of course, for the child itself. So, Mr. Speaker, we know this here, and it applies to women in sub-Saharan Africa and in the rest of the developing world. Women are not different anywhere in the country. The same physiological and pathophysiological processes occur everywhere with the issue of carrying children. We also know that when the uterus does not have time, Mr. Speaker, and forgive me for being a little graphic here, when the uterus does not have time to come back to its old strength, to the thickness of its walls, it is very, very easy for that uterus to rupture and for postpartum hemorrhage to occur, which is what the major causes of death in childbirth is all about. So you cannot separate the concept of family planning, planning your children, planning the distance between those children, that it has an impact on the actual occurrence during pregnancy and during childbirth for that maternal death and for that fetal morbidity or mortality to occur. So this is, as I said before, Mr. Speaker, not rocket science. It's very clear. We know this for a fact, and this is what we need to apply. So that I am very concerned, Mr. Speaker, as a physician and, of course, as a member of Parliament, to note that the concept of family planning and contraception, which is one of the key measurable goals of the Millennium Goals 4 and 5, is considered to be something that is an option. If I may be forgiven for paraphrasing, I think the Prime Minister said that he would keep those options open. He would not close any doors. Well, this is tantamount to saying that I don't buy the knowledge gained over medical care for centuries. I don't buy the fact that these two are linked. And I'm going to consider whether we will decide to do this or not. We have to base, when we're going to intervene, especially in countries that are not our own, we have to base everything we do on evidence-based care, on knowing what the outcomes will be and knowing how to prevent those outcomes. If we do, when we blue sky, we're quackery. We're doing quackery on people in a country that we are treating less than our own people. So we cannot say, I will consider the options. We have to say, these are the clear guidelines set out by the goals. These are the concrete action plan that we committed to following. So we cannot cherry pick it. We cannot decide. I would not be so bold as to say this is ideological or what, but I would be so bold as to say this is not good medical care, this is not good medical practice, and this puts the lives of these women at risk. Not only that, Mr. Speaker, we know that part of contraception is that many women in the developing world actually resort to. We know that 20 million of them each year have unsafe abortions. We know that 70,000 of them die from these unsafe abortions. Good family planning, good contraception is actually the most important step in preventing abortion. If we considered good family planning and contraception, we could have, and that is one of the key goals for the 2015 Millennium Goals, is to halve the number of abortions in the world. That is an extraordinarily important priority. So this is not about morality, and this is not about, it's about preventing something that most of us do not want to see used as a method of birth control. So, Mr. Speaker, these are important things we have to talk about. We need to understand the medicine of this, the clinical practice that we are embarking on here. Mr. Speaker, we know that, for instance, every year, 500,000 women die from pregnancy-related diseases. And I stood in this House here and I listened to the Minister of CEDA say that they're only interested in preventing deaths and therefore they're only focusing on the pregnancy and the 42 days post-pregnancy or the few days post-pregnancy where most women die. And this is a fact. It is a fact that most women die at that particular time. But, Mr. Speaker, suggesting that the causes of the postpartum hemorrhage and all the reasons for maternal death are something that only occurs right then and there during the pregnancy is like suggesting that we decided that we wanted to decrease the number of deaths for people from heart disease and that we will only focus on that during open heart surgery. That, in fact, prior to that, we won't care about obesity, we will not care about smoking, we will not care about trans fats, but we do care about those things because in this House we have debated the issues of obesity and trans fat use and smoking as being things that contribute to cardiac disease. So there is a whole spectrum of things that we must do. And, Mr. Speaker, for the sake of the women in these countries, for the sake of women around the world who leave orphan children when they die, for the sake of children who grow up and their mothers pass on to them HIV, AIDS, hepatitis C, for the sake of, and I will not elaborate on that because my colleague just spoke to the issue of sexually transmitted diseases, but that is a cause of chronic morbidity and maternal death. So I ask this government to please consider that they should follow the required course, the course that is set based on good clinical guidelines. Thank you very much.
Questions and comments, questions and commentaires.
Questions and comments.
For West Vancouver, Sunshine Coast, Sea to Sky Country.
Mr. Speaker, I'm delighted to hear the words of my honourable colleague, a doctor. And I recall from many years that doctors take the Hippocratic Oath, do no harm. So I asked the member opposite if she really is concerned about the health and welfare of women in other countries, as most members in this House are. If she's really concerned about that, how can she support a motion that includes in it the words that the Canadian government should refrain from advancing ideologies, and it goes on about a past leader of another country? Why isn't she focusing, as this House should be, on a noble mission to improve the health and welfare of mothers in other countries, instead of muddling it with something like this? How can that happen? How can that be considered doing no harm, adding those words to a motion in such a noble cause?
The honourable member.
That's an important question that the honourable member asked, and I think that as someone who took the oath and who understands the ethics of medical practice clearly based on the ethical code, it is not just doing no harm, it is to consider first the well-being of the patient. And this is something that we must consider. And I did not stand here and speak about ideology, although it must cause some of us here who understand that when the World Health Organization, UNFPA, the United Nations, and physicians and healthcare providers around the world have developed a clear, concrete strategy, one of them being good contraception, and a government ignores that, we have to ask ourselves if they are going to forget good clinical practice and resort to ideology. That is a common sense question to ask.
The honourable member for Elmwood Transcona.
Well, thank you, Mr. Speaker, and I want to thank the member for a very progressive speech, and we hear that a lot from Liberals in opposition. They're talk a great line in opposition. I remember when they were in opposition, they talked about the Red Book promises. They were going to get rid of the GST, cancel the helicopter contract, bring in a national daycare program. And you know, Mr. Speaker, for 40 years, these same Liberals have been talking about targeting, contributing 0.7% of gross national income to international aid. And as of this day, we still haven't achieved half of that. So my question, I guess, to the member, and I'm trying to get the same answer that my colleague, the member for Vancouver Kingsway, asked the previous speaker from Etobicoke North, will she commit that if and when she does become part of the governing party, that particular government will live up to that 40-year-old promise?
Well, member for Vancouver Centre.
Thank you very much, Mr. Speaker. I'm really disappointed that when we are speaking here about the lives of women and children that we have to resort to this sort of what did you promise X years ago. The Liberal Party has never, when it was in the government, ever talked about preventing access to contraception. We understood that this was key. I was at the Beijing conference in 1995 when we talked about women's rights being human rights and reproductive rights being at the forefront of women's rights. And therefore, Mr. Speaker, we have committed to this. We have done this. In all of our international aid, we have considered and given assistance to contraception and to assisting women in understanding this issue. The idea of committing currently to doing something that we don't know what the state of the Treasury would be when we get there is something that we can hope to use as a target, that we are committed to the target. Whether we can do it in the first year in government is not an answer that I am prepared to give. But we should stick to the issue and not the cheap political tricks.
Questions and comments, the honourable member for Mississauga South.
Thank you, Mr. Speaker. I'm reading from the G8 health report from Italy, and under the maternal health, it does confirm that due to complications associated with childbearing, a woman dies every minute, and the chance of dying during childbearing and delivery complications amounts to 1 in 16 in developing countries, and compared with 1 in 2,800 in developed countries. If it has to do with childbearing, and it's been suggested in some of the speeches that 30% of this problem could be dealt with by family planning. Of family planning as a whole holistic approach, what percentage of these, as it says here, a woman dies every minute, what percentage of all of those maternal deaths could be prevented by contraception or abortion?
The honourable member for Vancouver Centre.
There are all kinds of figures floating around. In response to the honourable member's question, 60,000 is one of them. But I would suggest that we could look at a round figure of about 30,000 of the women who currently die in maternal morbidity. Because the concept of contraception is not a moral one, Mr. Speaker. The concept of contraception is preventing. It's a preventative measure. Everyone knows that in good public health, one of the first pieces of good public health is prevention. As I said before, in cardiac death, you're not going to ignore obesity and trans fat and smoking. So prevention, i.e. preventing the frequency of pregnancies, helping women to plan their pregnancies so all babies are wanted that are born in the developing world.
Resuming debate, the Honourable Member for Laval. Thank you, Mr. Speaker. Mr. Speaker, it's a pleasure for me to rise in the House and take part in this debate. It is clear, Mr. Speaker, that I support the motion being debated today in the House, and that without reservation. I understand that the government's G8 initiative on maternal and infant health in the poorest regions of the world should include all ranges and all options with regard to reproductive, family planning, health, and this includes contraception. I also believe that the government's approach must be based on scientific evidence. And I also believe that the government, the Conservative government, should refrain from advancing the same right-wing ideologies, the failed right-wing ideologies that had been previously imposed by George W. Bush in the United States, which made humanitarian assistance conditional upon a global gag rule that required all non-governmental organizations receiving federal funding to refrain from promoting medically sound family planning. And before I go on, I'd like to tell you that I'll be sharing my time with a member for Pointe-de-l'Île. I must not forget that. So, Mr. Speaker, I find this all without surprise, basing international assistance for maternal health must be based on scientific evidence instead of ideologies. And this shows that education and family planning can prevent deaths. And we have the government here, the Conservative government, which is full of right-wing ideologies, which thinks that when it hears family planning of abortion and contraception, and it sees the flames of the underworld, and they want to ensure that they have the right to bear arms, but not to terminate pregnancies. So we have to know who we're dealing with, Mr. Speaker. We have to remember that this is the government that made wage equity a negotiable right. We have to remember that it is this government that cut funds to the Canadian Federation for Sexual Health, which ensures family planning services, and which is associated to the International Family Planning Organization. We must remember that this government has done almost nothing for Aboriginal women and has cancelled or abolished the Court Challenges program and other things, including Real Women. We have to remember who they are. The Minister for International Cooperation told us yesterday during question period that the government was not going to open a debate on abortion. Oh, no. Well, Mr. Speaker, who in this House is bringing abortion here? The opposition? I don't believe so. Who tabled Bill C-484? The opposition? I don't think so. Who said that the goal of the government's initiative at the G8 was to save lives, excluding family planning. The opposition? I don't think so, Mr. Speaker. What I do believe, however, is that this government, by telling us that it doesn't want to open the debate on abortion, is telling us that it is closed to this option, and it is saying we are refusing to talk about it. Will it avoid a debate that could upset our American neighbors? Who knows? Does it want to avoid taking a position and showing everybody their real face? We don't know. We do know that they will not open the debate, and that's all we know. But studies are clear on the issue. The medical journal The Lancet told us in 2007 that of the 42,000 abortions practiced every year throughout the world, 35,000 occur in developing countries. In 2003, 48% of all voluntary terminations of pregnancies occurred without any medical assistance whatsoever, an increase of 4% since 1995.
The authors, including Mr. Petshov from the World Health Organization, 92% of voluntary terminations, if these were done in safe conditions, then there would be a lot better outcome. 97% of the abortions carried out in highest risk conditions happen in developing countries. In most countries, there is very limited access, and there are 100 times more deaths to women. People use sharp objects or herbs as the usual way of terminating a pregnancy, and the results are often disastrous. Some say that this is not a public health issue, but who would dare say that this is not a high-risk issue? In developing countries, abortions are carried out improperly very often. We do not have the choice to do nothing. Women are dying. They are bleeding to death because there is no health care for this. Do we need to tell our partners in the G8 that we are going to provide family planning, including contraception and abortion, everywhere where it is needed and legal? If we did not do so, it would be a case of not providing assistance to someone in danger. But I have no illusions, because I know what this government is. If I said I believed that they would do this, I would be forgetting what they stand for. They will not put all the options on the table. They will not reopen the debate on abortion. They will not face up to their fundamentalist supporters. And this makes one profoundly bitter. This is not an issue of international assistance, it is a question really of values, their values. It is easier to change governments than to change the values of the one that we have. So I apologize on my own behalf to these women who have had the misfortune to grow up and become pregnant in a country where health care is inadequate. And I apologize that knowing this, my government, where I live, is doing nothing. Thank you, Mr. Speaker. Questions and comments? The Honourable Member for Lévis-Bellechasse. Mr. Speaker, I would like to ask my colleague a question. She certainly must not have listened closely when the Prime Minister said that he was prepared to come to the aid of women and children in difficult circumstances around the world, and this is going to be a major issue at the G8 meeting. I would like to ask her, though, about women and children who are the victims of human trafficking in Quebec. She has had a chance to stand up here in the House and challenge show that she is not dogmatic. She is not willing to stand up and defend women and children from human trafficking. So why is she not willing to impose minimum sentences on criminals in our countries who are a menace to women and children, and especially recognize that Conservative members are standing up here to defend women here and around the world? Order, please. The Honourable Member for Laval. Mr. Speaker, I am very pleased by this question asked by my colleague, the member for Lévis. I'm particularly happy because my colleague is surely not aware that I am the person who was involved in the arrest of the very first person charged with trafficking human beings in Quebec. So one needs to make sure that one has all the facts before jumping to one's feet. The Bloc Québécois has always defended human rights and worked against trafficking of humans. And we are defending women in a proper way and not just creating a smoke screen and then not doing anything about the problems.
Order, please.
Questions and comments. The Honourable Member for Laval-les-Îles. Thank you, Mr. Speaker. I would like to thank my colleague for this great cry from the heart to women in developing countries. I would add that many of the factors that she talked about also apply to women in Aboriginal communities, the First Nations, the Métis and Inuit here in Canada. I know she talked a great deal about abortion. I feel that reproductive health is one aspect, but there are other aspects as well. I would like to hear her tell us something about reproductive health and what that might include. The Honourable Member for Laval. Thank you, Mr. Speaker. I would like to thank my colleague, the member for Laval-les-Îles, for her question. It is true that abortion is not the only issue in the debate here today. It is certainly one issue. The contraception is also very important because it can help women and young girls. We know that in Africa, there are many young girls who are married at the age of 9 or 11. They have no choice. They have no access to contraception, no way of planning their family, and they often have miscarriages. They are too young to be pregnant and to endure childbirth and raise these children. The other aspects of this motion are very important, and we will be supporting it in the Bloc Québécois with pleasure. We believe that all tools need to be made available to women in developing countries. We have less than 30 seconds for the Honourable Member for Burnaby, New Westminster. Thank you very much, Mr. Speaker. I enjoyed the speech by the member for Laval. We are currently in a crisis. We know that in the next half hour, 30 children will die and many women will die. This is a crisis, certainly. Stephen Lewis, the ambassador for the United Nations, has said that this is that what is happening here is smoke and mirrors by this government, and nothing really is being done to deal with the problems of women and children. So I would like to know from my colleague why the government doesn't understand how important it is to provide resources. Mr. Speaker, I would like to be able to answer my colleague, but I really don't understand how my Conservative colleagues are wired. I don't understand why they don't understand. And yet it is so easy to understand. When a young woman is pregnant and needs help, you have to help her. That is not complicated. It is simple to understand. They don't understand it on the other side of the House. It's a mystery. What can I say? Resuming debate. The Honourable Member for La Pointe de l'Île. Thank you, Mr. Speaker. Standing up to speak after my colleague, who, as usual, made a wonderful speech, which was unusually emotional, and I hope that it actually reached the hearts of our colleagues across the floor, is a huge responsibility. So I will take a very simple approach. It seems to me that this G8 meeting and the G20 meeting are a wonderful opportunity for Canada to say how important it is in meeting the Millennium Goals to deal with this issue, which is maternal and child health. What do those words really mean? We would like this to be an easy matter. We need to provide money to provide clean water in many developing countries. That is an urgent need, of course. But when the situation is such that women have no control over their bodies and they have no access to contraceptives, when women are not in good health and they become pregnant, the pregnancy is a risky one. They have no access to abortion in order to recover their health. These women will either die or give birth to a child who will be in health for his or her whole life. These children are weakened throughout their lives because of the conditions of the pregnancy. So instead of this woman being able to contribute to her own enjoyment, her own have a good life for herself and her children, to contribute to society, either there will be murder committed or a burden for society. So we are very interested in these issues. In January, I was at the Council of Europe, and on Friday at the debate, where usually there are not many people, there were some 100 colleagues. There was a very vigorous debate between two sides, the Liberals and progressive forces, and on the other side, the Conservatives. Are you surprised? I'm sure you are. The document that was... how much time do I have, please, Mr. Speaker? How much time do I have left? 6 minutes? Very well. Thank you. I'll try to go quickly. Let us start with the following words. At the International Conference in 1994 in Cairo, the Conference on Population and Development, the countries agreed that population and development are intricately linked, and that it was important to meet the needs of individuals and societies in the area of reproductive health, education, and so on. The conference adopted a 20-point action plan based on the needs of individuals rather than on demographic objectives. And I continue. Improve equality between men and women, eliminate violence against women, and guarantee their ability to control their reproduction, to make this a cornerstone of population and development policies. Universal education, reduction of child mortality as well as the mortality of women and infants, the access to tools for reproductive health, and to eliminate and treat HIV, AIDS, and other sexually transmitted infections. However, some progress was made, but the problems remain. We have problems with gender equality, with women's health, sexual and reproductive health, including, and this is what is missing in the motion, including family planning and safe abortion services. 113 countries have not achieved the objective of gender equality in primary and secondary education. 137 million women were estimated not to have access to reproductive health services. And 97% of women who died in childbirth were in developing countries. And I would add one more point concerning violence against women, which is a very commonplace problem. And women are also more at risk of being infected with sexually transmitted diseases and HIV because of the sexual practices of their partners. Women are suffering a great deal. We also have the problem of genital mutilation, which creates suffering throughout women's lives. And there are concrete measures needed. So this is a general declaration of principles. And we know that in Quebec we have certain problems, but we can certainly address the issues around the world, the problems of women, older women, girls. Often older women have to look after the children of their children. International assistance must provide the true means for development. We know that there can be no genuine development unless women have access to equality and autonomy in terms of their care and their personal lives as well as control over their bodies. We cannot promote development without having women in charge of their reproduction, their fertility, so that they know that they can help and raise their children. They need access to health and to abortion if the need arises. These are part of the very essence of international assistance. Some people are afraid to say this. Yesterday, I was rereading a document for another reason, because I don't usually do this, but it was the 1988 Supreme Court decision that declared the existing legislation on abortion unconstitutional. The Supreme Court unanimously made this decision, and it clearly indicated that the right to liberty, to freedom, was fundamental, and this freedom included the freedom to choose and to have control over one's body. It is fortunate that we have had a chance to debate this issue. If we cannot have a dialogue, at least we can once again reassert in a majority way here in Parliament that it is essential to have this overall right to maternal and child health. There are 5 minutes remaining for questions and answers after question period. We will start now with statements by members.
Member for Dufferin-Caledon.
Thank you, Mr. Speaker. It is with great honor that I rise today to recognize a wonderful husband, father, grandfather, friend, philanthropist, and member of our community. This is only a brief description of Don Laverty, who will always be remembered for his generous nature, natural business intellect, and dedication to helping youth and recognizing their full potential. Sadly, we lost Don on February 4th. However, he left his mark on our community through his many contributions to Burnside and Associates, his work on the Youth for Christ movement, as well as his involvement in other groups and committees. Don's proudest achievement was his beloved family, his wife Lynn, and his children Leanne, Craig, and Tracy Lee, and his grandchildren Max, Ella, Owen, Rylan, and Abigail. Together with his family, Mr. Speaker, we will miss Don, but we will always be very thankful for his incredible enthusiasm, generous spirit, and immense humility. This is an amazing legacy left by an amazing man. Thank you.
The honourable member for St. John's South Mount Pearl.
The Atlantic Coastal Action Program is a unique community-based program that mobilizes local communities into action on environmental and developmental challenges. The goal is to help restore and sustain watersheds and adjacent coastal areas. ACAP recognizes that local organizations are the most effective champions to achieve sustainability in their communities. ACAP involves 14 nonprofit organizations in Atlantic Canada. In 2008 alone, over 3,000 students and youth participated in soil and water sampling projects, environmental education, outreach and engagement initiatives. Over 1,100 volunteers throughout Atlantic Canada received training and subsequently provided over 35,000 hours of time advancing the region's environment and conservation initiatives. Given this record of success, people of Atlantic Canada want this program to continue. The government is yet to confirm funding, and I ask that they do so.
The Honourable Member for Abitibi, Bay James, Nunavut, EU. Mr. Speaker, this year is the 40th anniversary of the Francophonie, and I am very proud that Val d'Or, in my riding, was named Quebec Francoville 2010. As a result, this city in Abitibi will be in the forefront of all issues. Since 2006, the Office Québécoise de la Langue Française and the Quebec-France Association have chosen a Quebec City to twin with the French one. And as a result, Val d'Or will be twinned with Châtellerault. Val d'Or will also be an international, have an international showcase for the full year. Val d'Orians will also have an opportunity to participate in activities of all kinds. There will be a gala at Théâtre Telbec on March 28th, where people will have an opportunity to meet Olympic medalist Jean-Luc Brassard and to attend meet a number of people. Mr. Speaker, all residents of Val d'Or, like my colleagues, are very proud to contribute to the flourishing of our.
The Honourable Member for British Columbia, Southern Interior.
Mr. Speaker, I stand today on behalf of the Board of Education of School District Number 20, Kootenay, Columbia, who have asked me to read their letter to this chamber. I quote, November 20th, 2009 marked the 20th anniversary of the UN Convention on the Rights of the Child. However, the Canadian government does not appear to take children's rights seriously, nor does our government appear to implement the UN Convention in Canada in order to ensure fair treatment for all children in our country, end of quote. The Board specifically urges the government to ensure greater equity in Canada's national income support programs for children, to put the best interests of the children ahead of federal-provincial funding disputes, to provide help for special needs before young persons become wards of the state or end up in prison, and to provide accountability on how Canada respects the right of children. 45 recommendations from the 2003 report regarding the implementation of the Convention have not been addressed, and the January 2009 report is nowhere to be seen. The Board of Education recommends that the federal government take seriously our responsibility to respect children as persons with human rights, dignity, and values in society, and that it address the issue of child poverty.
Member for South Surrey, White Rock, Cloverdale.
Mr. Speaker, tomorrow is World Tuberculosis Day, a day to focus on the devastation caused by the global pandemic wrought by this bacterial infection. While tuberculosis is a worldwide problem, the hardest hit populations are in Africa and parts of Asia. TB kills nearly 2 million people every year. In the past, I've had the opportunity to travel to Ethiopia, where I saw CETA-funded projects to treat and prevent TB. They're focusing on simple things like hand washing, proper use of latrines, providing clean water, and basic nutrition, and they're achieving solid results. Canadians are helping to save lives from TB, and I was pleased to see our tax dollars being spent wisely and efficiently there, and I strongly support the increased funding our Conservative government announced for foreign aid in our recent Jobs and Growth budget. Thank you, Mr. Speaker.
The Honourable Member for Ajax Pickering.
Opening at the end of this year, the Automotive Centre of Excellence on the campus of the University of Ontario Institute of Technology is helping transform Durham into a global centre of research and development. Attracting the best and brightest engineering minds from across the country and around the world, it will drive made-in-Canada leading-edge innovation with a world-class learning environment. Among its unique capacities will be one of the world's largest and most sophisticated climatic wind tunnels. This technology will permit students and businesses to test cars, transport vehicles, locomotives, aircraft components, new energy technologies as well, such as wind turbines. As a member of the previous Liberal government, I am deeply proud of the Beacon project we announced in 2005 that helped make this project a reality, and of the many visionaries who worked tirelessly to bring it to fruition. In touring the new facility, it is clear the Automotive Centre of Excellence will be an engine for jobs, innovation, and opportunity for our community, and a critical part of Durham's future as a global centre for research and development.
The Honourable Member for Langley.
Thank you, Mr. Speaker. It's a pleasure to offer my congratulations to Trinity Western University in my riding of Langley, British Columbia, which has been honoured by Maclean's magazine as one of Canada's top 3 universities. In the National Survey of Student Engagement and the Canadian Survey Consortium study, Trinity Western University is at the front of the pack. As a Trinity alum myself, I couldn't be more proud. Out of 56 universities, the school ranked first for offering an enriched educational experience. 74% of Trinity's senior population evaluated the experience as excellent. It's also ranked second in following best practices and offering a supportive campus environment. Trinity has surpassed all other universities in Canada in all categories. I congratulate President John Raymond and the faculty and the student body of Trinity Western University for the outstanding achievements. Go Spartans, go!
The Honourable Member for Louis-Hébert. Mr. Speaker, on Sunday, the Paralympic Games in Vancouver wrapped up. And we want to salute the remarkable performance by all athletes who participated. I want to particularly congratulate the Quebec Paralympic athletes who did us proud during the Games. Vivienne Forêt, who is an alpine skier, won no fewer than 5 medals. She had already made it to the podium as part of the Summer Games, and now this has shown her excellence once again by reaching the podium in the Winter Games. I also want to highlight the performances of Sébastien Fortier, Jean Labonté, Hervé Laure, Benoît Saint-Armand, and Arlie Fogarty. On behalf of all of the members of the Bloc Québécois and myself, I want to congratulate once again all these athletes who, through their accomplishments, have done such a good job of representing the Quebec nation.
Honourable Member for Cumberland, Colchester, Musquodoboit Valley.
Mr. Speaker, today our government announced that CAE Inc. has been awarded the training contract for the 15 new Boeing CH-147F medium to heavy lift Chinook helicopters. Through this investment, our government is helping create high-tech jobs in the Canadian aerospace sector. CAE will provide training for the new Chinook aircrews on high-tech flight simulators. As with all major military procurements, the industrial and regional benefits policy ensures that 100% of the value of this contract will be invested in Canada. This means that CAE will generate $1 of economic activity in Canada for every dollar it receives in this contract. with the majority of benefits flowing directly to the Canadian aerospace and defence sector. In addition to helping create high-tech jobs, our government is also providing the men and women of the Canadian Armed Forces the best training and technology to do their jobs both at home and on the world stage.
The honourable member for Toronto Centre.
As someone who studied the Air India bombing of 1985, I became intensely aware of the depth of feeling and the deep divisions in the Indian subcontinent, as well as in Canada at that time. 26 years later, efforts at truth and reconciliation are underway in India, as indeed they are in Canada. Mr. Kamal Nath, the Indian Minister of Highways, has visited Canada several times since 2001. He's visiting Canada now. We hope the government will take the opportunity to discuss all these issues with Mr. Nath. As Canadians, we deeply value our growing ties with India and want them to be strengthened. We also need, as Canadians, to stand for human rights and for truth and reconciliation. Mr. Justice Major's report on the Air India tragedy, in which hundreds died, will shed important light on the events of over 25 years ago. After the assassination of Indira Gandhi, thousands of Sikhs were killed and other members of the Indian community lost their lives as well. It is clear that many deep wounds have not yet healed. It will require openness and mutual respect to get through a difficult time in the lives of many of our fellow Canadians. Thank you, Mr. Speaker.
The Honourable Member for Montmagny, Lille, Kamouraska, Rivière-du-Loup. Mr. Speaker, this morning in Montreal, the Minister of Public Works and Government Services and the Minister responsible for the economic development regions of Quebec announced support for the creation of new jobs in the aerospace industry. This is excellent news because there will be direct and positive benefits for Quebec and Canada. In fact, CAE Inc. has been awarded a contract worth $250,000 for the 15 new Boeing CH-147 Chinook medium to heavy lift helicopters. Training will take place on high-tech flight simulators. This project will enable us to create 240 new jobs, 40 new jobs over the next 20 years. This contract will also make it possible for the men and women of the Canadian Forces to have access to the best training and technology to do their jobs at home and on the world stage. Mr. Speaker, our Conservative government continues to work to create jobs. This is what Quebecers and Canadians want. The Honourable Member for Outremont. Mr. Speaker, on the weekend, a synagogue in Outremont was vandalized. Books and other sacred holy objects were damaged, and swastikas were painted.
Havas Israel congregation, and in particular to Rabbi Hirsch and my friend Meyer Fag, our sincerest expressions of support and understanding in the face of this anti-Semitic attack. Mr. Speaker, the painting of swastikas as an expression of hatred is particularly disgusting in the case of a congregation that includes several Holocaust survivors. As Martin Luther King once said, he who passively accepts evil is as much involved in it as he who helps to perpetrate it. He who accepts evil without protesting against it is really cooperating with it. Let's hope that as the swastikas are removed, the hatred that led to this attack, will always be denounced in all of its forms, Mr. Speaker.
The Honourable Member for Lévis-Bellechasse. Thank you, Mr. Speaker. The comments by the Bloc leader who dared to compare his party to the French resistance are inappropriate, and he should apologize immediately. It's an insult to taxpayers who have been paying his limousine and his salary for 20 years. And we're not talking about the generous government pensions. We're talking about a generous golden pension. According to branchez-vous.com, this member would have investments in the LEO program, and these investments are in the oil sands. So this is hypocrisy. It's hypocrisy that is as crass as it is glaring. It's good for his portfolio, but not for Quebec, Mr. Speaker. In fact, this member should stop resisting and should work for a strong Canada, a strong Quebec within Canada. The Honourable Member for Trois-Rivières. Mr. Speaker, as a critic for natural resources, I would like to take advantage of International Water Day, which took place yesterday, to make my colleagues aware of how important this resource is. It's too often neglected. Quebec has 3% of the planet's fresh water supply, and more than 10% of the territory of Quebec is covered in water. While some 40% of the population on the planet is struggling to have access to this essential resource, we have an opportunity to live in a country where access to drinking water is not a daily concern for us. An abundant supply, however, does not mean that we should waste it. On the contrary, this privileged access to blue gold is something that is such that it's our duty to take care of it and to leave water supplies for future generations. I would therefore call on my colleagues in this Parliament to walk the talk and to promote a responsible use of this wealth. Water is not a resource like the others, and we must all protect it.
The Honourable Member for Eglinton Lawrence.
Mr. Speaker, during prorogation, the Minister of Transport announced that he was increasing the air security tax by a stunning 250% over 5 years. Troubling? In 2002, the then transport critic, now Minister of Heritage, issued a press release entitled 10 Reasons to Hate the Air Tax. He said, "This tax grab represents one of the most arrogant, wasteful, and irresponsible public policy decisions ever made by Canada's government." In another release, he said, "This is stunning proof of failure to understand basic economics." And further, the government should pay for increased air security from general revenue and should stop fleecing flyers. Well, now that he's at the cabinet table, is the former critic for transport content as his cabinet colleagues, quote, fleece flyers, end of quote, to the tune of $1.5 billion? Oh!
Member for Prince Albert. Order.
Mr. Speaker, this coming weekend, Liberals will gather in Montreal for their Spenders Conference, and make no mistake, they're planning big, expensive programs that will come with high taxes and big price tags for Canadian families. However, Mr. Speaker, I couldn't help but notice that out of the more than 50 guest speakers at the Spenders Conference, not a single one of them was from my home province of Saskatchewan. Is the Liberal leader suggesting that the good people of Saskatchewan don't have any ideas? Apparently, not even the member from Wascana has any good ideas. Because like the rest of the Liberal MPs, he didn't make the invite list. Mr. Speaker, Canadians know that when the leader of the Liberal Party holds a big fancy spenders conference, the only thing that will come out of it are new and creative ways to raise taxes on Canadian families. That's because the leader of the Liberal Party isn't in it for Canadians. He's only in it for himself.
Order. Oral questions. Questions orales. L'honorable chef de l'opposition.
The Honourable Leader of the Opposition.
Mr. Speaker, the Prime Minister keeps changing his story on maternal health and family planning at the forthcoming G8 summit. First, he said no to family planning. Then he said yes, maybe. Nobody actually knows where this government is. Now's the time for clarity. Will the Prime Minister support the Liberal motion now before the House? It reaffirms the Canadian position maintained over the last 25 years. Will he support this motion, yes or no? The Right Honourable Prime Minister.
The government's initiative on maternal and child health is very clear. Our objective, of course, is to work with our partners around the world to do many things that can be done at reasonable cost to save the lives of women and children. And, Mr. Speaker, we're looking at a range of options in that regard. Obviously, we'll take the best scientific advice. In terms of his motion, Mr. Speaker, even his own member from Mississauga South says he is just, the leader of the opposition, is just being opportunistic. So, Mr. Speaker, I'd encourage the Liberal Party to worry about saving the lives of mothers and children and not about playing petty politics.
The Honourable Leader of the Opposition. Order. Mr. Speaker, the issue here is the consistency and coherence of Canadian policy over the last 25 years. Does he support or does he reject that policy? Our motion calls for the government to fund all family planning options. That's been the policy of Liberal and Conservative governments over 25 years. It's what the government itself agreed to in the G8 communique last year. Why did the Prime Minister sign that communique if he had no intention of keeping his word?
The Right Honourable Prime Minister.
Of course, Mr. Speaker, we will be keeping our word as we go forward with this initiative. The real issue here, Mr. Speaker, is the Liberal Party and the leader of the Liberal Party trying to be too clever by half. And now he has divisions, even in his own ranks, on that issue, Mr. Speaker. The fact of the matter is, Canadian people want to do what they can, cost-effectively, to save the lives of mothers and children. They are not interested in reopening abortion. They are not interested in playing petty politics in the United States.
The Honourable Leader of the Opposition. Order.
Mr. Speaker, I'm not trying to change the status quo. I'm trying to affirm the Canadian status quo, which we have had for 25 years. Canada has supported family planning outside the country as it does inside the country. If the Prime Minister weakens family planning outside of Canada, he will weaken family planning within Canada. Will the Prime Minister maintain the consistency of Canada's policies of the last 25 years, yes or no? The Right Honourable Prime Minister. Mr. Speaker, the government is clear. Our objective is to save the lives of women and children worldwide, and we've examined all possible options. And we are going to help with contraception, but the Leader of the Opposition is acting in an opportunistic way, and we shouldn't be dealing in petty partisan politics. What we want to do is save lives.
Member for Labrador. Order.
Mr. Speaker, the Conservatives have changed their minds on a lot of things lately. The national anthem, community access sites, the distribution of parliamentary junk mail. First Nations University is another example of where this government needs to change its mind. No one is asking the Prime Minister to support the mistakes of the past. No one condones those mistakes, but they are past. They're now fixed, thanks to courageous people like Chief Lonechild and the President of the University of Regina, Dr. Timmins. Will the Prime Minister give the new regime, not the old one, but the new regime, a chance?
The Honourable Minister of Indian Affairs and Northern Development.
Speaker, of course, we continue to support Aboriginal learners across the country. We, even at First Nation University, 2/3 of the students there receive funding under our post-secondary education programming. And of course, Mr. Speaker, all institutions can apply for funding under the Indian Student Support Programming, which is available to all post-secondary institutions across the country. But Mr. Speaker, when they're talking about the old days like this was many years ago. It was a week ago we found out hundreds of thousands of dollars are missing under the scholarship program designed for kids. And now this last week, the administrator's been dismissed, Mr. Speaker. The problems still continue there, and there's more work to be done.
The Honourable Member for Labrador.
Mr. Speaker, the financial situation at First Nations University has changed. The Minister knows that. The new arrangement puts money management in the hands of the University of Regina. First Nations University will concentrate on its academic work, which has always been high caliber. There are thousands of success stories, people who are now contributing to Canada as doctors, dental technicians, lawyers and social workers, teachers and scientists. I ask again, why is the government so determined to kill rather than fix this vital educational institution?
The Honourable Minister of Indian Affairs and Northern Development.
Speaker, it's important to know that, just to counter the impression that the Liberals are leaving, that less than 5% of Aboriginal learners go to First Nation University in Canada. So it's not like there isn't other options. But, Mr. Speaker, more importantly, as the Education Minister from Saskatchewan has said, there is no firm proposal on the table. This is, I hate to say it, typical of the Liberals, which is to pull out the pocketbook, sign the bottom line, tear off the check, and say, why don't you see how you can spend it?
Another blank check.
The Honourable Member for Laurier-Sainte-Marie. Mr. Speaker, with respect to harmonizing the GST, the federal government is doing its utmost not to come to an agreement with the Quebec government, and yet Quebec did in fact harmonize its sales tax despite what the federal government has implied. Result, Quebec still hasn't got the $2.2 billion that the federal government owes it for having harmonized in 1992. Will the Prime Minister finally admit that he has no intention of coming to an agreement on harmonizing the GST and paying the $2.2 billion it owes Quebec? The Right Honourable Prime Minister. Mr. Speaker, this is not true. We are coming to an agreement, trying to come to an agreement with Quebec. We've signed agreements with 5 other provinces, and these are agreements that work. There are arrangements with other provinces, and we're trying to come to a similar agreement with Quebec, and I hope that in our good faith negotiations we will be able to come to an agreement. The Honourable Member for Laurier-Sainte-Marie. Mr. Speaker, there has been an agreement since 1992. And in the budget of 2006, this government said that Quebec had harmonized its sales tax with the GST, and that other provinces should do as Quebec did, and the Atlantic provinces did. So let him reread the 2006 budget. The fact is they owe $2.2 billion to Quebec. Full stop. The Right Honourable the Prime Minister. Mr. Speaker, quite the contrary. The leader of the bloc is talking about 2 kinds of agreements with 5 provinces. We have agreements which create a harmonized tax administered by the federal government, and we pay a certain amount of money for this arrangement for other provinces to collect the tax. In the case of Quebec, Quebec administers the 2 separate taxes, and we pay Quebec each year. The Honourable Member for Repentigny. Mr. Speaker, not only has the Conservative government refused to compensate Quebec for harmonizing the GST and the QST, but its budget has nothing to increase transfers for post-secondary and education and social programs, and to return to the indexed levels of 94-95. Does the government understand that because of its obstinacy, Quebec is losing a minimum of $800 million a year in transfers for post-secondary education? The Honourable Minister of Finance. The Prime Minister has already said this. We are continuing our negotiations, and we want to come to real harmonization. The Honourable Member for Repentigny. Mr. Speaker, I think the Minister was on the wrong track. Besides depriving Quebec of transfers for education and cutting into research programs, the government has now decided that bursaries and scholarships for postdoctoral students will be taxable, and this will cut into these students' meager incomes. This reckless decision may lead to a brain drain and discourage leading-edge research. How is it that this government is so lacking in vision? The Honourable Minister of Finance.
We very much welcome the creation of $45 million worth of postdoctoral fellowships. Indeed, it was the university community, including the university leadership in Quebec, at Laval and McGill and others, that asked for this. And now some are suggesting that at $70,000 a year, a postdoctoral fellowship ought not to be taxed. Say that to the rest of the Canadian people that earn $70,000 a year and pay their fair share of Canadian taxes.
Right
The Honourable Member for Toronto, Danforth.
Mr. Speaker, the CRTC was supposed to settle the battle that's going on between the broadcasters and the cable companies. You've got the broadcasters saying that they can't deliver local programming without getting a cut of the cable company's profits. You've got the cable companies saying that the broadcasters are spending too much on American TV. The fact is that they're both right, and the CRTC didn't solve either of the problems. So why won't the government simply instruct the CRTC to stand up for the public interest and solve this dispute instead of leaving it entirely to their big corporate broadcasting and cable friends?
The Right Honourable Prime Minister.
I'm not sure what position exactly the leader of the NDP is expressing. Obviously, we asked the CRTC, Mr. Speaker, to look at that question. The government itself has indicated in the past that we would obviously have concerns with taxes or fees imposed upon consumers. CRTC has delivered some recommendations and is taking this matter to the courts for further opinion, and will watch for the outcome of those deliberations.
The Honourable Député de Toronto.
The Honourable Member for Toronto Danforth. There's another problem, Mr. Speaker. That is that the CRTC has abandoned CBC Radio-Canada. The Minister of Heritage has forced the CBC to cut services and to lay off workers. They say that the public broadcaster must compete on the same footing as private companies. But the CRTC has given money to the private sector and excluded the CBC. Will the minister tell us how this is logical? The Right Honourable, the Prime Minister. Mr. Speaker, it's not up to me to explain the decisions of the CRTC. It's an arm's length organization. But, Mr. Speaker, the fact is that the CRTC is studying the funding of private networks in Canada. That's what they're analyzing now. And as for Radio-Canada, it's already funded by taxpayers, Radio-Canada CBC, funded to the tune of billions of dollars a year.
Speaker, here's the Conservatives' record on this. They precipitated a crisis at CBC that has forced the shutting down of local broadcasting and thrown hundreds of people out of work. And then cable rates keep climbing, despite their promises that deregulation was going to do something about that. And more money than ever is spent on U.S. programming instead of being invested in Canadian creativity. So the question is, will the Conservatives let their cable buddies go out and gouge Canadians increasingly with increased fees, or will they stand up for Canadians for a change?
The Right Honourable Prime Minister.
Well, Mr. Speaker, I have a feeling the position of the leader of the NDP is evolving as he asks his questions. Mr. Speaker, just if I could point out two facts in response to that. The first, of course, is that this government has funded the Canadian Broadcasting Corporation to record levels, $1.1 billion per year, Mr. Speaker. In the case of this decision by the CRTC, it's seeking further advice from the courts. Mr. Speaker, the government has indicated we are obviously concerned about anything that would impose fees upon consumers without their consent.
The Honourable Member for Random, Buren St. George's.
Mr. Speaker, this morning before the Justice Committee, the Minister of Justice refused to say that solicitor-client privilege does not apply to Mr. Iacobucci's employment with the government. This fits into a 3-year pattern of deny, deflect, and delay. Conservative stamina for subversion seems to be limitless, but we will continue to seek the truth. Can the Minister tell the House, will the Minister be able to silence Mr. Iacobucci by using solicitor-client privilege?
The Honourable Minister of Justice.
Very clear, of course, is to cooperate with Justice Iacobucci and make all relevant documents available to him. Now, his will be an independent, comprehensive, proper review of all these documents, and I know that he'll want to work as expeditiously as possible, and the opposition should let Justice Iacobucci do his work.
The Honourable Member for Random, Buren St. George's.
It's interesting, Mr. Speaker, that the Minister refused to answer the question. The Minister of Justice said today that Mr. Iacobucci has received some documents and that he will be able to receive any documents that he needs. But who determines need? Is it the government's position that Mr. Iacobucci will receive every single document he asked for from 2001 to today from any department, PCO, PMO, and the Afghanistan Task Force?
The Honourable Minister of Justice.
Speaker, I'd like to refer the honourable member to the terms of reference, Mr. Speaker. These questions are answered there, and as I've indicated before, Mr. Speaker, Justice Iacobucci will have access to all documents, Mr. Speaker, and I've been very clear. This goes back to 2001, Mr. Speaker, the beginning of our involvement in Afghanistan, and this, of course, should have the support of the honourable member.
The honourable member for Honoré Mercier. Mr. Speaker, the CRTC decision on fees excludes CBC Radio-Canada. You know the budgets of CIBC depend on commercial revenue. This is true for all broadcasters, but there will be one treatment for the private sector, another for CBC. The government should see to it that there is a fairly negotiated treatment for CBC. Does the minister find it normal? The Honourable Minister of Canadian Heritage. Mr. Speaker, this was a CRTC ruling, not a government ruling. We have asked the CRTC to consider what distribution fees will mean for Canadians. We know that Canadians have to pay higher taxes.
See, here's what Hubert Lacroix said yesterday. He said, quote, I have a good relationship and I really like James Moore. I think he is on the ball. And with regards to these issues, the CBC understands that we get
results. The honourable member. The honourable member for Honoré Mercier. Mr. Speaker, the minister is saying that the CRTC ruling it's to make, but he's quoting Hubert Lacroix, and here's something else he said. He said that he was furious with this ruling. So, will the minister tell us how that when that does he realize that jobs will be cut when the CBC is cut? The Honourable Minister of Canadian Heritage. Did my colleague hurt himself? Okay. Mr. Speaker, as we've said on several occasions, as the Prime Minister just said, we made specific promises during the last election campaign and with respect to the CBC in order to maintain its budgets, and that's what we did. We increased with each budget funding to CBC, and this with an anti-recession budget. They are the ones that are not working on behalf of CBC. The Honourable Member for Marc-Aurèle Fortin. Mr. Speaker, youth centres in Quebec remind us that the Quebec model is based on rehabilitation and reintegration of young offenders, and this is a model that is held up as an example worldwide. Social workers and lawyers agree, but C4 runs counter to the Quebec approach and emphasizes repression, denunciation, and deterrence. Will the government amend its bill and respect the Quebec model?
Mr. Speaker, the
Honourable Minister of Justice.
We have introduced the Youth Criminal Justice Act give complete discretion to the provinces as it does now, Mr. Speaker. Now, our approach is a balanced one and includes prevention, enforcement, and rehabilitation. If the honourable member really wants to start talking about children, perhaps he could speak about why they would vote against a bill that was directed at child human trafficking, Mr. Speaker. Perhaps you could answer that for the House.
The honourable member for Marc-Aurèle Fortin. Mr. Speaker, we're not talking about child trafficking, but the exploitation of minors. Two Quebec lawyers who specialize in youth law contend that the government already has the tools it needs to deal with juvenile delinquency. Professors Rachel Grondin and Nicolas Bala lament the fact that the government is giving pride of place to deterrence over rehabilitation. Why will the Quebec government not respect the Quebec model, which has proved its worth? The Honourable Minister of Justice.
I would direct the honourable member to the details of the bill. It has complete provincial jurisdiction, as it does now, Mr. Speaker. But one thing we will never do as a government, we will never stop talking about child exploitation. We will always support legislation that cracks down on that kind of activity, unlike the Bloc.
The Honourable Member for Montmorency, Charlevoix, Haute-Côte-Nord. A unanimous motion of the National Assembly calls on the federal government to include the National Capital Commission in discussions on the armory. To one of our questions, the minister responsible for the Quebec City region answered that the commission was consulted. The National Assembly, however, is not talking about consultation, but rather demands that the commission be involved in the reconstruction process. Will the minister respond positively to this request? The Honourable Minister of Intergovernmental Affairs. Mr. Speaker, I repeat that over the two consultations we had, either by Jean Bergeon or another person, the NCC was consulted. But this said, Mr. Speaker, our government has committed to reconstructing the armory. The Bloc voted against it. The Honourable Member for Montmorency, Charlevoix, Haute-Côte-Nord. It's continuing its own work on Parliament Hill, which is now delayed because of the government's waffling. The Commission now has to take part in discussions, be involved in a reconstruction process, and not simply be consulted. When will the minister stop working in secret and respond to what the National Assembly wants, our National Assembly? The Honourable Minister for Intergovernmental Affairs. Mr. Speaker, I would point out to the member that I am a Quebecer too. And the armory is something I care about very much. This said, the National Capital Commission has been consulted, and with respect to reconstructing the armory, the government has the file, and it's up to citizens as to what the next step will be. But the Bloc voted against our objective, and they themselves excluded themselves from the process.
The Honourable Member for Brassard-La Prairie.
The Lawrence River is part of our collective wealth. May I remind the Minister that the St. Lawrence is a river, not a Great Lake. It is an invaluable natural asset that has been at the heart of Canada's history and economy since Confederation. Yet the Conservative government doesn't seem interested in keeping it clean for Canadians. The funding for the protection of the St. Lawrence will expire this year, next week in fact, and the Minister still won't say whether they have a program to replace it. Is there or is there not funding for the sustainable development of the St. Lawrence River?
The Honourable Minister of the Environment.
Thank the Honourable Member for taking me to task on not advising of the government's full investment and taking full credit for the investments that we've made in both the Great Lakes and the St. Lawrence, Mr. Speaker. I'd like to thank her for pointing out that not only does the government invest $54 million annually in the environmental protection of the Great Lakes, but an additional $15 million on the St. Lawrence, Mr. Speaker. An annual investment of $69 million on the health of the Great Lakes and the St. Lawrence. I promise, Your Honourable Member, I'll not make that error again.
The Honourable Member for Brassard-La Prairie. Thank you, Mr. Speaker. But that doesn't answer my question. What's going to happen in a week? The St. Lawrence River, which is not part of the Great Lakes, is a part of our historical natural wealth and part of the life of Quebecers. By, in fact, subsidising the sustainable development of the St. Lawrence, which expires next week, the government is taking no action. the Conservatives are not going to clean the St. Lawrence River, and it's not going to clean itself. Quebecers want to know what's going to happen. Is the government going to extend funding for the St. Lawrence River, yes or no? The Honourable Minister for the Environment. Mr. Speaker, we're going to take action. Environment Canada and the other departments have, in fact, earmarked $15 billion for St. Lawrence action. The government is going to negotiate with Quebec in short order in order to renew the agreement which is expiring. The funding of the ZIP program has been extended for 2010-2011 in order to cover this transition period, Mr. Speaker. The Honourable Member for Westmount Ville-Marie. Mr. Speaker, the government has imposed a tax on research and is in fact no longer exempting postdoctoral students from this tax. This is a new tax which will damage research and hurt research in Canada. After creating fellowships which were supposedly supposed to fund postdoctoral research, the government is now taxing all postdoctoral students, supposedly on the pretext that they want to fund these scholarships. Does the government actually understand what it's in the process of doing? The Honourable Minister of Finance.
Change in the tax policy in Canada with respect to postdoctoral fellowships. It is exactly the tax policy that was followed by the Liberal government. But we made a big change several budgets ago, and that is scholarships. Pure scholarships are not taxable in Canada. But as you know, postdoctoral fellows work just as the Liberal government recognized. They're going to be paid through the fellowships $70,000 a year. And as I said earlier, they should pay their fair share of taxes in Canada.
The Honourable Member for Westmount Ville-Marie.
Mr. Speaker, most researchers recognize that the most productive phase in research begins at the postdoctoral level when a person has acquired the necessary research skills and knows where he or she wants to focus. This is where a researcher has the greatest potential to make important contributions. This is not the time to clobber postdoctoral students with taxes that will reduce their already meager incomes. Mr. Speaker, does the government recognize that it is suffocating research and innovation in this country?
The Honourable Minister of Finance. Order.
Mr. Speaker.
Order.
Only a Liberal, Mr. Speaker, could stand up in this place and say to Canadians that earning $70,000 a year is meager income. Only a Liberal could do that in this place. And you're so out of step, the member opposite. Here's what the presidents of 13 Canadian universities said, including the Honourable Alan Rock, the president of the University of Ottawa. He said, for that vote of confidence in higher education and advanced research, we are indeed grateful to the Government of Canada and to the taxpayers of Canada.
Order. The Honourable Member for Wellington, Halton Hills. Order.
Mr. Speaker, we've said that the recovery remains fragile and that our focus is ensuring that those Canadians who've lost their jobs find work again. Recently, the Conference Board of Canada indicated that Canada's Economic Action Plan, along with provincial stimulus, has created 70,000 jobs or preserved them in Ontario alone. And in the next year, they predict that 40,000 jobs will be created or preserved in Ontario. Can the Minister of Transport tell this House why it is so important that we continue with year 2 of Canada's Economic Action Plan?
The Honourable Minister of Transport.
Working with the Government of Ontario, with municipalities and community groups right across the province, we've seen the creation of some 70,000 jobs, Mr. Speaker. And that's not a government number, that's a number that was released by the Conference Board of Canada. It shows the great partnership that we have on infrastructure. We're able to go 3 times farther, 3 times faster, and thank goodness for our Economic Action Plan, because had we sat back and done nothing, we would see great despair in this country, but we see a lot of hope, we see a lot of opportunity, and a lot of hope for the future, Mr. Speaker.
The Honourable Member for Ottawa Centre. Order.
Mr. Speaker, the government is calling on Haiti to give account. They're also asking NGOs on the ground to be held to account. And yet this government has awarded contracts without a tender process to ATCO, which is a company that is in bed with the Conservatives. Why this double standard? Why rules for friends of the party and different rules for NGOs, Mr. Speaker? The Honourable Minister of Labour.
Government asked for our help, we were able to deliver. This was an emergency situation, so we used our emergency contracting authorities so that we could respond within days as opposed to months. We are proud that we were able to do this and respond to the government of Haiti in their time of need.
The Honourable Member for Ottawa Centre.
Earthquake struck Haiti. Canadians came together to help. They were generous and they continue to support Haiti's rebuilding. But now we are learning that public funds aimed at helping Haitians rebuild their own country are being handed out in untendered contracts to conservative-friendly companies. This is a slap in the face of Canadians who opened their heart and their wallets to help Haiti. When will this government tell this Parliament when the contracts were given, under what circumstances, and why did they ignore the tendering process that we have established in this country? Why the double standard?
The Honourable Minister of Public Works.
Thank you, Mr. Speaker. Well, I can tell the Honourable Member that we acted within days as opposed to months, and we were able to do this because it was an emergency situation, and we acted by using our emergency contracting authorities. He should know that, like any contract, though, it will follow all government contracting regulations, including comparing costs, verifying supplier capacity, and conducting post-contract audits. He should also know that this company has been identified as the only supplier with the world expertise in delivering on a priority basis in an emergency situation.
The Honourable Member for Laurentides-Labelle. Mr. Speaker, after clearly stating that they did not want the G8 to fund family planning initiatives, the Minister of International Cooperation and Foreign Affairs have tried to convince us the otherwise. This flip-flop comes all too late and is therefore suspect. The Prime Minister himself has further confused matters by failing to specify whether abortion will be included among initiatives he'll agree to fund. Can the government be clear for once? Will contraception and abortion be available to women in developing countries? The Honourable Minister of International Cooperation. Thank you, Mr. Speaker.
Speaker, our government wants, and we've articulated this, save the lives of mothers and children based on facts and evidence. But, Mr. Speaker, I'd like to put another fact before us. Between 1993 and 2006, under a Liberal government, the maternal mortality decreased by only 1% per year. That's not a stellar record. The Liberals may want to politicize this matter. We want to really make a difference, save some lives of some mothers, and to help children so that they can have a fruitful future.
The
Honourable Member for Laurentides-Labelle. Mr. Speaker, we can still see the reformers pulling the strings behind this Conservative government. While the other G8 members are trying to improve maternal health in the poorest regions, this government is taking the opportunity to export its outdated ideology. Can the government set the record straight, once and for all? What will be its policy at the G8? Promote a higher birth rate at any cost, or give women the right to choose? The Honourable Minister of International Cooperation.
Mr. Speaker, as I've clearly said, we want to ensure that Canadians are contributing and making a difference in the lives where there is the greatest need. Right now, we see mothers dying, children who are not surviving their infant stage. We want to ensure that we can address these issues. In fact, Mr. Speaker, we know that the main causes of child mortality are neonatal causes, pneumonia, diarrhea, malaria, and HIV/AIDS. Mr. Speaker, we have been doing a good job at this, but we know all the G8 countries will focus on this and actually show real results.
The Honourable Member for Dartmouth Cole Harbour.
Mr. Speaker, troubling questions have been raised about the Enabling Accessibility Fund. 3 years ago it was announced, but it took a full year to release the application details, and it came with a suspicious one-month deadline. Many advocates suggested it was specifically designed for a project in the finance minister's riding. 2 days before the last election was called, the government announced that very project. In fact, if the $45 million made available, $30 million of it went to just 2 projects, both in Conservative ridings. But last week at committee, officials indicated that funding for those projects has been deferred. Can the minister confirm that, and how much of the original $45 million will actually lapse?
The Honourable Parliamentary Secretary to the Minister of Human Resources. Order.
We're quite proud of the program we have to ensure accessibility to those that are disabled. It's projects that we have put forward throughout the country. Mr. Speaker, we've invested significant dollars. Projects include more accessibility to buildings, upgrading and creation of centres, comprehensive centres, to provide a range of services for all of those that are affected, Mr. Speaker.
The Honourable Member for Dartmouth Cole Harbour.
Well, Mr. Speaker, the government has played partisan games with this fund from the very beginning. It was announced 3 years ago, and yet some of that money hasn't even flowed. Canadians with disabilities deserve better than that. Given the political games that the government has played by allocating 66% of all the funding to just 2 projects in Conservative ridings and making the application criteria so strict that many others couldn't even apply for the rest of the funding, what possible reason would Canadians have to believe that the sequel will be any better than the original? Why won't they put aside partisan games and help all Canadians with disabilities?
The Honourable Parliamentary Secretary to the Minister of Human Resources and Skills Development. Order.
Mr. Speaker, we're helping all Canadians with disabilities. Budget 2010 increases the funding by $45 million over 3 years. The Enabling Accessibility Fund makes buildings and vehicles more accessible, helps create comprehensive ability centres. It ensures that every sector that may affect those that are disabled is enhanced by investing significant funds, something the previous government did not do.
The Honourable Member for Trinity Spadina.
Mr. Speaker, once again, the government is showing its hypocrisy. A year after banning anti-war MP George Galloway from entering Canada, the Minister of Censorship has no problem with letting pro-war Conservative come and preach hate. And quote said, and I quote, "The government should be spying on all Arabs, engaging in torture as a televised spectator sport, and dropping daisy cutters wantonly throughout Middle East. I'm all for freedom of speech, but why the double standard?"
The Honourable Minister of Citizenship and Immigration.
Speaker, I'm surprised the member doesn't understand Canadian immigration law. It's not politicians who decide who can come into the country. It's professional members of the public service, Mr. Speaker. And in the case, for instance, of Mr. Galloway received a preliminary inadmissibility determination by an officer of the Canadian Border Services Agency, I presume based on the fact that he publicly and overtly handed piles of tens of thousands of dollars to the leader of a banned anti-Semitic terrorist organization called Hamas. Now, if she has information on anyone who comes to Canada that she thinks would be the basis for an inadmissibility review, I invite her to furnish that to the President of the Canadian Border Services Agency.
Honourable Member for Trinity Spadina.
Mr. Speaker, newly filed court documents reveal that the minister was active in stopping Mr. Galloway from crossing the border. CBSA was told that Galloway could not be admitted under any circumstances. So for this government, a pro-peace British MP is a threat, but a pro-war Conservative who said that Jews needs to be perfected and call Muslim insane savages is fine. Will the minister admit he supports free speech only if he agrees with the Speaker, or is this more Conservative hypocrisy?
The Honourable Minister of Citizenship and Immigration. Order.
Speaker, of course, I and this government support free speech within the Canadian law. If she has information that she thinks would render a visitor to Canada inadmissible, she should supply that information to the CBSA. They can take it into account. They did take into account Mr. Galloway's admission of having financed the leadership of Hamas, which is a banned terrorist organization. Mr. Speaker, I simply made it clear that I wasn't going to grant a ministerial permit to effectively override the inadmissibility determination of the CBSA because I actually happen to believe that we should enforce the law and not allow financiers of terrorist organizations to come to Canada.
Honourable Member for Stormont. Order. The Honourable Member for Stormont, Dundas, South Glengarry.
Mr. Speaker, my question is for the Minister of Public Works and Government Services Canada.
Since coming to power, our Conservative government has worked hard to rebuild and re-equip the Canadian forces after 13 years of Liberal neglect known as the Decade of Darkness. This morning, the Minister made an important announcement in this regard. Mr. Speaker, can the Minister please provide the details to this House?
Good question. The Honourable Minister of Public Works. Order.
Thank you, Mr. Speaker. In fact, Mr. Speaker, this morning I had the honour and the privilege of joining hundreds of employees of CAE in Montreal at their plant to announce that CAE has been awarded a $250 million training contract for the new Chinook medium to heavy lift helicopters. This investment, Mr. Speaker, clearly demonstrates our ongoing commitment and support for the Canadian men and women in uniform. This contract also creates high-tech jobs in the aerospace sector. Indeed, this contract will create 240 jobs for the first 4 years and another 40 jobs for the next 20 years.
The Honourable Member for Halifax West.
This government has dragged its heels on renewing the Atlantic Coastal Action Program so badly, it's had to admit the program won't be ready for April 1st. 16 community-based groups in Atlantic Canada are left twisting in the wind by this government's incompetence. They're waiting to hire students for this summer. They're waiting to start projects to protect our coastal areas. When will the Minister get his act together and release details of the interim funding?
The Honourable Minister of the Environment.
Well, Mr. Speaker, Environment Canada values the relationship it has on conservation. The achievements of this government relative to conservation across our country are enormous. We have expanded the footprint of Canada's national park system by close to 30% in 4 years, Mr. Speaker. We have partnered for close to $1 billion with other agencies, with other investors in terms of conservation. The Atlantic plan of which he speaks is under consideration. It's being reviewed along with all of the other conservation investments that this government has made and will continue to make, Mr. Speaker.
The Honourable Member for Verchères-les-Patriotes. Mr. Speaker, on the 25th of October, the Industry Minister stated that his government had a plan to help promote innovation within the pharmaceutical industry. Since that date, the government has taken no steps to give companies that innovate the right to appeal and have their grievances heard when it comes to competition, so that they can continue to invest in research and development. And yet, innovation is what drives the pharmaceutical industry. When will the Industry Minister issue a regulation on the right to appeal in order to address this flagrant injustice that is the Patent Act? The Honourable Minister of Industry.
Member in this chamber, indeed, we've had discussions with the pharmaceutical sector. They know what is required to move that step forward, which involves frequently the provinces signing off that this is the right thing to do in terms of their budget. So if the honourable member is suggesting that we should override the provinces, including the province of Quebec, he should stand in his place and say so. In the meantime, we're looking for a national solution that involves the provinces and territories.
The Honourable Member for Nickel Belt.
Mr. Speaker, it's been 8 months that the labour conflict at Valley Inco has drawn on. The Minister of Industry has met with the representatives from the company on 13 occasions since the 13th of July 2008. The workers are still waiting for the company to negotiate in good faith. Yesterday, thousands of miners and their families gathered together to fight for fair pay for fair work, which still hasn't come. When is the Minister going to put pressure on the company in order that it negotiate in good faith? The Honourable Minister of Industry.
This is a matter for the provincial jurisdiction. The provincial Minister of Labour is involved in that. It would not help matters if I became involved as well. But the honourable member is incorrect. I have not met with the Valley Inco officials, maybe on one occasion since I was first elected to this place. In fact, I've met with union officials more often than I've met with company officials.
The Honourable Member for Saskatoon, Rosetown, Bigger.
Mr. Speaker, I am appalled that the Liberals are continuing with their beer and popcorn attitude and are yet again bashing the important work of mothers across this country. The Liberal member of St. Paul stated that she did not think that mothers who stay home to raise their children are doing a real job. Can the Minister tell this House what he thinks of these comments and how our Conservative government's support for families differ from that of the Liberals?
The Honourable Parliamentary Secretary to the Minister of Human Resources and Skills Development.
Thank you, Mr. Speaker. Our Conservative government couldn't disagree more with the Liberals.
Absolutely.
Mr. Speaker, let me be clear. On this side of the House, we believe that the most important job in this country is being a mum or a dad. We believe, Mr. Speaker, that families are the foundation of this great nation. We believe that parents know what is best for their children.
Absolutely.
That's why we're providing choice in child care through the universal child care benefit. Mr. Speaker, the Liberals should be ashamed of any comments or any statements to the contrary. Thank you, Mr. Speaker.
I'm afraid that will conclude our question period for today. The Honourable Chief Government Whip is rising on a point of order.
Mr. Speaker, there have been discussions between all parties, and I believe if you seek it, you will find unanimous consent for the following motion. That notwithstanding any standing order or usual practice of the House, all questions necessary to dispose of Ways and Means motion number 8 shall be put immediately at the expiry of the time provided for oral questions on Wednesday, March 24th, 2010.
Does the Honourable Chief Government Whip have the unanimous consent of the House to propose this motion? Agreed? La Chambre l'a entendu.
The House has heard the motion. Is it the pleasure of the House to adopt the motion? Agreed? I declare the motion adopted. The Honourable Member for Joliette on a point of order as well. Thank you, Mr. Speaker. Mr. Speaker, on March 5th last, a statement was made with respect to certain bills, private members' bills, that had been the subject of a point of order with respect to royal recommendation. This is the case of 343, C343, standing in the name of the member for Compton-Stanstead. I do not share, you won't be surprised, the view of the parliamentary secretary to the government house leader stating that this requires royal recommendation. The rule with respect to royal recommendation is as follows, according to Marlon Montpetit. Anything involving the spending of public funding requires royal recommendation. Now, what my colleague is putting forth is employment insurance benefits as part of a family leave to the victims of families of the victims of crime. It would extend to 52 weeks. The Employment Insurance Fund, Mr. Speaker, which is made up of contributions paid in by employers and employees, is what funds employment insurance benefits. Last week, the Prime Minister stated that the organization that manages those funds is independent. As a result, the funding is not public funding. They are contributions paid into the fund by employers and employees to provide benefits when people are in need. In closing, Mr. Speaker, allow me to say that I'm very disappointed in the government with its attitude, stating that this bill requires royal recommendation. It shows that the government is unable to go beyond partisanship in order to help the families of the victims of crime. Thank you, Mr. Speaker. Any other points of order?
Oh, bon. Okay, orders of the day. Order du jour.
Government orders, business of supply, resuming debate on the opposition motion dealing with maternal and child health.
Order, à l'ordre. Resuming debate. Reprise de débat. The Honourable Member For Esquimalt, Wanda Fuca.
Thank you very much, Mr. Speaker, and it's an honor today to speak on this Liberal motion. We have, Mr. Speaker, a moment in time. A moment in time because we're hosting this year's G20 summit, a moment in time when we can have the most profound impact upon the health of the world's poorest than we have ever seen in decades. Mr. Speaker, the reason why the Liberal Party's put this motion, it has to do with a number of comments made by the government that have obscured the message of what we should be doing at this great moment in time. And I'll quote a couple of those comments. The Minister of International Cooperation said that family planning measures are going to never be part of that group, i.e. what will be discussed at the G20 summit. The Minister of Foreign Affairs on March 16th said it does not deal, quote, it does not deal with in any way, shape or form with family planning. Indeed, the purpose of this, i.e. the plan of action in the G20, G8 meeting, is to be able to save lives. Mr. Speaker, what we're dealing with here is not a political issue, but we're dealing with a medical issue, and we're dealing with a humanitarian issue. What I'm going to put forward, Mr. Speaker, is I'm going to describe some of the challenges and problems that are faced with maternal and international health, a plan of action that can go forward to deal with this problem, and I sincerely hope, as all of, I think, colleagues across this House and all of the opposition parties, that the government takes the opportunity that they have and they're able to implement what works from a scientific basis. And we've heard from many of my colleagues today from my party and others how to do this. Mr. Speaker, the challenge is precisely this. Right now, every minute of every single day, a woman dies as a consequence or during pregnancy. That's 530,000 women every single year. They essentially die from 5 largely preventable causes. Women bleed, hemorrhage, babies get stuck, obstructed labor, they get infection, sepsis, they get something called eclampsia, where their blood pressure goes high, they get seizures and they die. And also, 63,000 women a year die as a result of septic abortions. Those are abortions that they go to get because they have no other option. What does this mean? It means when the mother dies, more than half of her children also die who are under the age of 5, Mr. Speaker. And I think many of the members of this House do not understand that. So the death of the mother presages a death of most of her children under the age of 5, which is leaving not only a sea of orphans, but also a sea of children who die that are completely unnecessary. It is also devastating to the economy and the social cohesiveness of these countries. Most, as we've heard before, of these deaths are occurring in developing countries. So how do we deal with this? It is true, and the government is correct to say, that health systems are the key. And it's focusing on the basics. Having a trained healthcare worker, access to the proper medications and diagnostics, clean water and proper nutrition, and access to a full array of family planning options, including, Mr. Speaker, family planning options including access to abortion in those countries where it is legal. And I'll just quote, Mr. Speaker, the World Health Organization really talks about this in a very important way. And they say that family planning, and they define it as such, allows individuals to have the desired number and spacing of children by the use of contraceptive measures and treat involuntary fertility. In other words, family planning is voluntary and contraception is tailored to the individual needs. We can't go and try to foist our morals on other people, and no one is suggesting that for a moment. But we have to be able to support, Mr. Speaker, that which is known to work and that which is legal in the countries that we're trying to assist, congruent with what they want. And why are we so focused on family planning? Because, Mr. Speaker, if you can provide people with family planning, you will be able to save more than 1/3 of the 530,000 women who die every single year while they are pregnant. Imagine that. 1/3 of those women's lives will also be saved, including, Mr. Speaker, 50% of the children that die during early childhood, their lives will also be saved. So if the government wants to truly save lives, then they absolutely have to follow the science, and they have to follow enabling people to access a full array of family planning options. I might say, while the government has spoken about not opening the door on the abortion issue, we say, amen. Because if you don't want to open the door of the abortion issue, then the logical conclusion of this is that you have to give people the rights that are currently in existence. And those rights, Mr. Speaker, include in our country a woman's right to be able to have access to a safe abortion. Why, Mr. Speaker, is the government choosing to pursue preventing women in other countries from having the same rights as women in our country do? In fact, if women in Canada and men in Canada didn't have access to a full array of family planning options, we would have a much higher rate of maternal mortality and infant mortality in our country. Now, mind you, I'll get into this later, in our country things are not all homogenous. There are segments and elements in our country, particularly in First Nations communities and in rural communities, where the maternal mortality and infant mortality rates are too high. I think most Canadians would be shocked to know that our country, that spends the 5th highest amount of spending on a per capita basis in the world, has the 22nd highest rate of infant mortality in the world. What kind of a situation is that? That should be a national shame, and the government should work with their provincial counterparts to deal with this, Mr. Speaker. What is also interesting when it comes to family planning is that the reason why this is important from a medical perspective is that if we give women the ability to control their own fertility, in other words, allowing women to space their children out, not have them too young or too old, then what happens, you're able to enable a woman to be able to have her children at the correct number, at the correct spacing. Indeed, the United Nations recognizes the right of women to do this. This is a long-established right, Mr. Speaker, for women to be able to have this particular right. On the abortion issue, in 1994 in Cairo, the United Nations members, including our own, came together and agreed that women should have the right to have access to safe abortions in those countries where it is legal. The interesting thing, Mr. Speaker, is if we're able to get this picture right, if we're able to invest in the health services that I mentioned, the trained healthcare workers, meds, water, micronutrients, I might add, because more than 80,000 women die as a consequence of iron deficiency anemia every single year. And Dr. Zlotkin from U of T and many others in Canada have been champions of the micronutrient initiative that we call pennies from heaven. And we call it pennies from heaven because a small investment will go a long way to being able to save not only mothers' lives, but also children's lives too. As I said before, what is interesting is if we get the health systems right, if we can treat the pregnant woman, which is Millennium Development Goal 5, what is very interesting is that you can also treat 80% of what comes through your emergency department. The big killers, gastroenteritis, pneumonia, tuberculosis, malaria, malnutrition, HIV/AIDS. If you treat and focus on the pregnant woman, Millennium Development Goal 5, you can also treat 80% of what comes through your emergency department. Said another way, there is no single greater input of finances. And the government speaks about this in terms of wanting to be effective, in terms of using the taxpayers' money, which we are all behind. If you want to be most effective and being able to make the most effective, sensible, cost-effective use of the taxpayers' money, you have to, the answer that pops up is family planning. Access to family planning is the most profound, cost-effective way to be able to improve the health of populations, as well as to be able to improve the economy and environments of countries. This is absolutely crucial. So it's hard to understand, Mr. Speaker, when the government speaks about not allowing this to happen. I want to talk also about the government's position on a few other areas related to this. In Vancouver, Dr. Montana Kerr, Evan Woods, and others have come up with a Seek and Treat program for those with HIV/AIDS. In my province of British Columbia, there are 12,000 people who are HIV positive, the highest in Canada on a per capita basis. What Dr. Montana and his team have done at the Centre for Excellence is they've actually put forth a program called Seek and Treat. They've also the champions of the heart therapy, the highly active antiretroviral therapy treatment that they have. And they're going to use this to be able to seek and treat people who are undiagnosed, people who are HIV positive. Why this is so profound, Mr. Speaker, is that the heart therapy allows people who are HIV positive to receive triple therapy. If they receive that, you can drop the viral particles, the viral load so low that you actually prevent people from infecting others. This, in fact, is the most profound and positive and new evidence we have to find a way to curb this pandemic. What is the government doing on harm reduction strategies like this? They've actually taken the Insight program in British Columbia that Dr. Montana and his team championed, and they're actually, remarkably, they're taking this to court to prevent patients from having access to the Insight program that is saving lives. What kind of a government is actually depriving people from being able to access known, proven, life-saving initiatives? And yet that, for all those who are watching, Mr. Speaker, that is what your government today is doing. They are actually standing in the way of life-saving measures. That includes the Insight program in Vancouver, and they're using the courts to do this. When a lower court said, the evidence shows from the Lancet to the New England Journal of Medicine that this particular initiative saves lives, and said governments must allow patients to access this. What does our Conservative government do? No. We can't allow this because it violates our sense of ideology. So they stand in the way, and they're actually going to the courts to block a life-saving measure. Similarly, the reason why the Liberal Party put this motion forward, Mr. Speaker, is that the government has started to change their tail a little bit. And what they're saying is that they're going to not close the door on any family planning options, but we're not going to open the book on abortion. What does that mean? It can mean a lot of things. That's very different from saying we're going to embrace enabling people to access family planning. We're going to bring it to the G8 table and G20 table. We're going to work with the most powerful leaders in the world, and we're going to include this as part of an integrated plan that will save women's lives, men's lives, and children's lives. If, Mr. Speaker, the government does not do this, then not only does it mean the death that could be prevented of millions of women and millions of children, but it also will prevent many men from living too, because and women too, through the HIV/AIDS issue. Because what the government will, in effect, has been saying up until very recently is they're actually not going to promote simple, well-known options for people to prevent and protect themselves from the spread of HIV. What kind of government can possibly get it into their mind that they're going to deprive people from having the tools that they need to have to protect themselves from HIV and other sexually transmitted diseases? That's absolutely inconceivable. What's driving that, unless the government wants to tell us something else, is an ideology. And the reason why we put the reference to President Bush in there is that President Bush put an obligation on U.S. aid and the PEPFAR program to say, we're not going to fund anybody or any group or any country that is going to be in any way, shape, or form enabling women to have access to safe abortions. Now, I want to get into that just for a second, if I may. For the comfort of us in this particular room, this is not something that's well known. I'm a physician. I've worked in Africa, Mr. Speaker. I've worked in right next to a war zone. I've seen some pretty horrible things. And one of the shames of the world is the use of rape as a tool in conflict. In places like the Eastern Democratic Republic of the Congo, 70% of the women in some communities have been raped and gang raped. Mr. Speaker, what option does that woman have if she's being gang raped and she's pregnant? Does the government can they truly look at themselves in their own hearts, in their Christian hearts, if they are Christian, and ask themselves that they can look in that woman's eye and say, we're going to prevent you from having an abortion even though you want one, even though if you take this fetus to term, you will be a pariah, you can't handle it, it's psychologically devastating to you, for whatever reasons that she may have. Do members of the government, if they look in their heart, can they truly think that they could look, if that woman was sitting here today, that they could look in her eyes and say, no, you will not have access to a septic abortion? I would ask them, Mr. Speaker, to reflect on that, because that is the reality in too many countries in the world. Because this is the dark side of too many countries that exist in conflict zones that exist in our world today. We would like to believe that that does not happen, but that is the reality, and I can tell you that is the reality in too many countries in that world. That is why the world has got together behind what is known as an integrated series of options and initiatives that will enable us to save lives, what the government says they want to do, save children's lives, men's lives, women's lives. It is this series, this bucket of solutions that I've articulated here, Mr. Speaker, that are science-based, fact-based. In fact, the Prime Minister, Mr. Speaker, actually supported this last year. What our Prime Minister signed on to at last year's G8 summit in Rome is the following, and I'll quote. The members, including our Prime Minister, committed to, quote, accelerating progress on maternal health, including through sexual and reproductive health care and services and voluntary family planning. Now, people like the Society of Obstetricians and Gynecologists, which Maureen McTeer and Dr. Lalonde and others have been very eloquent spokespeople. Dr. Dorothy Shaw, who is one of the key people and our spokesperson for G8, G20, part of the Partnership of Maternal and Child Health, and others, have articulated very clearly, very dispassionately, very factually, very scientifically, a series of initiatives that Canada can and should embrace, based on the science. Mr. Speaker, I understand the sensitivities members on the other side have on the abortion issue. They may have their personal opposition to it. That's their right. But they don't have the right to deprive other people of that which will save their lives. And that's the crux of the matter, Mr. Speaker, and that's why we have brought this up today. It is also, Mr. Speaker, a moment in time when Canada is going to lead. We are going to lead at the G8, G20 summit. If the government simply puts out these very vague terms about we're not going to close the door on anything in particular, we're not going to open the book on abortion, I say to the government, and we say to the government, come clean on what you're going to do. This is how it can happen. Right now, the Sherpas are meeting, Mr. Speaker. This month, the foreign ministers will be meeting in Gatineau. A month hence, the development ministers will be meeting. What they need to do is come up with an integrated plan. The inputs are known. You can divide it up. Each country, G8 member, takes a leadership role in each of those particular areas. Somebody does health, human resources. Somebody else does water, power, micronutrients, family planning. And what can happen is that country takes the leadership role. The Sherpas should be part of an ongoing working group to implement that plan. So you have one plan of action based on the science, you have one implementing mechanism, and you have one oversight mechanism and reporting mechanism to our taxpayers in our countries. This, of course, should all be transparent. As the Prime Minister has said, he wants transparency and accountability. We're all in favor of that. That's what they need to do. And they need to post it, and they need to record it, what they're doing. They can even partner with different groups that we have in our country. I have an initiative right now with some of our universities, where our universities, it's called the Centers for International Health and Development. Essentially, the government has the opportunity to link up our universities with institutions in developing countries to be able to use our universities as a way to capacity build based on what the recipient countries want to have. That, Mr. Speaker, is a functional way that the government can implement a lot of these, partnering with NGOs, partnering with our universities, partnering with international partners like UNFPA, domestic partners like ACPD and others, to actually implement what we know needs to be done to save lives. What is unacceptable and will not be acceptable is that our party is simply not going to let the government off the hook. We are not going to simply buy into vague statements by the government that is meant to obscure this issue, but we will work with the government to implement that which is necessary to save mothers' lives, men's lives, and children's lives. I see my time is almost up, Mr. Speaker, but I just want to appeal to the sense of humanity in members of the government. If you can look beyond your own personal ideologies for a moment and put yourself in the shoes of somebody who lives in a country far away, or even in our own country in some communities, and put yourself in the very difficult choices that they sometimes have to make in order to protect themselves, save their lives, that of their children, and that of their families, then I would ask you to see what would you need to be able to save your lives and that of your family. And the only conclusion that you can come up to is to allow others to be able to have access to the same options that all of us have, whether we choose to embrace them or not, to allow everybody to have the full range of primary health care services, including having access to a full range of family planning options, including the ability to have a safe abortion where it is legal. And I ask the members to look in their heart and allow this, because the failure to do this will result in millions of lives. Do you want to save lives or not? That is what I will leave you with.
Questions and comments? The honourable member for Winnipeg South.
Well, thank you, Mr. Speaker, and I'd like to also extend my acknowledgement of the member opposite's delivery and his obvious understanding of so many of the elements that he spoke of. Clearly, as a medical doctor, he has a lot of insight into this important debate, and I would perhaps like to offer a few questions for him. As he heard not only recently but even today, that this policy is not going to include abortion. However, he did recommend that it should, and his leader earlier in question period also indicated that this foreign policy should be based on the status quo that we have in Canada. And so my question for him would be, is there any exclusions from the status quo in Canada that should be made in our foreign policy? Perhaps, say, gender selection, abortions. And Mr. Speaker, could you also have him indicate perhaps if there is a law in Canada against that already, then of course that would be excluded. But is there any other exclusions that he can think of that shouldn't be in the foreign policy that he's suggesting should occur for Canada?
The honourable member for Esquimalt-Juan-de-Fuca.
I'll keep it very simple, Mr. Speaker, for my colleague's question. And that why don't we just embrace that which is already agreed to by the professionals, by the Partnership of Maternal and Child Health, by the Society of Obstetricians and Gynecologists. In other words, Canada should support access to safe abortions in those countries where it is legal. That's the beginning and the end of it, Mr. Speaker. Because that, in other words, will save women's lives and also children's lives too. So I thank you very much for that.
The honourable member for Elmwood Transcona.
Well, thank you, Mr. Speaker, and I want to thank the member for an excellent speech today. I'd like to observe that the Conservatives are conveniently hiding behind the premise that this resolution is anti-American. Yet, President, newsflash for the government, President Obama revoked the global gag rule, which was a policy under the previous American government that barred any foreign organization receiving U.S. funds from providing, advocating, informing, and counseling women on abortion. And he did this in his first week in office. So I'm assuming that the government is okay with that position now, and I don't think that President Obama would be offended or indeed opposed to this motion that the Liberals have presented. So I'd like to ask this member, why does he think that this government continues to hide behind that very thin veil that this resolution is anti-American, so they can't vote for it?
The honourable member for Esquimalt-Juan-de-Fuca.
I thank my colleague for the question, Mr. Speaker, and I think that what the government is trying to do is they're trying to obscure the facts of the matter. And he's quite right. The reason why we brought the reference to President Bush is that President Bush put as a proviso on his PEPFAR monies for HIV/AIDS that there would be no funding for groups that are involved with providing access to abortions. Why this is relevant to the Canadian government is that the Canadian government's actually doing this right now. Through the International Planned Parenthood, the Canadian government has actually depriving and withholding essential monies for Planned Parenthood because Planned Parenthood supports women's rights to have access to safe abortions in those countries where it is legal. I think our viewers would be fascinated to know that our government is using our taxpayers actually in depriving individuals from having access to this, a group that we have funded for many, many years. And that, Mr. Speaker, is an ideological position because the government hasn't said anything on why they haven't provided Planned Parenthood with the monies they need to be able to improve maternal health.
The honourable member for Vancouver Centre.
Thank you very much, Mr. Speaker. Mr. Speaker, there are a lot of controversies going on here. As a physician, I can tell you that the word contraception means stopping people from getting pregnant. So that abortion is not a method of contraception. So if ideologues believe that by funding family planning and contraception, they are supporting abortion, they're wrong. Indeed, I would like to ask my honourable colleague, the thing is that one of the Millennium Goals with regard to this is to decrease the number of unsafe abortions by 50% by 2015. And if we know that good contraception stops people from getting to the point where they need an abortion, isn't this logical? And so we're back to the question, when something illogical goes on in a public policy forum, we have to ask, is this ideological or not? Because isn't that a way of bringing down the number of abortions, good contraception?
The honourable member for Esquimalt-Juan de Fuca.
Well, I thank my colleague. She made a very good point, Mr. Speaker, is that if the government and all of us are interested in reducing the incidence of abortion, then you have to come to the conclusion to allow people to have access to a full range of family planning options. If you allow that to happen, you'll actually reduce the number of deaths from abortions and indeed the numbers of abortions that are taking place because you're preventing unwanted pregnancies. And I remind the government, if they're interested in saving lives, you're actually dismissing the fact that 63,000 women a year are dying of septic abortions. Furthermore, you can't address the HIV/AIDS pandemic without enabling people to have access to condoms. You can't do that. And so why on earth is the government so afraid and taken such a bizarre, anti-scientific position that puts them completely at odds with most of the rest of the world and certainly the rest of the G8 countries?
Honourable member for Winnipeg South.
Speaker, in his last answer to a question I posed, he suggested that we should leave it to the professionals. I'm assuming he means the Canadian Medical Association. So I guess my question to him is, does himself and the Liberal Party agree with the Canadian Medical Association's viewpoint on gestational limits, and is that included in your foreign policy proposal?
The honourable member for Esquimalt-Juan de Fuca.
Like I said before, Mr. Speaker, I'm trying to keep it really simple and do that which is agreed by the medical groups. And the medical groups that I think the member should take a look at, and he'd be well advised to do that, is take a look at what the work done by FIGO, the Society of Obstetricians and Gynecologists, the Partnership of Maternal and Child Health. All of them have come around and done a lot of work for many, many years to be able to advance those series of solutions. I was in Rome last year. I chaired the last two pre-G8 meetings of parliamentarians for international health in Rome last year, Tokyo the year before that. Last year, we hammered out a very constructive series of solutions. Take a look at my website on keithmartin.org. We have that G8 declaration there and the series of solutions that are there that the government could adopt. That plan would be very effective. So, Mr. Speaker, I ask the member simply to look at those groups and he will get the medical position that will be medically based. And in fact, he and his government would be on sound scientific footing when they go to the G8, G20 summits later this year.
Questions and comments, the honourable member for Elmwood-Transcona.
Mr. Speaker, and I'd like to ask a follow-up question to the member. In 2009, in the United Kingdom, there was a white paper on international development calling for safe abortion services where abortion is legal and a rise by 1/3 of the number of contraceptive users. And in addition, the EU has said that their action at the G8 will be based on the 1994 Cairo Declaration, which aims to ensure universal access by 2015 to reproductive health care, including family planning. Now, the question is, why does this government want to be out of step with the majority of the industrialized countries in the world?
Honourable member for Esquimalt-Juan de Fuca.
Well, this is what is inconceivable. I mean, particularly if the Prime Minister talks about honouring past commitments, then what he ought to do is honour the commitment that he signed on to last year in Aquila, Italy. That commitment talks about enabling women and men to have access to a full range of family planning options. It also talks about access to, importantly, and the government has said this correctly, access to skilled birth attendants. And I look at the work that Dr. Paul Farmer has done with his partners in health is a good model that the government could adopt and work with the other countries to deal with. Not only, and it would be terrible, Mr. Speaker, if this issue got simply bogged down on the abortion issue. That access to safe abortions is part of the solution. But it's also, as I said before, access to skilled birth attendants, meds, diagnostics, cold storage, micronutrients, and clean water.
May please do débat.
Resuming debate. The Honourable Member for Lévis-Bellechasse. Thank you, Mr. Speaker. I'm pleased to take part in this debate today, and I'd like to inform you that I will be dividing my time with my colleague, the member for North Vancouver. Today I will talk about the fact that our government wants to provide aid for children and young people that is effective, better targeted, and transparent. And Mr. Speaker, our government, or 2 months ago, our Prime Minister indicated his will to play a leadership role in the G8 summit, which will be held here in Canada. And his priority is to help women and children in the poorest countries. Our government understands that success, from the point of view of development, is easier to obtain when children and young people have a good start to life. This is why the future of children and young people is a basic priority for CEDA, which is continuing its mandate, which is to coordinate international aid from Canada to help the least advantaged. The present generation of young people has never been so numerous. Now, the present generation of young people, I was saying, have never been as numerous. In fact, close to half the world population of 6.8 billion people they are 25 years of age or less. And of these, Mr. Speaker, almost 90% live in developing countries. When they get the health care and the education they need, these children and young people can grow and thrive and contribute to society. But many of them have to deal with obstacles. The lack of access to services, or else the poor quality of services, are factors which threaten their well-being and the survival of children and young people. Too often they are victims of violence and exploitation and negligence, especially in fragile states in a conflict situation. It's particularly so with girls and young women whose most fundamental rights are far from being respected. So they are less educated, less healthy, and less likely to contribute to society. Mr. Speaker, wherever they are in the world, wherever they live in the world, children and young people have the right to live in a secure environment free of violence and discrimination, and this is not always the case. Our government understands this fundamental principle, and through CEDA we are implementing a strategy for children and young people which will allow more young people to contribute positively to society.
As far as these children and young people are concerned, it's clear that action needs to be taken. The lack of education and skills, inadequate investment in programs for girls, violence and mistreatment, high mortality rates for mothers and children, without of course forgetting the exponential demographic growth, are all factors which seriously jeopardize the current generation of children and youth. As part of CEDA's strategy, there are three components: survival of children, including maternal health, access to quality education, and a future for children and youth. It's important to pursue our initiatives for the survival of children, given that almost 9 million children under the age of 5 die annually from avoidable and treatable illnesses. But to begin with, we need to look after mothers. In developing countries, each and every minute a woman dies during childbirth or pregnancy. So we need to accord as much importance to maternal health as to the survival of children. Mr. Speaker, our government has clearly voiced this commitment when the Prime Minister announced in January that maternal and infantile health would be key components at the G8 summit this year. Canada intends to work in collaboration with its G8 partners to develop a global approach in order to improve maternal health and health of children under 5 years of age, and to concretely advance the millennium development objectives with respect to health. Second CEDA strategy, education. A educated labour force is key to the sustainable development and the reduction of poverty. Access to education has improved in developing countries, but still today, for financial, social and health and safety reasons, 72 million children, including 39 million girls, do not go to school. Education of our children is a priority. Our government is working on strengthening the national education systems through training teachers, developing relevant programs of study and improving teaching material. Mr. Speaker, Canada's efforts to provide better teaching to a greater number of children and young people in developing countries is an initiative we are taking in order to have better structured education systems so that young people, particularly young girls, get the basic skills they need to become productive citizens. Mr. Speaker, in many developing countries, violence, mistreatment and exploitation, including child trafficking, are some of the worst ways children are treated, including forced child labour. Girls are particularly vulnerable, just like as are the poorest and marginalised youth. If we set aside questions of protection and safety, investing in health, education and other areas will have no sustainable spin-offs for the life of children and youth. Children, as a vulnerable group in society, are entitled to a safe environment in which they can flourish, grow and development. Canada will ensure that legal frameworks are developed with the countries concerned so that more and more children, particularly girls, are protected from violence, exploitation and mistreatment. Mr. Speaker, CEDA and our government hasn't chosen these priorities by a chance. They're deliberate. We've consulted many stakeholders, including NGOs, other governments and donors worldwide, in order to develop a strategy which will reduce poverty and give an increasing number of children a chance to lead a productive life, to be healthy and to be protected against violence and discrimination. Mr. Speaker, in closing, I'd just like to remind you that under the Liberals, the international aid strategy was inconsistent. They handed out money right, left and centre without actually accomplishing anything. Our government is focusing our bilateral aid in 20 countries in which it's possible to change, really change things. The Prime Minister wants this issue, that is maternal and children's health, at the centre of the G8. We showcased this in Haiti when the natural disaster occurred. Rhetoric is all well and good, but our money, our manpower and our initiatives what counted when we assisted the Haitian population, and in particular women and children in Haiti. So, Mr. Speaker, we're in favour of focused international aid in order to provide for concrete goals. Questions and comments.
Member for Squamish, Wanufuka.
Thank you very much, Mr. Speaker. I'd like to ask my honourable colleague whether or not he feels that women in developing countries should have the same rights as women in Canada, all things being equal. In other words, where women in developing countries, where access to family planning and abortion is their right to have access to, does he not think that those women in those countries should have the same rights as women in Canada who have those rights, and that Canada should take a leadership role in working with other G8 countries to ensure that family planning and access to safe abortions in those countries where it is legal must be something that should be dealt with if you're going to address the issue of maternal and childhood mortality?
The Honourable Member for Lévis-Bellechasse. Thank you very much. I'd like to thank my colleague for his question. I'm glad that I agree on a particular point with my colleague across the way, and that is that Canada is playing a leadership role among G8 countries this year by making child mortality one of the key issues. We're going to work alongside these countries. We're going to consider all our options that will lead to concrete results, as we have done since we came into power. Questions and comments?
Well, thank you, Mr. Speaker, and I want to thank the member for his comments. Mr. Speaker, according to the World Health Organization, the first step to avoiding maternal deaths is to ensure that women have access to family planning and safe abortion. Family planning could prevent 25%, Mr. Speaker, of maternal and child deaths in the developing world by preventing risky births that are too close together, too early, or too late in a woman's life. Mr. Speaker, modern contraception helps fight the spread of HIV/AIDS by allowing HIV-positive women to space births for optimal health and access services to prevent mother-to-child transmission. There are a lot of reasons why all the developed countries are moving in one direction. And the question is, why does this government have such reluctance and resistance to in terms of progress that we're seeing from other countries? Why is it so reluctant to support this resolution, which doesn't seem like there's a lot of objectionable parts to it, other than what some members across feel as anti-American?
The Honourable Member for Lévis-Bellechasse. Yes, I'd like to thank my colleague for his question. Yes, indeed. Just like many of my colleagues have said today, there are many doors open to many options, and contraception is one of those options. But we shouldn't just focus on one initiative, rather on a whole array of initiatives, global initiatives. We know that drinking water, clean drinking water, is very important and has a major impact. So we need a far-reaching approach. We're ready to work alongside the opposition parties, but of course we don't need to insult our American neighbours in doing so, and to insult the president. All of this can be done with mutual respect, and I think that it is a rule of thumb when it comes to foreign affairs. We were very clear that we wanted to deal with maternal and children's health in poorest countries at the G8 summit, and we're going to work alongside all these countries to find concrete solutions. There is enough time for a very short question.
Yeah, I would like to ask the member, my colleague here, if he can respond to a question under the Liberal government when they were at the helm there. The methodology behind international assistance seemed to be very much a scattergun, shotgun approach, if you will. Throwing money at everything essentially guaranteed nothing was accomplished. And this government has moved to be much more focused in terms of our countries, so we have bigger amounts in our bilateral assistance, where we can really make a difference. And here again, in respect to the maternal health care initiative, that is the point. So I'm wondering if the member could respond in respect to general focus of our efforts in terms of international assistance, different than the scattergun approach of the Liberal Party.
The Honourable Member for Lévis-Bellechasse. Thank you. I'd like to thank my colleague for his question. Now, excuse me, sorry, I'd just like to clarify, Mr. Speaker, that we have... I'd like to thank my Francophone colleagues for helping me out with that popular adage that I was trying to say, but basically we've focused on 20 countries. We want our assistance to be effective. There are 9 million children that die annually before the age of 5 years because of a lack of poor quality of healthcare, lack of poor nutrition, and no access to safe drinking water. And that's why we have established these agreements with the G8. Resuming debate.
Here to the President of the Treasury Board.
Mr. Speaker, we will not be supporting the motion before the House. This motion is a transparent attempt to reopen the abortion debate that we have clearly said we have no intention to get into. By voting against this motion, we are proving that we will not reopen the abortion debate. In addition to the motion contains rash, extreme, anti-American rhetoric that we cannot, as a matter of foreign policy, support. Mr. Speaker, this government cares about saving the lives of mothers and children, and that is why Canada is championing a major initiative on maternal and child health at Canada's G8 this year. As the Prime Minister wrote in his opinion piece announcing this year's G8 meeting, members of the G8 can make a tangible difference in maternal and child health, and Canada will be making this the top priority in June. Far too many lives and unexplored futures have already been lost for want of relatively simple healthcare solutions. End of quote. Our presidency of the 2010 G8 allows us to mobilize our international partners and to work together to take effective action that will improve the lives of millions of mothers and children around the world. In the weeks ahead, we will be consulting and working with other partners, including our G8 counterpartners, to help bring about this change. Cleaner water, more vaccinations, and better nutrition, along with the training of healthcare workers to care for new mothers and babies, will be the top priority in this new maternal and child health initiative. CETA's mandate is to reduce poverty in developing countries, and especially for the most vulnerable populations, including women and children. Through its Children and Youth Strategy, the Canadian International Development Agency is already working to improve vulnerable women's access to maternal health care, reduce sickness and death in newborns, increase immunization, and promote nutrition. And Canada is working with partner countries so that their health systems will be capable of delivering better health services that are closer to home for mothers and children. We have repeatedly stressed the importance of strengthening health systems so that people will have access to quality health services. Canada is blessed with incredible expertise and know-how in maternal and child health. Increasing access to family health services is a key programming area for international organizations supported by the Canadian International Development Agency. In addition, responding to the needs of developing country partners, many of our health services are integrated with other activities in a number of CETA's projects. The need is great, and the opportunity we have to make a difference is real. Canada has a real opportunity to bring the issue of maternal and child health to the forefront of the world stage. The G8 Development Ministers meeting in Halifax will set the stage for the June 1st Ministers meeting. Mr. Speaker, we can't talk about international development without thinking about the context of human rights. Human rights are a central theme of Canadian foreign policy because respect for human rights is a core Canadian value. We recognize that Canadians expect their government to be a leader in the field of human rights by reflecting and promoting Canadian values, including democracy and the rule of law on the international stage. This government is well aware that women and the realization of women's rights are central to achieving sustainable development results. Increasing evidence has demonstrated that equality between women and men is necessary to eradicate poverty. In the service of its mandate and consistent with international human rights standards, CETA seeks to address the barriers of exclusion and discrimination that often exist, so as to extend the benefits of development to the most marginalized peoples and to achieve meaningful development results. CETA is working to integrate equality between women and men and good practice principles of inclusion, participation, equality, and non-discrimination through its developmental work. That's why they figure prominently in all three of CETA's priorities: increasing food security, securing the future for children and youth, and sustainable economic growth. The third priority reflects the fact that focusing on children and youth is one of the best ways to achieve long-term development and poverty reduction. CETA aims to achieve concrete results that will make a significant, sustainable difference in the lives of children and youth. Special attention will be focused on young women and girls, because investment in girls and women brings great social and economic returns to their societies. All children have a right to be healthy, receive quality education, and grow up in a safe and secure society. CETA is committed to helping children and youth in developing countries attain their full potential to become the strong, positive, and engaged citizens of tomorrow. For this reason, on Universal Children's Day, the Minister of International Cooperation outlined CETA's Children and Youth Strategy, which will respond to the needs of the world's most vulnerable and help them to become resourceful, engaged, and productive young men and women. CETA's Children and Youth Strategy will focus on three paths: child survival, including maternal health, access to quality education, and safe and secure futures for children and youth. Under the safety and security path in this strategy, CETA will support developing countries with a view to fulfilling the following priorities for action: strengthen and implement national protection legislation and mechanisms to safeguard the human rights and security of children and youth, and to protect them, particularly girls, against violence and exploitation. Ensure that schools are safe, free from violence, and are child-friendly spaces for learning, and support efforts to help youth at risk find alternatives to violence and crime and engage in constructively as full members of society. Under the child survival and maternal health path of CETA's Children and Youth Strategy, the government will contribute to ensuring mothers and children have access to the services, medicines, and nutrition needed to lead healthy lives. In addition to programming specific maternal health, CETA working to ensure we can make a difference in the lives of children living in developing countries. CETA recognizes that we need to work with our G8 partners, improving maternal and child health. The maternal and child health discussion is not about what we are including or not including. It is about simple measures that focus on saving the lives of 500,000 pregnant mothers who die annually during childbirth and pregnancy. This initiative is about the 9 million children who do not make it past their 5th birthday. This initiative is about providing health services, nutrition, and clean water. I realize that we sometimes tend to play politics in this House. I understand that the job of the opposition is to criticize the government, but I hope that we can eventually find a common ground when it comes to maternal and child health. Thank you.
Questions and comments? Questions and commentaires. The Honourable Deputy de Bonavista.
The Honourable Member for Bonavista Gander, Grand Falls Vista.
Thank you, Mr. Speaker. I just off the top, and the two comments that he said at the very beginning of his debate, I'd just like to question him further on it. The first point was obviously opening the abortion debate, but I don't quite understand where he's coming from on that one. I would like to get his opinion on this particular point. Canada has pledged its commitment to support the Millennium Development Goals, which include universal access to reproductive health, including family planning, which is Goal 5, Target 2. Now, the goal is sometimes referred to as the unmet need to avoid a pregnancy, the number of women having access to modern contraceptives. His opinion on that, not quite sure, agree or disagree. And the first part, anti-American, when in fact in the first week President Obama endorsed this, and Ms. Clinton, Secretary of State Clinton, said in the administration, we are convinced of the value of investing in women and girls, and we understand there is a direct line between a woman's reproductive health and her ability to lead a productive, fulfilling life, commenting about the policy change from when George Bush was in power. So, two questions. Thank you.
Honourable Parliamentary Secretary.
Mr. Speaker, what we've said, and I'll repeat, is that this government is open to looking at all options that will protect the health and well-being of women and children. This includes saving the lives of 500,000 mothers a year who die during childbirth, and 9 million children who don't make it past their 5th birthday. We will look at all options to protect the health and well-being of these children and these women.
Well said.
The Honourable Member for Elmwood-Transcona.
Well, thank you, Mr. Speaker, and I want to thank the member for his presentation today. Mr. Speaker, every year it's estimated that 74,000 people around the world, women around the world, die as a result of unsafe abortions that could be prevented with contraception and access to safe abortion facilities. In addition, to every woman who dies, 20 more experience serious complications ranging from chronic infections to disabling injuries. The budget, Mr. Speaker, the 2010 budget announced a freeze on foreign aid levels, and officials have said that this maternal health program will have to be funded out of the existing aid budget. The question is, how does this lack of resources square with the Prime Minister's newfound interest in fulfilling the Millennium Development Goals?
And the Honourable Parliamentary Secretary.
Mr. Speaker, as I said earlier, that this particular issue is about saving lives, and we cannot stand idle while mortality rates in Africa continue to escalate. And I refer to the UNESCO report that states clearly that the single most effective way to address maternal and child mortality is access to health care and health professionals. And this is consistent with our government's approach to this matter. We have the know-how and we have the ability to save lives, and we're going to use it.
Questions and comments, the Honourable Member for Crowfoot.
Well, thank you, Mr. Speaker. And Mr. Speaker, I would like to say that last night when I saw the motion that the Liberal Party was bringing forward, I was very disappointed. I was disappointed because, again, we see a party that's adrift, the Liberal Party. We see a party that is trying to politicize an issue on the backs of women and children. And I think, Mr. Speaker, that history will say shame, shame on them for trying to accomplish that. I think what we need is to be very concerned with the issue at hand. And, Mr. Speaker, I know it's been brought out in speeches that our government has been very clear about the maternal and child health initiatives that we will be putting forward at this year's G8 meeting. Those who come together are looking forward to the agenda that's been brought forward, a positive agenda that's going to deal with mothers and children and, you know, about saving the lives of 500,000 pregnant mothers every year. This is what this Parliament needs to be concerned with, not a divisive issue that's politicized. The Liberal Party also politicizes an American, former American, and I'm questioning this member as to why they would be so political on an issue like this.
The Honourable Parliamentary Secretary.
Mr. Speaker, I think it's absolutely shameful that the opposition is trying to turn this debate into an issue which is going to be divisive. We are focused on one issue, and that is saving the lives of mothers and children around the world. Exactly. 500,000 mothers a year die during childbirth. 9 million children don't even make it to their 5th birthday. That is our priority. That is our focus. And Canadians can be proud of our Prime Minister for making this the initiative for the June G8 summit.
Exactly. Shame on the Liberals.
Resuming debate, the Honourable Member for St. Paul's.
Mr. Speaker, I am pleased to speak today on the Opposition Day motion, and even though some seem on the other side to feel this is about politics, it's actually about the lives of women and children. The science is clear, the facts are clear, and the statistics are horrific. I've delivered, Mr. Speaker, probably 2,000 babies as a family physician, and I've seen one maternal mortality in my lifetime. It's a day that I will never forget. We had every possible modern medicine technology there in the room to try and save this woman's life, and she died anyway. I've seen many babies die, and to this day feel that every single one of those babies had a family, had grandparents, and had changed that experience changed the life of those families forever. Once as a medical student in the Caribbean, I saw a woman arrive with a temperature of 104, chills and rigors, septic from the effects of an illegal abortion. We actually have to get on with this file. It is one woman dying every minute of every day. That in my lifetime I saw one maternal death, but in Sierra Leone, 2,000 women die in every 100,000 births. That's 2 per 100. This is unacceptable, and we have to do better. But we also have to do better here in Canada, where because of the gap in health status of our Aboriginal peoples, that we still are not doing well enough on the world standard, where we still are losing 5.2 babies per 100,000, when even in Cuba they are able to reach the goal of 4.8 per 100,000 in the last year. The report adding it up, the benefits of investing in sexual and reproductive health care by the Alan Guttmacher Institute in the UNFPA states how sexual and reproductive health account for 1/3 of the global burden of disease among women of reproductive age and 1/5 of the burden of disease among the population overall. It says that HIV/AIDS accounts for 6% of the global disease burden. It says that the need for sexual and reproductive health services, and thus the potential benefit of meeting the need, is greatest among the poorest women, men, and children in the world's lowest income countries. We know that satisfying the unmet need for contraceptive services in developing countries would avert 52 million unintended pregnancies annually, which in turn would save more than 1.5 million lives and prevent 505,000 children from losing their mothers. A woman cannot die from complications arising during pregnancy and childbirth if she is not pregnant. And we know that children do not do well when their mother is dead. Yet by refusing to fund programs that respect women's reproductive rights, including contraception and all aspects of reproductive health services, this government is allowing its ideological differences to get in the way of good health and gender equity. In the Mexico City policy was created in 1984 by the Reagan administration. This later became known as the Global Gag Rule and was a policy of the United States government that barred any foreign organization receiving U.S. foreign assistance from using its own funds or funds from other donors to perform abortions, advocate for the liberalization or decriminalization of abortion in laws and policies, or provide information, make referrals, or counsel women on the procedure, even in countries where abortion was legal. The Mexico City policy was announced at the new restriction at the International Conference on Population Development in Mexico in Mexico City in terms of 1984 by the Reagan administration. This policy was placed till 1993 when, as his first act in office, President Bill Clinton overturned it. Yet on January 22, 2001, President George Bush issued a presidential memorandum reinstating the Mexico City policy. It was his first act as president. On January 23, 2009, President Barack Obama overturned this policy once again. According to the Global Center for Gender and Equality, approximately 500,000 women die from pregnancy-related causes each year, and according to the United Nations Population Fund, 74,000 women die every year from unsafe abortions. They go on to say an estimated 201 million women have an unmet need for family planning. The highest unmet need is in sub-Saharan Africa, where 1 in 4 married women wants to limit or space her births, but does not have access in the services to do so. This lack of access to family planning results in 80 million unintended pregnancies a year. And they go on to say that it is by preventing that if of the 80 million unintended pregnancies each year, 60% end in abortion. The problem was that the global gag rule tied the hands of the trained reproductive health providers because family planning organizations receiving U.S. funds could neither perform abortions for their clients nor advise them. It's women on to where to seek the procedure. As a result, women were not able to turn to trained doctors or nurses for safe medical care. They were therefore left to find their own care, which also often meant an unsafe illicit abortion. Globally, 16 women die every hour from unsafe abortion. Restrictive government laws on abortion often force the practice underground, as the centre said, contributing to the morbidity and mortality rates associated with unsafe abortion. Instead of fostering civil society participation in government and promoting democratic values, they felt that the global gag rule undermined the rights, such as freedom of speech and assembly rights, that their Americans enjoy by prohibiting international organizations from working with their governments. What was worse was the global gag rule also prohibited organizations that provide information and services related to abortion from receiving U.S. contraceptive supplies, such as female and male condoms, birth control pills, intrauterine devices, and other medically effective methods of contraception. As a result, service providers either had to comply with the policy or forego the much-needed family planning. We are hugely concerned on this side that should the government go forward with its plan where it believes it can restrict or cherry-pick parts of a family planning approach, that again, that you will end up with, in effect, the effect of the gag rule. Si la vaccination, l'accès à l'eau potable.
While vaccination, access to drinking water, better nutrition, and better training for health officers are all important for the health and safety of women and their children, their girls, facing the real issues that underlie the problems with maternal health requires a host of options being made available in order to promote education and awareness of family planning and equality among the sexes. Any other action is nothing but a Band-Aid solution.
Newborn and Child Health has produced an excellent consensus document. Their aim is every pregnancy wanted, every birth safe, every newborn and child healthy. They have a plan that will save the lives of over 10 million women and children by 2015. How will it be accomplished? The consensus document could not be clearer. It calls for political leadership and effective health systems that deliver a package of high-quality interventions in key areas along the whole continuum of care. Des systèmes de santé efficaces sont
Effective healthcare systems are necessary in order to target the people who are the most in need, to prevent, treat, manage, measure, and assess all aspects that will have an impact on maternal health, as well as on those living with HIV and AIDS and STDs. I want to thank Janet Hatcher-Roberts, Director General of the Canadian Society for International Health, for her incredible work, which advocates the strengthening of health services in all developing countries.
Say how that this plan would be delivered through strong, well-funded health system with trained, appropriate, and paid health professionals. The continuum of care must include comprehensive family planning, skilled care for women and newborn during and after pregnancy, including antenatal care, quality care at birth, emergency care for complications, postnatal care, and essential newborn care. Safe abortion services when abortion is legal, and improved child nutrition and prevention and treatment of major childhood diseases is explicit in the partnership document in terms of their plan. They also stress that barriers to access must be removed and skilled and motivated health workers be in the right place at the right time, and accountability at all levels is ensured for credible results. I would like to commend Dr. Dorothy Shaw, Canada's spokesperson for the G8-G20, to the Partnership on Maternal Health, and for her excellent work on this initiative. I implore the Government of Canada to take her advice and to put forward at the G8 table the full spectrum of the plan and the consensus document put forward by the partnership. Action Canada for Population and Development, under the leadership of their excellent Executive Director, Catherine MacDonald, has written an extensive call to the action, asking the Prime Minister to assure that he will not change Canada's long-standing tradition of recognizing women's productive rights and access to contraception as part of his maternal health initiative at the G8. ACPD has explicitly called on the Prime Minister to work with Canada's G8 partners to ensure that sexual and reproductive health and rights, particularly to access to family planning, including contraception, will be part of the G8 Maternal and Child Health Initiative. ACPD also stresses accountability, and I'm pleased that the government has stressed that accountability be a focus of this year's G8. At last year's G8 in Italy, the heads of government agreed that maternal and child health was one of the world's most pressing global problems. They committed to accelerating progress on maternal health, including through sexual and reproductive health care and services and voluntary family planning. The Prime Minister promised last year. The Prime Minister must deliver this year. ACPD is calling on Canada's G8 partners to build on, not backtrack on previous commitments. Sexual and reproductive health and rights, especially to access to family planning, including contraception, must be part of the initiative. Therefore, in order to be accountable, this government must honour its own commitment at last year's G8 to accelerate the progress on combating maternal and child mortality, including through sexual and reproductive health and family planning. We know that dividing the G8 is not leadership. It is not leadership for Canada to say, we will do these bits, the other members of the G8 can do the ones that we don't want to do because of our socially conservative ideology. We noticed in the Minister of International Development remarks last week that they, the G8 leaders, not Canada, will chart the way forward to save the lives of mothers and children. They is not good enough. We need Canada to lead by affirming Canada's commitment to providing the full range of reproductive health services and a pledge of financial support befitting the Canadian leadership the Prime Minister has promised. Le ministre du Développement International.
The Minister of International Development was quoted stating that she would not close the door to any option that would make it possible to save the lives of women and children. But there is a huge difference between a door that is open and the presentation by Canada of a consistent, comprehensive plan on sexual health and reproductive services.
I'm particularly concerned in this government's ability to present a comprehensive and coherent plan when we see its own members spreading false information. In a recent editorial, the member for Saskatoon, Wanuskewin, and the member from Saskatoon, Humboldt, told readers that there was no evidence to back up claims that proper education, resources, and support would reduce maternal deaths and complications, in spite of the wide swath of evidence already mentioned in our remarks. And how can we be confident in this government's ability to represent the mothers and children of the developing world when here in Canada they have launched a systemic assault against women's health? The 4 Centres of Excellence for Children's Well-Being, whose job is to put research into practice in early childhood development, in child welfare, in children with special needs, and in youth engagement, did not have their funding renewed under this government's new program review. The Centres of Excellence in Women's Health received informal cuts and are being forced to operate under a new, more narrow and constrained mandate. This government's new program review uses 3 criteria: accountability, cost-effectiveness, and alignment. I find this last criterion particularly worrying. It is a code for the intent of the government to cancel programs that are not aligned with government priorities. It also allows them to cancel programs that they determine are aligned with their strict interpretation of federal responsibility, i.e. health and health care. We are all concerned that community-based programs may be increasingly at risk. In leadership, the first test is always at what is happening at home. And we draw the attention, although admirable, of the Prime Minister to the state of the developing countries in issues like potable water and housing and the deplorable housing conditions. But we actually want them to look at home, to the plight of our Aboriginal people, where there's 17 people living in one home, no running water, as we learned on the reserves in Manitoba in June during H1N1. It is extraordinary that we have to do more at home. It is a national and international embarrassment. We have to begin at home.
The Government of Canada has also refused to provide $18 million over 3 years for the International Plan for Parents which is funding that is absolutely essential if Canada is going to be consistent with the document which is called Rise to the Call Act and honor Canadians' international obligations and past commitments to fund sexual and reproductive health and rights in general.
Family planning is a human rights issue. The Convention on the Elimination of All Forms of Discrimination Against Women, to which Canada is a signatory, says countries must ensure access to health services, including those related to family planning. The International Conference on Population Development at Cairo in 1994 and the United Nations Fourth Conference on Women at Beijing recognized the right of men and women to be informed and have access to safe, effective, affordable, and acceptable methods of family planning of their choice. Without this right to make decisions about fertility and family planning, women's capacity to exercise their own civil, political, and economic rights is limited. The consequence of their absence has serious implications for women and may even jeopardize their right to life. Immediate action is needed. I've said before that it is crucial that politicians do the politics and that scientists do the science, and that the transmission of information from the scientist to the politician is done transparently, accountably, without ideology. I implore this government to listen to the partnership action plan and for the G8 and act in terms of what the midwives and the obstetricians and the professionals have said is an essential, coherent plan, not to cherry pick the bits that they want to do. I would encourage all members of this House, especially my colleagues on the government side, to support this motion. Support the Millennium Development Goals 4 and 5 and ensure that Canada builds on its commitments to include the full range of family planning, sexual and reproductive health options, including contraception, as part of the G8's initiative. The Prime Minister's opinion piece was a beginning. We welcomed it. We now want the real leadership in honouring the 25-year history of Canada in the world and this government's previous commitments in Italy and at the UN. They must put forward a real comprehensive plan based on the partnership of the G8 and full access to reproductive care. They must put leadership-level dollars on the table. Canadians want Canada to lead. We implore you to support this motion.
Is there any comments? Is the Chief Government Whip rising on a point of order?
Yes, Mr. Speaker, I believe that if you seek it, you will find unanimous consent for the following 4 travel motions. That in relation to its study on the state of organized crime, 12 members of the Standing Committee on Justice and Human Rights be authorized to travel to Edmonton, Alberta, and Winnipeg, Manitoba in the spring of 2010, and that the necessary staff accompany the committee. That in relation to its study on the state of organized crime, 12 members of the Standing Committee on Justice and Human Rights be authorized to travel to Toronto, Ontario in the spring of 2010, and that the necessary staff accompany the committee. That in relation to its study on the review of the new Veterans Charter, 12 members of the Standing Committee on Veterans Affairs be authorized to travel to St. Anne de Bellevue, Quebec in the spring of 2010, and that the necessary staff accompany the committee. And that in relation to its study of Arctic sovereignty, 12 members of the Standing Committee on National Defence be authorized to travel to Yellowknife, Northwest Territories, and Iqaluit, Nunavut in the spring of 2010, and that the necessary staff accompany the committee.
So, does the Chief Government have the unanimous consent of the House to move the first motion relating to the Standing Committee on Justice and Human Rights traveling to Edmonton, Winnipeg this spring? Yes. Agreed. Is it the pleasure the House has heard the terms of that motion? Is it the pleasure of the House to adopt that motion? Yes. Agreed. Does the Chief Government Whip have unanimous consent of the House to move the travel motion regarding the Standing Committee on Justice and Human Rights traveling to Toronto? D'accord. La Chambre l'a entendu.
The House has heard the question. Is it the pleasure of the House to adopt the motion?
The Chief Government Whip have unanimous consent of the House to move the motion regarding the Standing Committee on Veterans Affairs traveling to Saint-Anne-de-Belleville, Quebec. Agreed. The House has heard the terms of the motion. Is the pleasure of the House to adopt the motion?
Yes.
Does the Chief Government Whip have unanimous consent of the House to move the travel motion regarding the Standing Committee on National Defense traveling to Yellowknife and Iqaluit? La Chambre l'attend.
The House has heard the motion. Is it the pleasure of the House to adopt it?
Well, I'm up. I might as well mention, conformément à l'article 30.
Pursuant to Standing Order 38, the questions will be dealt with at adjournment tonight. The Honourable Member for St. John's South Mount Pearl, access to information.
Violence in sports. Questions and comments. The Honourable Member for Abbotsford.
Well, thank you, Mr. Speaker, and I wanted to thank the member for St. Paul for her intervention. Unfortunately, I profoundly disagree with most of what she said. As you know, the Liberals are Johnny-come-lately to the whole issue of women's and children's health outcomes in the third world. In fact, for 13 years, Mr. Speaker, the Liberals had an opportunity to do something about it. And yet their policy on international assistance and development failed. It was unfocused. It was ineffective. So our Prime Minister, our Conservative government, finally takes the bull by the horns, and we make it a priority for the upcoming G8 and G20 summits. And what do we receive? Rather than applauding this, the opposition parties want to turn this into a debate on abortion. It's shameful. My question to this member is this. Why, during her 13 years in government, and the previous Liberal government's 13 years of darkness, did they never make this a priority? Former Prime Minister Chrétien, former Prime Minister Paul Martin attended numerous summits, and yet they made absolutely no efforts to make maternal and children's health a priority on the international stage. Why didn't they get it done, Mr. Speaker?
The Honourable Member for St. Paul's.
Well, I think that the Liberal record is strong, and particularly in Prime Minister Chrétien's pledge to Africa, Prime Minister Martin's pledge to not only Africa but our Aboriginal peoples. But I think that the question that we have right now is that when it is clear that Africa has the worst outcomes on maternal child health, how this government could be so inconsistent as to be removing funding for programs in Africa and turning its attention to South America when it is Africa that actually has the greatest need by every indicator that you want to use.
Questions and commentaires. L'honorable député de...
Questions and comments. The Honourable Member for La Salle-et-Mar.
To ask the Honourable Member of St. Paul, I know that she's been consulting quite a bit on the subject that we're debating today, and most recently this month with the W8 group, a group that's traveling across the world to bring awareness to decision makers, and it's a group that is recognized by Oxfam, so I think we can't question their credibility. Would the Honourable Member tell us what their demands were exactly? I think you met with people from India and Malawi, so could you tell us more about what their demands were?
The Honourable Member for St. Paul's.
Well, I think, as the Honourable Member has stated, that in meeting with those people, it puts such a huge human face on what they live every day. To meet with a midwife from Malawi who just only has one pair of hands and has 3-4 women in distress at the same time. This is about trained healthcare providers, but it's the need for comprehensive health systems, of paid workers, and it is about that they can't do it without a comprehensive system. And I think that it requires a coherent plan, but it particularly requires that we listen to the voices of the people on the ground.
The commentaire, l'honorable député de Laval.
The Honourable Member for Laval. Thank you, Mr. Speaker. Mr. Speaker, I listened carefully to my colleague, and I'd like to know, in her opinion, since this morning, the Conservative members have been rising in their place and repeating ad nauseum that we want to reopen the debate on abortion, while it seems that the only people who want to reopen that debate are indeed the Conservatives. What does she think? What does she think of this? What do you think this hides?
Monsieur le Président.
Mr. Speaker, I am in absolute agreement. The debate on abortion is something that happened 25 years ago.
Calling on the government to continue a policy that's been in place for 25 years. We don't want to open it either. This is absolutely ridiculous, and I am so upset that if any one of those members opposite had seen the sickness that we have seen from illegal abortions, that you would not be doing this now. Women have been seeking abortion for as long as they've been getting pregnant. We have to ensure they don't die doing that.
Questions and comments, the Honourable Member for Elmwood-Transcona.
Thank you, Mr. Speaker. And unlike the government member, I actually enjoyed the speech from the member. And but I do want to point out to her that great speeches from the progressive wing of the Liberal Party are not it's not the total goal here. We remember that the Liberals were in power for 40 years, or certainly for 40 years. They've taken the position that 0.7% of the gross national product should be put aside for international development, and yet to this date we still haven't achieved half of that. This morning, the member for Vancouver Kingsway and myself asked successive Liberal speakers this question, to put on the record now whether they, if they form a government in the future, would in fact agree to go back to 0.7% of gross national product towards international development. We would like her to put that commitment on the record now.
The Honourable Member for St. Paul's.
I thank the member for the question, and I am thrilled to be able to say that as working together with our CETA critic, the member from London, Fanshawe, that again we need to redefine what actually is overseas development. Health has not actually been part of the way we've defined development previously. I think developing health systems and developing new approaches to maternal child health is going to be the way we have to go forward. That when we, as a government, sent our lab to Angola to deal with Ebola virus, or when we trained after SARS the Vietnamese lab technicians at our Winnipeg lab, that's never really been included in the 0.7. I think that we want to get there. We want to get there as fast as we can, but I think we have to redefine what international development really means, and it must include health and health care.
Questions and comments, the Honourable Member for Kamloops Thompson Caribou.
Thank you, Mr. Speaker. And I think it's clear that everyone in the House agrees that the rate of maternal, child morbidity is absolutely unacceptable, and that it's a very worthy priority for the G8. But I did listen to the member from St. Paul's, and the very start of her speech, she said, "This is not about politics." This morning in Health Committee, we were sitting in committee listening to very important testimony from veterans, from soldiers, from police, and from an RCMP widow. In the middle of that testimony, it was interrupted by the Liberal Party to introduce this motion to the Health Committee. If this is not about politics, could she please tell me why they would interrupt important testimony from important people, take away from their time in terms of this debate?
The Honourable Member
I
for
thank the
St.
member
Paul.
for the question. The three members of the Conservative Party, Mr. Speaker, weren't even there for the testimony because they were at abortion school learning how not to talk about abortion this afternoon. So from 9 until 10, the Conservative members were in a caucus meeting, didn't have the respect to listen to those witnesses. I won't take any advice from her.
Questions and comments, the Honourable Member for Winnipeg South.
Well, thank you, Mr. Speaker. Just a quick question for the doctor. I know that it's been indicated that the foreign policy you're suggesting would be based on the status quo relative to abortion in Canada. Is there any exclusions from that status quo that you would insert in the foreign policy, such as prevention of gender selection abortion?
Mr. Malloy. The Honourable Member for St. Paul's.
Actually, the policy as presented by the partnership in terms of the G8 is allowing abortion only in the countries that have it legal. But in terms of maternal-child health, I think that we don't. I think that gender selection is certainly not part of my maternal health program. It is actually that is something that is between women, their doctors, and their country. That isn't really what we're focusing on in terms of saving 550,000 lives a year.
Resuming debate, the Honourable Member for Halifax.
Thank you, Mr. Speaker. I'd like to talk about the promise about maternal health and the G8, and I'm very happy to take part in the debate. I will be sharing my time with the member for Vancouver West.
Is specifically about the inclusion of family planning and sexual reproductive health options. However, I'd like to talk about this motion within the greater context of maternal and child health and Canada's failure to and potential to act on this important global issue. Nous avons entendu de la part.
We've heard from the Prime Minister that the major project, which will be presented by Canada during the G8 summit in June, will be an initiative to decrease the rate of mortality, of maternal mortality and child mortality in developing countries. The government has asserted from the very beginning that the planning programs, family planning programs, will not be part of the initiative, saying that the objective was to save lives. He then reversed his position by saying that family planning was a file which had always been considered as an area for action.
Presented as a holistic approach that focuses on clean water, vaccinations, nutrition, and training for healthcare workers. However, we have no confirmation that it will include access to family planning, and no funds have yet been allocated. Mr. Speaker, I have some statistics, some key statistics that I'd like to share with you, and I hope will shed some light on this issue. L'accès à un moyen de contraception.
Access to contraception and the choice to whether and reproductive choice, rather, are recognized as being means of saving lives. According to the World Health Organization, the first stage in avoiding deaths among new mothers is to make sure that these women have access to family planning and to safe abortion services.
5% of maternal and child deaths in the developing world by preventing risky births that are too close together, too early, or too late in a woman's life. Modern contraception helps fight the spread of HIV and AIDS by allowing HIV-positive women to space births for optimal health and access services to prevent mother-to-child transmission. And every year, an estimated 74,000 women around the world die as a result of unsafe abortions. This could be prevented with contraception and access to safe abortion facilities.
By refusing to make family planning part of the initiative on maternal health, I believe that this government is disconnected from the international community.
Like President Obama, who recently revoked the global gag rule, a policy that barred any foreign organization from receiving U.S. funds for providing, advocating, informing, or counseling women on abortion in his first week of office.
In a white paper on international development, published in 2009, the United Kingdom asked for abortion services in sanitary conditions in those countries where the procedure is legal and an increase by 1/3 of the number of users of contraceptives. The European Union affirmed that measures taken at the G8 would be based on the Cairo Declaration of 1994, which targets the assurance of universal access to reproductive health care between now and 2015.
A series of 8 international development goals that all 192 UN member states agreed to achieve by the year 2015, a year that really is just around the corner. Goal 5 states that we commit to improving maternal health by reducing maternal mortality and allowing people universal access to reproductive health. Remember, this was agreed to by all 192 UN member states, including Canada, Mr. Speaker. J'ai une fiche ici, une fiche de...
I have an information sheet here from the United Nations, and this information sheet states that the vast majority of deaths among mothers are in fact avoidable. In industrialized countries, death following pregnancy or giving birth are in fact rare. The mortality rate for mothers remains unacceptable in many developing countries in the world. Reaching Objective 5 means reducing or cutting by 3/4 the mortality rate between 1990 and 2015 among mothers. And this is a real challenge. And this is an area where there's been the least progress made.
And WHO, the World Health Organization, up to 15% of pregnant women in all population groups experience potentially fatal complications during birth. 20 million women each year. More than 80% of maternal deaths worldwide are due to 5 direct causes: hemorrhage, sepsis, unsafe abortion, obstructed labor, and hypertensive disease of pregnancy. In about 21% of the 500,000 maternal deaths occurring each year, women die as a result of severe bleeding. This complication can kill a woman in less than 2 hours. Control of bleeding, replacement of blood, or fast emergency evacuation is needed to save lives. Cette fiche aussi demande la question.
This information sheet also asks the question, what do they intend to do? And there's a broad list of initiatives, including funds to strengthen the healthcare system, in particular for mothers' health, children's health, and also by ensuring the purchase and distribution of contraception.
Programs to reduce maternal mortality and ensure universal access to reproductive health care, including family planning services. Adopt and implement policies that protect poor families from the catastrophic consequences of unaffordable maternity care, including through access to health insurance or free services. Améliorer l'accès à la contraception.
Improve access to contraception and sexual health advice for men, women, and teenagers. Protect pregnant women from domestic violence and get men involved in the health care of and care in general of pregnant women.
To protect poor families from these kinds of catastrophic consequences. We have known these things for years now, Mr. Speaker, and yet we still have not seen action in a serious way. Lorsqu'on examine les faits, une chose...
When you look at the facts, one thing is quite clear, and that is the Liberals haven't lived up to their responsibilities with respect to developing companies. Given this failure, what guarantee do we have that they'll be able to hold the government to account when it comes to maternal health?
Not words. We support this Opposition Day motion, but we also hope that it is worth more than the paper that it is printed on. Thank you, Mr. Speaker.
Questions and comments? The Honourable Member for Crowfoot.
Well, thank you, Mr. Speaker, and I want to thank the NDP Speaker for her speech on this motion today. Mr. Speaker, around the world, countries again are taking note of Canada. They're seeing Canada take a leading role in Afghanistan, not only in the mission there, but in the developmental mission as well. They're seeing the difference that Canada has made in regards to maternal and to women issues in Afghanistan. We've seen the girls and the women back in schools that they haven't been there before. And it's not only in education and commerce and the economy, but it's also dealing with other health issues as well. And to that end, Mr. Speaker, we gave notice that our government would be bringing and putting forward at this year's G8 meeting maternal and child health initiatives. And we have chosen to focus this particular initiative on saving the lives of pregnant mothers and children under the age of 5. Mr. Speaker, today we've seen, again in this House, where there's been an attempt to politicize this issue, to take it down a different trail, to try to use it as a wedge. But, Mr. Speaker, again, this government takes a leading role in it. Mr. Speaker, the maternal and child health discussion is not about what we are including or not including. It's about simple measures that focus on saving the lives of 500,000 pregnant mothers who die annually during childbirth and pregnancy, and 9 million children who do not make it past their 5th birthday every year for lack of quality health services, nutrition, and clean water. Mr. Speaker.
The honourable member for Halifax.
Thank you, Mr. Speaker, and I thank the member for his question. However, with all due respect to my colleague, the member from Crowfoot, I don't agree with him. What's happening in Afghanistan is a combat mission. I don't have the statistics in front of me, but they've been said in this House many times before. The numbers are shocking when you look at the amount of money that has been invested in the combat mission that goes towards combat as compared to the amount of money that goes towards aid. And if their objective is really about saving the lives of women and children, I really do wonder how many lives are lost at the expense of that combat mission that is attempting to do the very thing that it's the exact opposite of what it actually is achieving. Thank you, Mr. Speaker.
Questions and comments, the honourable member for Elmwood-Transcona.
Well, thank you, Mr. Speaker, and I want to congratulate the member on an excellent speech on this topic. Mr. Speaker, Canada is among the wealthiest nations in the world, yet 70% of Inuit preschool children live in homes where there's not always enough food. There are many mothers in Canada who live in unsafe places, who are going without food, electricity, or heat because of persistent deep poverty. And now that the government is committed to catching up with other wealthy nations on maternal aid, the question is, when will this government commit to putting women and children first in Canada as well? So I'd like the member to comment on that issue.
The honourable member for Halifax.
Thank you, Mr. Speaker, and I thank my colleague from Elmwood-Transcona for his insightful question about this issue. It's an interesting thing because we are talking about our Millennium Development Goals, and some people say, what about Canada? Well, the first thing I would point out with the Millennium Development Goals is we have agreed to put 0.7% of our GDP towards the Millennium Development Goals, towards foreign aid and development. And really, when you look at the whole picture of our GDP, 0.7% is a very small amount. So I think that is something we can achieve, while at the same time we can invest in things like a national housing strategy that would deal with the fact that so many people in our northern regions are living in overcrowded, decrepit housing, that we could actually deal with maternal health and child poverty here in Canada. I think that both are achievable. Thank you, Mr. Speaker.
Resuming debate, the honourable member for Vancouver East.
Thank you very much, Mr. Speaker, and I'm very pleased to have this opportunity to rise in the House today to speak on this motion. I think it's a very important debate that's taking place today, and I think it's really important that members of this House be able to express their strong opinions about this issue, and that the government's G8 maternal and child health initiative for the world's poorest regions must include the full range of family planning, sexual and reproductive health options, including contraception, consistent with previous governments that have stated that position, as well as all other G8 governments last year in Italy. So, Mr. Speaker, I certainly welcome this debate, and I think first and foremost we have to insist that any initiative that Canada takes forward must be based on scientific evidence, as outlined in the motion before us today. And that scientific evidence shows us that education and family planning can prevent as many as 1 in every 3 maternal deaths. Now, that's a very significant statistic, Mr. Speaker, and I think as we're throwing around numbers and arguments today, and I hear the Conservatives claiming that this debate is being politicized. Nothing could be further from the truth. I think it's really important that we stick to the facts and the evidence, the scientific evidence about what needs to be done globally by Canada within the international community to prevent these kinds of deaths from taking place. And, Mr. Speaker, when you look at the statistics and the facts that are available, it truly is shocking to know that more than 500 women die each year in pregnancy and 9 million children die before the age of 5. These are things that are entirely preventable if we set clear goals and objectives and outcomes, and we dedicate the necessary resources to ensuring that very simple measures take place to ensure that mother and maternal and child health is made as a primary priority. We do know, Mr. Speaker, that for every woman who dies, there are 20 or more who experience serious complications as a result of their pregnancy. And in fact, we also know that the World Health Organization has documented over and over again that the first step for avoiding maternal deaths is to ensure that women have access to family planning and safe abortions. Now, that's just a stated fact. This is from the main UN body who monitors these things, who does research, and anyone who disputes that, I think, is really under some kind of strange illusion about what's going on out there. And so I do think it is important that we stick to the scientific evidence. We also know that family planning could prevent 25% of maternal and child deaths in the developing world by preventing risky births that are too close together or are too early or too late in a woman's life. And this is a very real issue for women in the developing world. And having that education, having that prevention, having that access to family planning at a grassroots level in a very accessible way. I mean, this is not rocket science. These are very basic provisions about supporting women, empowering women, and ensuring that they can carry safe pregnancies, that they can engage in family planning, and that they have control over it. To me, that is probably the most important thing, and I know that this is something that is really emphasized by the Stephen Lewis Foundation, that when women have control over their own bodies, over their own lives, when they can make their own decisions, and when they have really not a lot of resources, we're talking about minimal resources to do that, we will see dramatic transforming changes take place. And that's what we're trying to get at with this motion today. Now, Mr. Speaker, while we have the Conservative government who have now suddenly found this issue and stated that their goal is to focus on maternal and child health, I think it is important to point out, because credibility in the record is something that counts here. And I think it's fair to say that they do have very little credibility on issues affecting women in the developing world. And let's not forget that they are the ones that did away with the terms of gender equality, gender-based violence, impunity, and justice when calling for an end to sexual violence in the Democratic Republic of Congo. In the NDP, we certainly welcome this interest that they've suddenly developed in the health of mothers and children in the developing world, but it's got to be on a comprehensive basis. It can't be based on some sort of narrow ideological view. It's got to be based on the scientific and factual evidence that is available globally, that's being developed by the United Nations, by the World Health Organizations and many other organizations. And I think it will undermine Canada's credibility if we don't advance these proposals in that broad way at the G8, if it becomes so narrowly focused with this sort of conservative view. I think we become another embarrassment, just like what happened in Copenhagen on climate change. And I think Canadians feel pretty awful about what happens when we go on those international stages. So here we have the G8 coming to Toronto. We have an opportunity to do something right and to express the will of the House and to do it in a comprehensive, evidence-based way, and I hope that's what will happen today. Now, having said all of that, Mr. Speaker, one of the issues about credibility is a very stark question that we have to ask, and that is, why on the one hand is this government advancing this on the international stage, and yet here at home we still have appalling conditions for women and children in Canada. You know, we're one of the wealthiest countries in the world. I can tell you in my community of East Vancouver, we have women and children who are living far below the poverty line. They're living in slum housing. They're not getting enough food to eat. They don't have enough access to community-level health care provisions. There's no child care. Or the waiting list is so long and so expensive you can't get in. And so I do think we're compelled, while we deal with the situation internationally, that we also have to come back and focus on what's happening in Canada. These issues are not mutually exclusive. They don't cancel each other out. We demand of our government that they address both issues, that they address poverty here in Canada and that we address poverty globally. And I think they're very much interrelated, because it becomes a question of where do resources go. And if we did have a properly functioning gender analysis, whether it's on the budget that was just approved or whether it's on bills that come forward, I think we would have a much better analysis and we would have a much better allocation of resources instead of the incredible sort of ideological and political frame that we've had to go through time and time again with this Conservative government. So, Mr. Speaker, I do want to say in the strongest terms that I support the Millennium Development Goals. I support Canada advancing this initiative as long as it's done in broad terms and it doesn't exclude family planning and access to safe abortions for women globally. But I also feel very, very strongly that we have to set our sights on what's happening in our own communities, and we have to recognize what's taking place in Aboriginal communities. We have to recognize that there are rural situations, but there are also urban situations where the conditions that people endure are simply unlivable and should not exist in this kind of country. So, Mr. Speaker, I know that many organizations have done tremendous work on this issue, not over just the last year or so, but over the decades. I just talked to a woman in the lobby just a few minutes ago who told me she'd been working on this issue for 30 years, and she's very glad that this is being debated in the House today. So I think it's very important that we recognize the work that's being done, and the fact that the Conservatives have somewhat reversed their position. Originally, they were refusing to incorporate family planning into the Maternal Health Initiative, and clearly they were absolutely out of step with the international communities. And I have to say that to me it was a good lesson of what politics is about, to see the pressure both within the House but also in the broader community that took place that forced these people to change their position. And so groups like the Action Canada for Population and Development, the Canadian Federation for Sexual Health, the Federation of Medical Women in Canada, the Stephen Lewis Foundation, and many others, I applaud them for the work that they've done in forcing this issue and making it clear that we will not tolerate a Conservative position that is so superficial and that it gives the illusion that it's helping women and children, but in reality is actually undermining the rights and the freedoms and the liberties of women and children, not only in Canada but globally. So I hope this motion today will set us on the right course. We've been raising this in question period. Our leader has been raising this in question period, as have other members from our caucus. And we will continue to press this matter until the Conservative government understands that they can, if they want to advance this proposal, they've got to do it on the basis of supporting women's equality, women's rights, and not denying women access to full services and programs, whether it be family planning or abortion. And that's why this motion should pass today. Thank you, Mr. Speaker.
Le chef de le Bloc québécois.
The Bloc House Leader is rising on a point of order. Yes, I would like to apologize to a colleague who wanted to ask a question or make a comment following the speech. However, I want to inform you that there have been consultations among the parties, and that you will find that there is unanimous consent for the following motion, that notwithstanding any standing orders or customary practice in the House, if during the time set aside for private members' business a recorded division is called on Bill C-241, an act to amend the Employment Insurance Act, waiting period, that it be deferred to the end of the period following question period to tomorrow. Thank you very much, Mr. Speaker. Does the honourable member have unanimous consent of the House to move that motion? Agreed? The House has heard the motion. Is it the pleasure of the House to adopt the motion? Agreed? Agreed.
Questions and comments? Questions and commentaire. The honourable member for Winnipeg South.
Thank you, Mr. Speaker. I listened to the House Leader from the New Democratic Party's intervention quite closely, and I appreciate, obviously, the background that she brings to this debate. Mr. Speaker, of course, as a politician, we're always seeking consensus, and she references family planning, and I know family planning can be defined in many ways. I know internationally there are some regions of the world, unfortunately, that define that phrase differently, I think, than the philosophy that she probably has. Of course, when I speak about this, I'm referring to the Republic of China in relation to their one-child policy, which leads, unfortunately, sometimes to young women who find themselves pregnant a second time to be, as reported, coerced into abortions. And I'm sure she doesn't agree with those international viewpoints, and I'm sure there's consensus between us on that point.
The honourable member for Vancouver East.
Well, thank you very much, Mr. Speaker, and I appreciate the member's comments, but I think there's been a wealth of literature, some of which I quoted from today, in terms of definitions around family planning from the World Health Organization, from the Canadian Federation for Sexual Health, which is part of International Planned Parenthood Federation, and they make it very clear when you read their literature and their research that family planning has to include a full range of choices that is available to individual women around their reproductive rights. I mean, there's just no question about this. This is not something that is, I think, even debatable. Major organizations under the UN, organizations here in Canada, and if we don't accept that, what we're really saying is that somehow we force our own opinion on the choices that women have and on their own liberty and their own ability to make choices about their own bodies and their own reproductive rights. And that, to me, that is a fundamental human right for women. And I think we have to stand by that. And, the individual members may have individual views on this, but to me, it's a matter of choice. It's a matter of choice on whether or not to have an abortion. If you do, it should be something that should be done in a safe and medically sound environment. And so I think part of the debate here is making sure that we carry that as a very strong and clear message. Otherwise, what we're saying is that we don't really support women's equality and we don't really support women's rights. So let's be very clear on that.
Questions and comments? The honourable member for Elmwood Transcona.
Mr. Speaker, and I want to thank the member for a very inspiring speech today on this motion. Mr. Speaker, the EU has said that their action at the G8 will be based on the 1994 Cairo Declaration, which aims to ensure universal access by 2015 to reproductive health care, including family planning. So the government is basically trying to catch up with the rest of the developed world, as I see it, but we still have the member for Winnipeg South who just spoke, who's the leader of the anti-abortion caucus inside the Conservative caucus, fighting a rearguard action, trying to hold this government back. So we encourage the government to fight this rearguard action and come on and join the developed world in getting action in this cause.
The honourable member for Vancouver East.
Thank you. I'd like to thank the member from Elmwood Transcona. And there is a lot of really good information to show that whether it's the EU or individual countries like Norway have, first of all, contribute significant resources. I think in the case of Norway, it's 1.2 billion or so. It's a huge amount of funds that they've dedicated. And there you can see countries that are really living up to their commitment to the Millennium Development Goals. And that's really what we want to see here in Canada. And we know that there are divisions within the Conservative caucus and likely within the Liberal caucus, but I think we've got to get over and above that. And we've got to say this is about Canada's position globally. This is about women's health and women's equality. This is about the rights of women, and I think that's what we've got to focus on. And I think that the motion today before us helps us do that. And I think it has very strong support in the community. And so we should stand very proud, to go to that conference, to the G8 with a strong position. But if we end up with this kind of very lopsided conservative view of what family planning is and what women's equality is, then I think we're actually taking steps backwards. I hope that doesn't happen, Mr. Speaker, because I think there'll be a very strong message from the members of the House today that if we're going to do this, we've got to do it properly, and we've got to put women first, we've got to put women's rights first.
Resuming debate, the honourable member for Chatham-Kent Essex.
Thank you, Mr. Speaker. Mr. Speaker, this government is proud that Canada will host the G8 Muskoka Summit in June 2010, which will be followed by a separate meeting of G20 leaders in Toronto. The theme of the G8 Muskoka Summit for Toronto G20 Summit leaders is recovery and new beginnings. At the Toronto G20 Summit, Canada will work with G20 partners to ensure that global economic recovery is assured and set the world on a path to strong, balanced, and sustainable growth. Over the past year and a half, many Canadians have felt the pain of global economic recession. Through Canada's Economic Action Plan, this government has taken decisive steps to protect incomes, create jobs, ease credit markets, and help workers and communities get back on their feet. Canadians know that the world's poorest citizens are also suffering the impacts of the recession and expect their government to show international leadership. The global recession threatens to set back many of the important development gains that have been made in recent years, including related to the United Nations Millennium Development Goals. Action within the G20 is helping to create the conditions for more sustainable growth that will help developing countries. And helping improve the lives of people throughout the developing world is something the G8 has been doing for many years. The G8 has a strong track record in supporting international development efforts and efforts related to global peace and security. As G8 president in 2010, Canada will ensure that the G8 countries continues to deliver results in these two core areas by advancing a pragmatic and a results-driven agenda for the Muskoka Summit. Accountability will be the hallmark of this agenda. In Muskoka, the G8 will follow up on past commitments to make sure that it delivers on its promises. And together, the G8 will set focused goals for leadership going forward. In Muskoka, Canada will focus the G8 agenda on areas where it has greatest value-added development and peace and security. These are central to the values and interests of G8 members and are areas where the G8 can make a clear difference. On development, Canada will champion a major initiative to improve maternal and child health in the world's most vulnerable regions. The statistics are shocking. Each year, nearly 9 million children die before they turn 5, and 500,000 women die in pregnancy and childbirth. Many of these deaths can be prevented with improved access to health care, better nutrition, and scaling up proven interventions such as immunizations. We believe that the G8 members can make a tangible difference, and we will make this a top priority of our Muskoka G8 Summit. At the Muskoka Summit, Canada will seek to leverage greater commitments from the G8 and other major donors to help developing countries respond to these challenges. The G8 Summit will also focus on critically important peace and security challenge. The spread and use of weapons of mass destruction, including by terrorists, remains a key threat to global security and stability. This requires continued resolve and leadership on the part of the G8 and its partners. Building the capacity of vulnerable states and regions to address peace and security vulnerabilities is another priority. This will include steps by the G8 to strengthen institutions, prevent conflict, and better mobilize civilian and military capacities. The G8 has a long track record of delivering results on development. We have done this by working in partnerships with African and other developing countries to support their priorities. Making a real contribution to international development requires leadership and resources. The G8's collective contributions on development are unmatched. Collectively, the G8 is a leader in contributing to development assistance. Leading by example, the G8 has been effective in leveraging additional financial and other support from other countries. For example, at the 2008 summit in Japan, and then again in Italy in 2009, the G8 played an important role in helping millions of the world's most vulnerable citizens threatened by rising food prices in recent years. At the 2009 L'Aquila Summit, the G8 led 20 leaders and heads of international organizations agreeing to mobilize more than $20 billion US for agricultural development over 3 years. Canada will participate in this new initiative, doubling our spending in support of agricultural development by committing an additional $600 million over 3 years, and that's $600 million Canadian. As Canada continues to prepare for our G8 summit in 2010, we remain committed to working diligently with other stakeholders to continue addressing the issues associated with hunger and food security. The G8 also has a strong track record in helping address the health of people around the world. In 2001, the G8 launched the Global Fund to fight AIDS, tuberculosis, malaria, and G8 countries have contributed substantial funds to fight these life-threatening and debilitating diseases. Mr. Speaker, the G8 has made significant investments in addressing the health challenges experienced in developing countries. However, significant challenges remain, and the G8 can continue to show leadership in mobilizing the international community to meet these challenges. One area in particular cries out for action: maternal and child health. These two issues are captured under the United Nations Millennium Development Goals 4 and 5, with targets set for progress by 2015. They are the Millennium Development Goals that are showing the least progress. As G8 President in 2010, Canada has decided to advance maternal and child health as a key priority for the G8 Muskoka Summit. And it is doing so with the strong and universal support of its G8 partners. Canada is already very actively engaged on support for child health and maternal health around the world. Our priorities include malaria control, especially to protect children and pregnant women, and scaling up of health worker training to develop high-impact interventions to women and children. We have long been active supporters of programs to support child immunization, including for polio vaccinations. Given the close intersection of healthy children and educational attainment, we are also delivering on our commitments to fund basic education and to support school feeding programs. Canada also announced that 3 priorities will guide our development programming going forward, one of which is securing the future for children and youth. The challenge of improving maternal and child health is immense and requires comprehensive solutions, additional skilled human resources, political support, and strengthened national health systems. It's not something any one country can take on by itself. So in Muskoka, Canada will mobilize G8 members and assume a leadership role in setting a global agenda for improving maternal and child health. The G8 provides a powerful framework to accelerate action on these issues, bringing increased political profile, operational coherence, financing, and accountability to collective efforts. Mr. Speaker, I would like to conclude by noting that accountability will be the hallmark of Canada's 2010 Muskoka Summit. Canada championed the creation of the G8 Working Group on Accountability because we believe it is important to deliver on promises made. When G8 leaders...
Order. I regret to have to cut off the honourable member, but it being 5:15 p.m. and this being the final supply day in the period ending March 26, 2010, it is my duty to interrupt the proceedings and put forthwith every question necessary to dispose of the business of supply. La question est la suivante.
The question is the following. Mr. Ray, seconded by Mr. Martin. Esquire-Antoine de Foucault. That in the government of the House, the government's G8 maternal health and child health initiative for the world's poorest regions must include the full range of family planning, sexual and reproductive health options, including contraception, consistent with the policy of previous Liberal and Conservative governments, and all other G8 governments last year in L'Aquila, Italy.
The Government of Canada must be based on scientific evidence which proves that education and family planning can prevent as many as 1 in every 3 maternal deaths, and that the Canadian government should refrain from advancing the failed right-wing ideologies previously imposed by the George W. Bush administration in the United States, which made humanitarian assistance conditional upon a global gag rule that required all non-governmental organizations receiving federal funding to refrain from promoting medically sound family planning. Plaît-il à la Chambre?
Is it the pleasure of the House to adopt the motion?
All those in favor will please say yay. Yay! All those opposed will please say nay. No! À mon avis, les non.
In my opinion, the nays have it.
Call in the members.
À l'ordre, la question est la suivante. Monsieur Ray.
The question is as follows. Mr. Ray, seconded by Mr. Martin, moves that in the opinion of the House, the government's G8 maternal and child health initiative for the world's poorest regions must include the full range.
Dispense. All those in favor of the motion will please rise.
Mr. Ignatia, Mr. Bevilacqua, Mr. Easter, Ms. Fry, Mr. Regan, Mr. Ray, Mr. Goodale, Ms. Mina, Monsieur Bélanger, Mr. Byrne, Mr. Canis, Ms. Bennett, Mr. Bryson, Mr. Coder, Mr. Cockler, Mr. Martin Esquamot-Wandafuka, Mr. McCallum, Mr. Dosange, Mr. Dryden, Monsieur Proux, Mr. Cosner, Ms. Gros, Monsieur Patry, Madame Folco, Mr. Wilford, Mr. Bagnall, Mr. Eiking, Monsieur Leblanc, Mr. Pachetti, back to Mr. Murphy, Charlottetown, Mr. Baines, Monsieur Damour, Ms. Dalla, Mr. Holland, Mr. McGuinty, Ms. Ratansi, Mr. Rodriguez, Mr. Rota, Mr. Savage, Mr. Scarpaleggia, Mr. Sims, Mr. Russell, Mr. Dhaliwal, Mr. Murphy, Moncton Riverview Dieppe, Mr. Pearson, Ms. Hall Finley, Ms. Murray, Mr. Andrews, Ms. Cody, Mrs. Crombie, Ms. Duncan and Etobicoke North, Ms. Foote, Monsieur Garneau, Madame Mendez, Mr. Oliphant, Mrs. Simpson, Monsieur Trudeau, Mr. Valeriot, Madame Zarak, Monsieur Duceppe, Monsieur Laframboise, Monsieur Payet-Hochelaga, Monsieur Paquette, Madame Lalonde, Monsieur Bachan, Monsieur Bigras, Monsieur Ménard, Monsieur Bouchard, Monsieur Lessard, Monsieur Laforêt, Madame de Bellefeuille, Monsieur Guimond, Montmorency, Charlevoix, Haute-Côte-Nord, Monsieur Lemay, Madame Brunel, Madame Gay, Madame Bourgeois, Madame Demers, Monsieur Blais, Monsieur Bellavance, Monsieur Cardin, Madame Faye, Madame Lavallée, Monsieur Plamondon, Madame Freeman, Monsieur Saint-Cyr, Monsieur Malo, Monsieur Nadeau, Monsieur Carrier, Monsieur Lévesque, Monsieur Asselin, Monsieur André, Madame Mourani, Monsieur Godet, Madame Deschamps, Monsieur Vincent, Madame Tillac, Monsieur Dufour, Monsieur Ouellet, Monsieur Guimond, Rimouski-Neigette et Misquata-les-Basses, Monsieur Paillé-Louis Hébert, Monsieur Dorion, Monsieur Desnoyers, Madame Baudin, Monsieur Pomerleau, Mr. Layton, Monsieur Mulcair, Ms. Davies, Vancouver East, Mr. Massey, Mr. Harris, St. John's East, Mr. Martin, Sault Ste. Marie, Monsieur Godin, Mr. Comartin, Ms. Crowder, Mr. Christopherson, Mr. Julian, Ms. Charlton, Mr. Cullen, Mr. Sixay, Ms. Matheson, Mr. Bevington, Madame Savoy, Mr. Dewar, Mr. Malloway, Mr. Alan Wellen, Ms. Ashton, Mr. Davies, Vancouver Kingsway, Mr. Atamanenko, Mr. Donnelly, Ms. Duncan, Edmonton Strathcona, Mr. Gravel, Mr. Heyer, Mr. Stauffer, Mr. Marston, Ms. Chow, Mr. Martin Winnipeg Centre, Mr. Thibault, Ms. Leslie, Monsieur Arthur,
All those opposed to the motion will please rise.
Harper, Mr. Fetcher, Mr. Ashfield, Ms. Ambrose, Ms. Oda, Mr. Van Loan, Mr. Taves, Mr. Day, Mr. Nicholson, Mr. McKay Central Nova, Mr. Prentice, Mr. Cannon Pontiac, Mr. Flaherty, Mr. Clement, Mr. Straw, Mr. Baird, Ms. Finley, Mr. Ritz, Mrs. Shea, Mr. Kenny, Calgary Southeast, Mr. Moore, Port Moody Westwood, Port Coquitlam, Mr. Paradis, Mrs. Aglukat, Mr. Blackburn, Mr. Abbott, Mr. Duncan, Vancouver Vancouver Island North.
Mr. Duncan, Vancouver Island North.
Mr. Richardson.
Mr. Richardson.
Mr. Benoit.
Mr. Benoit.
Mr. Brightchrist.
Mr. Brightchrist.
Mr. Lake.
Mr. Lake.
Kitty, South Shore, St. Margaret.
Kitty, South Shore, St. Margaret.
Mr. Warwa.
Mr. Warwa.
Mr. Mackenzie.
Mr.
Mr. Goodyear.
Mr. Goodyear.
Mr. Merrifield.
Mr. Merrifield.
Mrs. Yelich.
Mrs. Yelich.
Madame Werner.
Madame Werner.
Mr. Hill.
Mr. Hill.
Mr. O'Connor.
Mr. O'Connor.
Ms. Raitt.
Ms. Raitt.
Mrs. Ablancy.
Mrs. Ablancy.
Mrs. Georges.
Ms. Georges.
Monsieur Lebel.
Monsieur Lebel.
Mr. Moore Fundy Royal.
Mr. Moore Fundy Royal.
Mr. Lunn.
Mr. Lunn.
Mr. Menzies.
Mr. Menzies.
Mr. Camp, Pitt Meadows, Maple Ridge Mission.
Mr. Camp, Pitt Meadows, Maple Ridge Mission.
Mr. Dykstra.
Mr. Dykstra.
Mr. Del Mastro.
Mr. Del Mastro.
Monsieur Gould.
Mr. Gould.
Mr. Carey.
Mr. Carey.
Mr. Thompson.
Mr. Thompson.
Mr. Harris Caribou Prince George.
Harris Caribou Prince George.
Mr. Cummins.
Mr. Cummins.
Mr. Anders.
Mr. Anders.
Mr. Casson.
Mr. Casson.
Mr. Goldring.
Mr. Goldring.
Mr. Mark.
Mr. Mark.
Mr. Bernier.
Mr. Bernier.
Mr. Chong.
Mr. Chong.
Mr. Kerr.
Mr. Kerr.
Mr. O'Bry.
Mr. O'Bry.
Monsieur Petit.
Monsieur Petit.
Mr. Hahn.
Mr. Hahn.
Monsieur Poiliev.
Mr. Poiliev.
Mr. Lukiski.
Mr. Lukiski.
Mrs. Wong.
Mrs. Wong.
Mrs. Glover.
Mrs. Glover.
Madame Boucher.
Madame Boucher.
Mr. Anderson.
Mr. Anderson.
Mr. Jean.
Mr. Jean.
Mr. Komarnicki.
Mr. Komarnicki.
Monsieur Lemieux.
Monsieur Lemieux.
Mr. Saxton.
Mr. Saxton.
Mr. Deckert.
Mr. Deckert.
Mr. Velicott.
Mr. Velicott.
Mrs. Gallant.
Mrs. Gallant.
Mr. Lunny.
Mr. Lunny.
Mr. Rajat.
Mr. Rajat.
Mr. Reed.
Mr. Reed.
Mr. Sorensen.
Mr. Sorensen.
Mr. Schellenberger.
Mr. Schellenberger.
Mr. Allison.
Mr. Allison.
Mr. Bazan.
Mr. Bazan.
Mr. Brown leads Granville.
Mr. Brown leads
Mrs.
Granville.
Greywall.
Mrs. Greywall.
Mr. Hebert.
Mr. Hebert.
Mr. Cramp. Prince Edward Hastings.
Mr. Cramp, Prince Edward Hastings.
Mr. Miller.
Mr. Miller.
Mr. Preston.
Mr. Preston.
Mrs. Smith.
Mrs. Smith.
Mr. Tilson.
Mr. Tilson.
Mr. Trost.
Mr. Trost.
Mr. Tweed.
Mr. Tweed.
Mr. Watson.
Mr. Watson.
Mr. Albrecht.
Mr. Albrecht.
Monsieur Lauzon.
Mr. Lauzon.
Mr. Allen. Tobic Mactaquac.
Mr. Allen Tobic Mactaquac.
Monsieur Blanny.
Monsieur Blanny.
Mr. Brownberry.
Mr. Brownberry.
Mr. Brenouge.
Mr. Brenouge.
Mr. Calkins.
Mr. Calkins.
Sorry, Mr. Cannon, Kelowna Lake Country.
Mr. Cannon, Kelowna Lake Country.
Mrs. Davidson.
Mrs. Davidson.
Mr. Fast.
Mr. Fast.
Monsieur Galipeau.
Mr. Galipeau.
Mr. Mays.
Mr. Mays.
Mr. Norlock.
Mr. Norlock.
Mr. Shipley.
Mr. Shipley.
Mr. Stanton.
Mr. Stanton.
Mr. Storsett.
Mr. Storsett.
Mr. Sweet.
Mr. Sweet.
Mr. Van Kesteren.
Mr. Van Kesteren.
Mr. Wallace.
Mr. Wallace.
Mr. Warkington.
Mr. Warkington.
Mr. Shear.
Mr. Shear.
Mr. DeVolen.
Mr. DeVolen.
Mr. Clark.
Mr. Clark.
Mrs. Block.
Mrs. Block.
Mr. Bowen.
Mr. Bowen.
Mr. Braid.
Mr. Braid.
Ms. Brown, Newmarket, Aurora.
Ms. Brown, Newmarket, Aurora.
Ms. Cadman.
Ms. Cadman.
Mr. Calandra.
Mr. Calandra.
Mr. Shorey.
Mr. Shorey.
Mr. Dreeshen.
Mr. Dreeshen.
Mr. Holbach.
Mr. Holbach.
Ms. Hepner.
Ms. Hepner.
Mr. Holder.
Mr. Holder.
Mr. Lobb.
Mr. Lobb.
Mr. McColeman.
Mr. McColeman.
Mrs. McLeod.
Mrs. McLeod.
Mrs. O'Neill Gordon.
Mrs. O'Neill Gordon.
Mr. Rathgaber.
Mr. Rathgaber.
Mr. Richards.
Mr. Richards.
Mr. Rickford.
Mr. Rickford.
Mr. Weston, West Vancouver, Sunshine Coast, Sea to Sky Country.
Mr. Weston, West Vancouver, Sunshine Coast, Sea to Sky Country.
Mr. Weston St. John.
Mr. Weston St. John.
Mr. Woodworth.
Mr. Woodworth.
Mr. Young.
Mr. Young.
Mr. Armstrong.
Mr. Armstrong.
Monsieur Généreux.
Monsieur Généreux.
Mr. McTague.
Mr. McTague.
Mr. Zabo.
Mr. Zabo.
Mr. McKay Scarborough Gilwood.
Mr. McKay Scarborough Gilwood.
Yeas pour 138, 138. Nays contre 144, 144.
Je déclare la motion rejetée.
I declare the motion defeated.
Order. The next question, order. The next question is on supplementary estimates C. Mr. Day, seconded by Mr. O'Connor, moves that the supplementary estimate C for the fiscal year ending March 31st, 2010 be concurred in.
Is it the pleasure of the House to adopt the motion?
No? No? All those in favor of the motion will please say yay.
All those opposed to the motion, please say nay. In my opinion, the yeas have it.
All those in favor of the motion will please rise.
Mr. Harper, Mr. Fletcher, Mr. Ashfield, Ms. Ambrose, Ms. Oda, Mr. Van Loan, Mr. Taves, Mr. Day, Mr. Nicholson, Mr. McKay Central Nova, Mr. Prentice, Mr. Cannon Pontiac, Mr. Flaherty, Mr. Clement, Mr. Straw, Mr. Baird, Ms. Finley, Mr. Ritz, Mrs. Shea, Mr. Kenny Calgary Southeast, Mr. Moore Port Moody Westwood, Port Coquitlam, Mr. Paradis, Mrs. Aglukac, Mr. Blackburn, Mr. Abbott, Mr. Duncan Vancouver Island North, Mr. Richardson, Mr. Benoit, Mr. Brightprice, Mr. Lake, Mr. Katy South Shore St. Margaret, Mr. Warawa, Mr. Mackenzie, Mr. Goodyear, Mr. Merrifield, Mrs. Yelich, Madame Bernard, Mr. Hill, Mr. O'Connor, Ms. Raitt, Mrs. Oblonsky, Mrs. Georges, Mr. Lebel, Mr. Moore Fundy Royal, Mr. Lunn, Mr. Menzies, Mr. Camp, Pitt Meadows Maple Ridge Mission, Mr. Dykstra, Mr. Del Mastro, Mr. Gould, Mr. Carey, Mr. Thompson, Mr. Harris Caribou Prince George, Mr. Cummins, Mr. Anders, Mr. Casson, Mr. Goldring, Mr. Marks, Mr. Bernier, Mr. Chong, Mr. Kerr, Mr. O'Brien, Mr. Petit, Mr. Hahn, Mr. Poilievre, Mr. Lukiski, Mrs. Wong, Mrs. Glover, Madame Boucher, Mr. Anderson, Mr. Jean, Mr. Komarniki, Mr. Lemieux, Mr. Saxton, Mr. Deckert, Mr. Valacott, Mrs. Gallant, Mr. Lunny, Mr. Rajat, Mr. Reed, Mr. Sorensen, Mr. Schellenberger, Mr. Allison, Mr. Bazan, Mr. Brown Leeds Granville, Mrs. Greywall, Mr. Hebert, Mr. Cramp Prince Edward Hastings, Mr. Miller, Mr. Preston, Mrs. Smith, Mr. Tilson, Mr. Trost, Mr. Tweed, Mr. Watson, Mr. Albrecht, Mr. Lozon, Mr. Allen to Big Mactaquac, Mr. Blaney, Mr. Brown-Berry, Mr. Brunouz, Mr. Cannon Kelowna Lake Country, Mrs. Davidson, Mr. Fast, Mr. Galipo, Mr. Mays, Mr. Norlock, Mr. Shipley, Mr. Stanton, Mr. Storsett, Mr. Sweet, Mr. Van Kesteren, Mr. Wallace, Mr. Walkington, Mr. Shear, Mr. DeVolen, Mr. Clark, Mrs. Block, Mr. Bowen, Mr. Braid, Ms. Brown Market Aurora, Ms. Cadman, Mr. Calandra, Mr. Shorey, Mr. Dreeshen, Mr. Holbach, Ms. Hepner, Mr. Holder, Mr. Lobb, Mr. McColman, Mrs. McLeod, Mrs. O'Neill Gordon, Mr. Rathgaber, Mr. Richards, Mr. Rickford, Mr. Weston, West Vancouver, Sunshine Coast, Sea to Sky Country, Mr. Weston St. John, Mr. Woodworth, Mr. Young, Mr. Armstrong, Monsieur Généreux, Monsieur Arthur.
All those opposed to the motion will please rise.
Monsieur Doucet. Monsieur Laframboise. Monsieur Payot-Schlaga. Monsieur Paquette. Madame Lalonde. Monsieur Bachan. Monsieur Bigra. Monsieur Ménard. Monsieur Bouchard. Monsieur Lessard. Monsieur Laforêt. Madame de Bellefeuille.
Madame de Bellefeuille.
Monsieur Guimond, Montmorency, Charlevoix, Haute-Côte-Nord.
Monsieur Guimond, Montmorency, Charlevoix, Haute-Côte-Nord.
Monsieur Lemay. Madame Brunel. Madame Gay. Madame Bourgeois. Madame Demers. Monsieur Blais. Monsieur Bellavance. Monsieur Cardin. Madame Faye. Madame Lavallée. Monsieur Plamondon. Madame Freeman. Monsieur Saint-Cyr. Monsieur Malo. Monsieur Nadeau. Monsieur Carrier. Monsieur Lévesque. Monsieur Asselin. Monsieur André. Madame Mourani. Monsieur Godet, Madame Deschamps, Monsieur Vincent, Madame Tillac, Monsieur Dufour, Monsieur Ouellet, Monsieur Guimond, Rimouski-Neigette, Témiscouata-les-Basses, Monsieur Payet-Louis Hébert, Monsieur Dorion, Monsieur Desnoyers, Madame Baudin, Monsieur Pomerleau, Mr. Bevilacqua, Mr. Easter, Ms. Fry, Mr. Regan, Mr. Wraith, Mr. Goodale, Ms. Mina, Mr. Bélanger, Mr. Burns, Ms. Bennett, Mr. Bryson, Mr. Coder, Mr. Cutler. Mr. Martin Esquimalt, Juan de Fuca. Mr. McCallum. Mr. Dosange. Mr. Dryden. Mr. Malley. Mr. Cuzner. Mr. McTague. Mr. Zabo. Mr. McKay Scarborough Guildwood. Mr. Iking. Mr. Leblanc. Mr. Murphy Charlottetown. Mr. Pachetti. Monsieur Damour. Mr. Savage.
Mr. Savage.
Mr. Scarpalegia. Mr. Sims. Mr. Dhaliwal. Mr. Murphy, Moncton Riverview, Dieppe. Mr. Pearson. Ms. Cody. Ms. Foote. Monsieur Trudeau. Mr. Layton. Monsieur Mulcair. Mr. Davies, Ms. Davies, Vancouver East.
Ms. Davies, Vancouver East.
Mr. Massey.
Mr. Massey.
Mr. Harris, St. John's East.
Mr. Harris, St. John's.
Mr. Martin, Sault Ste. Marie.
Mr. Martin, Sault Ste. Marie.
Mr. Godin. Mr. Comartin. Ms. Crowder. Mr. Christopherson. Mr. Julian. Ms. Charlton. Mr. Cullen. Mr. Sixay. Ms. Matheson. Mr. Bevington. Madame Savoie. Mr. Dewar. Mr. Malloway. Alan Wellen. Ms. Ashton. Mr. Davies, Vancouver Kingsway. Mr. Atamanenko. Mr. Donnelly. Ms. Duncan, Edmonton Strathcona. Mr. Gravel. Mr. Heyer. Mr. Stauffer. Mr. Marston. Ms. Chow. Mr. Martin, Winnipeg Centre. Mr. Thibault. Ms. Leslie.
Yeas pour 142, 142. Nays contre 114, 114.
Je déclare la motion adoptée.
I declare the motion carried.
Mr. Day, seconded by Mr. O'Connor, moves that a bill entitled An Act for Granting to Her Majesty certain sums of money for the federal public administration for the financial year ending March 31st, 2010, be now read a first time and be printed. Cette motion est
This motion is deemed adopted.
Monsieur Day, appuyé par Monsieur.
Mr. Day, seconded by Mr. O'Connor, moves that Bill C6, an act for granting to Her Majesty certain sums of money for the federal public administration for the financial year ending March 31st, 2010, be now read a second time and referred to a committee of the whole. Is it the pleasure of the House to adopt the motion?
Honourable Chief Government Whip is rising on a point of order.
Mr. Speaker, I believe if you seek it, you will find agreement to apply the vote on the previous motion to the current motion.
Unanimous consent to proceed in this fashion? Agreed. Then I declare the motion carried, and accordingly this bill stands referred to a committee of the whole. I do now leave the chair for the House to resolve itself into committee of the whole.
Order. La Chambre en comité plénier.
House in Committee of the Whole on Bill C6.
For St. John, South Mount Pearl has a question.
Mr. Chair, I would like to ask the President of the Treasury Board if the bill is indeed in its usual form.
The Honourable President of the Treasury Board.
Mr. Chairman, I can assure members that the bill is in the same form as it was in the previous supply.
Order. Shall Clause 2 carry? Carried. On division? Carried on division. Shall Clause 3 carry? On division? Carried on division. L'article 4 est allowed.
Shall Clause 4 carry? Carried on division. Shall Clause 5 carry? Carried on division.
It's carry. On division? Carried on division. Shall Clause 7 carry? On division? Carried on division. Shall Schedule 1 carry? On division, carried on division. L'annexe 2 est allowed.
Shall Schedule 2 carry? Carried on division.
Shall Clause 1 carry? On division, carried on division. Shall the preamble carry? On division, carried on division. Le titre est allowed.
Shall the title carry? Carried on division.
Le projet de loi.
Shall the bill carry? Carried on division.
Bill? Agreed? Mr. Speaker, the Committee of the Whole has considered Bill C6 and has directed me to report the same without amendment.
Order. Mr. Day, seconded by Mr. O'Connor, moves that Bill C6, an act for granting to Her Majesty certain sums of money for the federal public administration for the financial year ended March 31st, 2010, be concurred in at the report stage.
Is it the pleasure of the House to adopt the motion?
The Honourable Chief Government Whip on a point of order.
Speaker, if you seek it, I believe you'll find agreement to apply the votes in the previous motion to the current motion.
Is it agreed? Agreed, and so ordered. Then I declare the motion carried. When shall the bill be read a third time? Now. Monsieur Day, appuyé par Monsieur O'Connor.
Mr. Day, seconded by Mr. O'Connor, moves that Bill C6, an act for granting to Her Majesty certain sums of money for the federal public administration for the financial year ending March 31st, 2010, be now read a third time and do pass. Is it the pleasure of the House to adopt the motion?
On a point of order.
Just read the first paragraph.
I can't do the rest. Mr. Speaker, if you seek it, you will find agreement to apply the vote from the previous motion to the current motion.
Is there unanimous consent to proceed in this way? Agreed? Agreed? Then I declare the motion carried.
Third reading of this bill, troisième lecture de ce projet de loi.
Order. La prochaine mise au voix porte...
The next question is on the interim supply for 2010-2011.
O'Connor moves that this House to concur in interim supply as follows. That a sum not exceeding $27,249,740,000 and 50 cents. May I dispense with 50? There was 50 cents at the end there. So thank you. Thank you. Is it the pleasure of the House to adopt the motion? Agreed? No? All those in favor of the motion will please say yay.
All those opposed to the motion, please say nay. In my opinion, the yeas have it.
All those in favor of the motion will please rise.
Mr. Harper, Mr. Fletcher, Mr. Ashfield, Mr. Ambrose, Mr. Oda, Mr. Van Loan, Mr. Tave, Mr. Day, Mr. Nicholson, Mr. McKay Central Nova, Mr. Prentice, Mr. Cannon-Pontiac, Mr. Flaherty, Mr. Clement, Mr. Straw, Mr. Baird, Ms. Finley, Mr. Ritz, Mrs. Shea, Mr. Kenny, Calgary Southeast, Mr. Moore, Port Moody Westwood, Port Coquitlam, Mr. Paradis, Mrs. Aglucac, Mr. Blackburn, Mr. Abbott, Mr. Duncan, Vancouver Island North, Mr. Richardson, Mr. Benoit, Mr. Brightprice, Mr. Lake, Getty South Shore St. Margaret, Mr. Warwa, Mr. Mackenzie, Mr. Goodyear, Mr. Merrifield, Mrs. Yelich, Madame Werner, Mr. Hill, Mr. O'Connor, Ms. Raitt, Mrs. Ablancy, Mrs. Georges, Mr. Lebel, Mr. Moore Fundy Royal, Mr. Lunn, Mr. Menzies, Mr. Camp, Pitt Meadows Maple Ridge Mission, Mr. Dykstra, Mr. Del Mastro, Mr. Gourde, Mr. Carey, Mr. Thompson, Mr. Harris Caribou Prince George, Mr. Cummins, Mr. Anders, Mr. Casson, Mr. Goldring, Mr. Mark, Mr. Bernier, Mr. Chong, Mr. Kerr, Mr. O'Brien, Mr. Petit, Mr. Hahn, Monsieur Poilievre, Mr. Lukiski, Mrs. Wong, Mrs. Glover, Madame Boucher, Mr. Anderson, Mr. Jean, Mr. Komarniki, Mr. Lemieux, Mr. Saxton, Mr. Deckert, Mr. Valacott, Mrs. Gallant, Mr. Lunny, Mr. Rajat, Mr. Reed, Mr. Sorensen, Mr. Schellenberger, Mr. Ellison, Mr. Bazan, Mr. Brown-Leeds-Granville, Mrs. Greywall, Mr. Hebert, Mr. Cramp, Prince Edward Hastings, Mr. Miller, Mr. Preston, Mrs. Smith, Mr. Tilson, Mr. Trost, Mr. Tweed, Mr. Watson, Mr. Albrecht, Mr. Lauzon, Mr. Allen, Mr. Vic Mactaquac, Mr. Blaney, Mr. Brownberry, Mr. Bernouge, Mr. Cannon, Kelowna Lake Country, Mrs. Davidson, Mr. Fast, Mr. Galipo, Mr. Mays, Mr. Norlock, Mr. Shipley, Mr. Stanton, Mr. Storseth, Mr. Sweet,
Sweet,
Mr. Van Kesteren, Mr. Wallace, Mr. Walkington, Mr. Shear, Mr. DeVolen, Mr. Clark, Mrs. Block, Mr. Bowen, Mr. Braid, Ms. Brown Newmarket Aurora, Ms. Canman, Mr. Calandra, Mr. Shorey, Mr. Dreeshen, Mr. Hobart, Ms. Hepner, Mr. Holder, Mr. Lobb, Mr. McColman, Mrs. McLeod, Mrs. O'Neill Gordon, Mr. Rathgaber, Mr. Richards, Mr. Rickford, Mr. Weston, West Vancouver, Sunshine Coast, Sea to Sky Country, Mr. Weston St. John, Mr. Woodworth, Mr. Young, Mr. Armstrong, Mr. Généreux, Mr. Arthur, Mr. Bevilacqua, Mr. Easter, Ms. Fry, Mr. Regan, Mr. Ray, Mr. Goodale,
No.
Speaker didn't call.
The speaker didn't call again still.
No, they stood up and they stood up.
Motion. I haven't stood up to ask for those opposed yet. So. The Honourable Chief Opposition Whip is rising on a point of order.
Mr. Speaker, in our haste to vote against this budget, we had not yet been summoned to vote in a negative fashion, so if we could strike those previous votes.
Perhaps order. In the circumstances, maybe what we'd better do is finish the yeas at the far end there, and then if there are no more yeas, we'll start the nays over again. Well, it appears there was people may have been over enthusiastic, as they say. The Honourable Whip of the New Democratic Party is rising on a point of order.
Well, Mr. Speaker, you probably recall it happens to us one time,
yes,
and everybody has refused, yes, that we should be treated the same way.
Yes, I don't remember, but I suppose if these things have happened. All right, away we'll go. Are the yeas all finished? Then all those opposed to the motion will please rise now.
Mr. Bevilacqua, Mr. Easter, Ms. Fry, Mr. Regan, Mr. Ray, Mr. Goodale, Ms. Mina, Mr. Bélanger, Mr. Byrne, Ms. Bennett, Mr. Bryson, Mr. Coderre, Mr. Cotler, Mr. Martin Esquamont Wandifuta, Mr. McCaig, Mr. Dosange, correction, Mr. McCallum,
then Mr. Dosange,
Mr. Dryden, Mr. Malley, Mr. Cuzner, Mr. McTague, Mr. Zabo, Mr. McKay Scarborough Guildwood, Mr. Iking, Mr. Leblanc, Mr. Murphy Charlottetown, Mr. Pachetti, Mr. Damour, Mr. Savage, Mr. Scarpelegia, Mr. Sims, Mr. Dhaliwal, Mr. Murphy, Moncton Riverview Dieppe, Mr. Pearson, Ms. Cody, Ms. Foote, Monsieur Trudeau. Monsieur Duceppe.
Monsieur Duceppe.
Monsieur Laframboise.
Monsieur Laframboise.
Monsieur Paillé-Hochelaga.
Monsieur Paillé-Hochelaga.
Monsieur Paquette.
Monsieur Paquette.
Madame Lalonde.
Madame Lalonde.
Monsieur Bachan.
Monsieur Bachan.
Monsieur Bigras.
Monsieur Bigras.
Monsieur Ménard.
Monsieur Ménard.
Monsieur Bouchard.
Monsieur Bouchard.
Monsieur Lessard.
Monsieur Lessard.
Monsieur Laforêt.
Monsieur Laforêt.
Madame de Bellefeuille.
Madame de Bellefeuille.
Monsieur Guimont, Montmorency, Charlevoix, Haute-Côte-Nord.
Monsieur Guimont, Montmorency, Charlevoix, Haute-Côte-Nord.
Monsieur Lemay.
Monsieur Lemay.
Madame Brunel.
Madame Brunel.
Madame Gay.
Madame Gay.
Madame Bourgeois.
Madame Bourgeois.
Madame Demers.
Madame Demers.
Monsieur Blais.
Monsieur Blais.
Monsieur Bellavance.
Monsieur Bellavance.
Monsieur Cardin.
Monsieur Cardin.
Madame Faye.
Faye.
Madame Lavallée.
Madame Lavallée.
Monsieur Plamondon.
Monsieur Plamondon.
Madame Freeman.
Madame Freeman.
Monsieur Saint-Cyr.
Monsieur Saint-Cyr.
Monsieur Malo.
Monsieur Malo.
Monsieur Nadeau.
Monsieur Nadeau.
Monsieur Carrier.
Monsieur Carrier.
Monsieur Lévesque.
Monsieur Lévesque.
Monsieur Asselin.
Monsieur Asselin.
Monsieur André.
Monsieur André.
Madame Mourani.
Madame Mourani.
Monsieur Godet.
Monsieur Godet.
Madame Deschamps.
Madame Deschamps.
Monsieur Vincent.
Monsieur Vincent.
Madame Tillac.
Madame Tillac.
Monsieur Dufour.
Monsieur Dufour.
Monsieur Ouellet.
Monsieur Ouellet.
Monsieur Guimont, Rimouski-Neigette, Témiscouata-les-Basses.
Guimont, Rimouski-Neigette, Témiscouata-les-Basses.
Monsieur Paillé-Louis Hébert.
Monsieur Paillé, Louis
Monsieur Dorion.
Monsieur Dorion.
Monsieur Desnoyers.
Monsieur Desnoyers.
Madame Baudin.
Madame Baudin.
Monsieur Pomerleau.
Monsieur Pomerleau.
Mr. Layton.
Mr. Layton.
Monsieur Mulcair.
Mr. Mulcair.
Ms. Davies, Vancouver
Ms.
East.
Davies, Vancouver East.
Mr. Massey.
Mr. Massey.
Mr. Harris, St. John's East.
Mr. Harris, St. John's East.
Mr. Martin, Sault Ste. Marie.
Mr. Martin, Sault Ste. Marie.
Monsieur Godin.
Mr. Godin.
Mr. Comartin.
Mr. Comartin.
Ms. Crowder.
Ms. Crowder.
Mr. Christopherson.
Mr. Christopherson.
Mr. Julian.
Mr. Julian.
Ms. Charlton.
Ms. Charlton.
Mr. Cullen.
Mr. Cullen.
Mr. Sixay.
Mr. Sixay.
Ms. Matheson.
Ms. Matheson.
Mr. Bevington.
Mr. Bevington.
Madame Savoie.
Madame Savoie.
Mr. Dewar.
Mr. Dewar.
Mr. Malloway.
Mr. Malloway.
Mr. Allen. Welland.
Mr. Allen Welland.
Ms. Ashton.
Ms. Ashton.
Mr. Davies, Vancouver, Kingsway.
Mr. Davies, Vancouver, Kingsway.
Mr. Atamanenko.
Mr. Atamanenko.
Mr. Donnelly.
Mr. Donnelly.
Ms. Duncan, Edmonton, Strathcona.
Ms. Duncan, Edmonton, Strathcona.
Mr. Gravel.
Mr. Gravel.
Mr. Heyer.
Mr. Heyer.
Mr. Stauffer.
Mr. Stauffer.
Mr. Marston.
Mr. Marston.
Ms. Chow.
Ms. Chow.
Mr. Martin, Winnipeg
Mr.
Center.
Martin, Winnipeg Center.
Mr. Thibault.
Mr. Thibault.
Ms. Leslie.
Ms. Leslie.
Honourable Whip of the Democratic Party is rising on another point of order.
First of all, Mr. Speaker, I'd like to know whether the votes of the Liberals who voted twice were counted. I've been in this House for 13 times and I've never had an opportunity to vote twice.
Pardon? I will have the clerk announce the result of the vote first. Après ça, je répondrai.
And following that, I will respond to the point of order that was raised.
Yeas pour 147, 147. Nays contre 115, 115.
Je comprends que les votes.
I understand that the votes of 5 members were counted twice because they voted for and against. So they have been cancelled out. And the result reflects that. The Honourable NDP Whip once again. Mr. Speaker, I'm just trying to understand the logic here. They voted with the Conservatives. It's not right for them to have an opportunity to vote twice and for the vote to cancel each other out. We've never seen that here in this chamber. The first vote should stand, and I would ask you to bring a decision down on that.
Le résultat.
the result for the decision of the House is the same. I will consider the arguments raised by the member later, and we'll come back to the House with a ruling if there is a problem. However, the advice that I have received is that what has happened is not normal, but the motion has been adopted because even with the change, the overall result would not change. The Honourable Whip for the Bloc Québécois. Mr. Speaker, to refresh your memory, when you look at your own decisions, in the case of the NDP wanted to rise a second time, and that was refused. It was a vote, the first vote, that prevailed. You'll look at your own decision on that, Mr. Speaker, with all due respect. I appreciate the advice provided by the Honourable Member. I will look at the precedents. I do not have that in front of me now, but I will look at it all. Once again, the Honourable Whip for the NDP. Yes, once again, Mr. Speaker. Regardless of the fact that the result is the same, the Liberals were asleep at the switch.
En tout cas,
at any rate,
adopté.
The motion carried.
Seconded by Mr. O'Connor moves that a bill entitled An Act for Granting to Her Majesty certain sums of money for the federal public administration for the financial year ending March 31st, 2011, be now read a first time and be printed. Cette motion est répétée.
The motion is deemed adopted.
Et appuyé par Monsieur
Mr. Day, seconded by Mr. O'Connor, moves that Bill C7, an act for granting to Her Majesty certain sums of money for the federal public administration for the financial year ending March 31st, 2011, be now read a second time and referred to a committee of the whole.
Pleasure of the House to adopt the motion. The Honourable Chief Government Whip on a point of order.
Mr. Speaker, if you seek it, I believe you'll find agreement to apply the vote from the previous
Which vote was that? The one before the last one. Is it agreed that the said vote be applied to this one? Agreed? Then I declare the motion carried. Accordingly, this bill stands referred to a committee of the whole. Je quitte maintenant le fauteuil afin.
I shall now leave the chair so that the committee may proceed to committee of the whole.
Seven. I believe the Honourable Member for St. John, South Mount Pearl has a question.
Mr. Speaker, I would like to ask the President of Treasury Board whether this bill is in its customary form. The Honourable President of the Treasury Board.
I'm sure that the bill is in its customary form. The voting is somewhat uncustomary, but the bill is in its customary form.
Order. Shall Clause 2 carry? On division? Carried on division. Shall Clause 3 carry? On division? Carried on division. L'article 4.
Shall Clause 4 carry? On division? On division. Shall Clause 5 carry? On division? On division.
On division? Carry on division. Shall Clause 7 carry? Carried on division. L'annexe 1.1.
Shall Schedule 1.1 carry? On division. Carried.
1.2.
Shall Schedule 1.2 carry? Carried on division.
3 carry. On division, carried on division. Shall Schedule 1.4 carry? On division, carried on division. L'annexe 1.5 est-elle adoptée?
Shall Schedule 1.5 carry? Carried on division. Shall Schedule 2 carry? Carried on division.
Shall Clause 1 carry? On division, carried on division. Shall the preamble carry? On division, carried on division. Le titre est-il?
Shall the title carry? On division.
Shall the bill carry? On division, carried on division. Dois-je lever la séance?
Shall I rise and report the bill? Agreed?
Monsieur le Président, le comité...
Mr. Speaker, the Committee of the Whole has considered Bill C7 and has directed me to report to the same without amendment.
Mr. Day, seconded by Mr. O'Connor, moves that Bill C7, an act for granting to Her Majesty certain sums of money for the Federal Public Administration for the financial year ending March 31st, 2011, be concurred in at the report stage.
Is it the pleasure of the committee to adopt the motion? Of the House, rather.
Gouvernement.
The Honourable Government Whip.
Speaker, I think if you seek it, you will find agreement to apply the previous vote. I think we understand what that is now to the current vote.
That would be the vote on second reading, I believe. Is there agreement to proceed in this fashion? Agreed? Then I declare the motion carried. When shall the bill be read a third time? Now, Mr. Day, seconded by Mr. O'Connor, moves that Bill C7, an act for granting to Her Majesty certain sums of money for the fiscal year, for the Federal Public Administration for the financial year ending March 31st, 2011, be now read. A problème avec la traduction?
Is there a problem with translation?
Appuyé par Monsieur.
Mr. Day, seconded by Mr. O'Connor, moves that Bill C7, an act for granting to Her Majesty certain sums of money for the Federal Public Administration for the fiscal year ending March 31st, 2011, be now read a third time and do pass. Is it the pleasure of the House to adopt the motion?
Honourable Chief Government Whip.
I think if you seek it, you will find agreement to apply the previous vote to the current motion, to the previous motion to the current motion.
Is it agreed? Okay, je déclare la motion adoptée.
I declare the motion carried.
Pursuant to order made on Thursday, March 18, 2010, the House will now proceed to the taking of the deferred recorded division on the sub-amendment to the address and reply to the speech from the throne. La mise aux voix porte sur le sous-amendement.
The question is on the sub-amendment.
Monsieur Généreux, appuyé.
Mr. Généreux, seconded by Mr. Armstrong, moved that the following address be presented to Her Excellency, the Governor-General of Canada. May I dispense?
Monsieur Ignatieff, following amendment. May I dispense? Monsieur Duceppe, appuyé par Monsieur...
Mr. Duceppe, seconded by Mr. Paquette, moved the following sub-amendment. May I dispense?
The Honourable, all those in favour of the sub-amendment will please say yea.
All those opposed to the sub-amendment will please say nay.
The Honourable Chief Government Whip is rising on a point of order.
Mr. Speaker, if you seek it, I think you will find agreement to apply the vote from the previous motion to the current motion with the Conservatives voting no.
Is there unanimous consent to proceed in this way? D'accord?
Agreed?
Opposition Whip.
Yes, the official opposition will vote against. Nay.
L'Honourable Whip.
The Honourable Whip for the Bloc Québécois. Order, please. Mr. Speaker, colleagues and I in the Bloc will be voting in favour of this motion. The Honourable Whip for the NDP. The NDP will be voting yes, yay, but only one time.
L'Honourable Député.
The Honourable Member for Carchatier. And I'm voting opposed twice, nay, 2 times.
Yeas pour 78, 78. Nays contre 179, 179.
I declare the sub-amendment defeated.
20 p.m. The House will now proceed to the consideration of private members' business as listed on today's order paper.
Private members' business. Étape de rapport du projet de loi C-241, loi de...
Bill C-241, an act to amend the Employment Insurance Act, removal of waiting period, standing in the name of Mr. Ouellet.
Comme il n'y a aucune motion à l'étape du rapport.
As there is no motion at report stage, the House will now proceed to a vote on the report stage. Mr. Ouellet, seconded by Madame de Bellefeuille, moved that Bill C-241, an act to amend the Employment Insurance Act, removal of waiting period, be now read a third time and do pass. Is it the pleasure of the House to adopt the motion?
All those in favor of the motion will please say yay. Yay! Que tous ceux qui s'opposent à la motion voient bien.
All those opposed will please say no. In my opinion, the nays have it.
Pursuant to order made earlier today, the recorded division stands deferred until Wednesday, March 24, 2010, at the expiry of the time required provided for oral questions. Is it agreed that we see the clock as 6:30? Agreed? Order. In accordance with Standing Order 38, a motion to adjourn the House is deemed to have been made and seconded at this time. Therefore, the question is that this House do now adjourn. The Honourable Member for St. John's South, Mount Pearl.
Thank you, Mr. Speaker. I appreciate the opportunity. I asked a question on March 4th. It was a question to the Prime Minister, and the Prime Minister has declined to direct his ministers to be open, transparent, and accountable when it comes to access to information requests. Now, this stands in stark contrast to the attitude in the United States under President Barack Obama. He really took leadership on the President's first day in office. He issued an executive order and 2 presidential memoranda suggesting and establishing a presumption of disclosure of information that is requested under the Freedom of Information Act. In Canada, a troubling situation has developed. Requests for information about what the government is doing are being delayed, disrupted, and really are harming Canadian democracy. For example, 3 Conservative cabinet ministers are under investigation by the Information Commissioner. But the Information Commissioner has had to go even further than that. I quote, "The scope and focus of the systematic investigation will be expanded to examine whether political interference in the processing of access requests is a cause of delay or unduly restricts disclosure under the Act, including any reviews and approvals by the Office of the Ministers or institutional heads." Now, Mr. Speaker, this is a very serious issue here. So not only do we have not an open, transparent, and accountable government, now we have to have our Information Commissioner going forward to see even if there's, some kind of interference by minister's office, by staff, by members of other parties to see if, for us to get information. The Information Commissioner is in place to assist individuals and organizations who believe that federal institutions have not respected their rights under the Access to Information Act. She's been very active because of the government's unwillingness to be accountable to Canadians. For example, most recently it was reported that a member of staff of an office of the then Public Works Minister had attempted to unrelease information that had been requested by a reporter. A CP reporter who broke the story on how his access request was handled by the Office of the Minister is a veteran access to information user, and he's been using the system since it came into force in 1983. And he said, in his opinion, the access to information system has been pretty much ground to a halt, and that he's never seen the system so broken. A March 2008 access to information request, for example, by the Liberal Caucus Research Bureau for all documents concerning Canada's decision to stop Afghan detainee transfer was denied in December 2009. That's 639 days later, after the issue had become a full-blown political controversy for the Conservative government. The request was denied because the reports could be used in anticipated or contemplated litigation. I want to ask again, when is the Prime Minister going to direct his ministers to be open, transparent, and accountable? What do they have to hide?
Honourable Parliamentary Secretary to the President of the Treasury Board.
Mr. Speaker, I rise today to set the record straight with respect to access to information and the government's record on this fundamental principle of democracy in Canada. This government takes citizens' rights of access to information very seriously in this country. In 2006, it was this government, that brought in the Federal Accountability Act. We made public institutions more open, accountable, and transparent than at any time in this nation's history. And we broadened the law to include crown corporations, foundations, and agents of Parliament. As a result, 70 more public institutions are now covered by the Access to Information Act, bringing the total number of organizations subject to the legislation to about 255. These organizations are now accountable to the same Canadian taxpayers who pay their salaries. Organizations like the Canadian Wheat Board, the CBC and Via Rail, the Public Sector Pension Investment Board, Export Development Canada, and many others. And we didn't stop there, Mr. Speaker. We fought for Canadians' right to know how their government operates. We got rid of the coordination of access to information request system known as CARES. This system was used by Liberals to centralize control of access to information requests. Shame. When Liberals didn't like a request or were worried about being exposed, they filed them away in a sea of bureaucracy, Mr. Speaker. That's not how this government operates, Mr. Speaker. That's not to say, however, that there are sometimes delays. In fact, the very question we're discussing today refers to a case where Treasury Board wasn't able to respond to a reporter's request in a timely manner. We in the government think that is unacceptable and are working to ensure that all requesters get their answers in as timely a fashion as possible. I am happy to point out that the Treasury Board Secretariat responded to 72% of requests within 30 days last year, Mr. Speaker, but we think we can still do even better. That's why we're still working to improve the system, to improve transparency and openness across the government. We have also been pleased to work with the Information Commissioner to ensure that Canadians have access to information about their government. Mr. Speaker, we have taken action to address the issues identified in his report last year. For example, we have asked officials to improve the administration of the ATI Act, and we've updated our information management practices to make the information easier to find. This is at the core of being able to provide information to Canadians in a timely manner. We have developed a new directive on record keeping under the policy on information management. We have also created an information management strategy and action plan that establishes annual objectives and priorities to support improved information management. And we're working with Statistics Canada to improve how they track statistics. We want to make sure that their data is useful and that it provides a comprehensive picture of the government's access to information and privacy program. We're also working to train public servants so they have a better understanding and awareness of the Act. This is so crucial because it is nonpartisan and professional public servants that are responsible for administering the Act. Elected officials and political staff are not the ones making the decisions regarding these releases. Lastly, Mr. Speaker, we are committed to ensuring continued improvements in processing requests for information. Last year, for example, we delivered some 75 training sessions for public service officials. And on average, we deliver 60 training sessions every single year. These actions demonstrate the government's unwavering commitment to openness and accountability, a strong access to information system that serves Canadians first. Thank you.
The Honourable Member for St. John South, Mount Pearl.
Thank you, Mr. Speaker. I guess members of his government didn't get the memo. Perhaps it was redacted. It's too bad this government doesn't enforce its legislation to ensure that we have meaningful access to information. I know Robert Marlowe, who was the former Access to Information Commissioner, thought the 30-day rule had become an exception rather than the rule. And I ask, Mr. Speaker, that we really do need to have leadership in this country to ensure open and effective and transparent government, and I ask that this government do so.
The Honourable Parliamentary Secretary.
Mr. Speaker, leadership she has, and she will get. That's why we introduced the new Accountability Act.
Hear, hear.
Treasury Board Secretariat responded to 72% of requests within 30 days last year, and that takes into consideration those 70 new institutions that we added. Now, these delays, however, are still unacceptable, and that is not standard practice. We expect individuals requesting information to receive a response within a reasonable time frame. This government fought for Canadians' right to know how their government operates, and our record is clear. We got rid of the system used by the Liberals to centralize control of access to information. We opened up the Wheat Board, the CBC, and dozens of other institutions to the Access to Information Act. 70 new institutions are now accountable to Canadians through the Access to Information Act. For the first time, Canadians can see how these institutions spend their tax dollars. These are important steps forward towards openness and transparency, steps the Liberals never took, Mr. Speaker. We are committed to running an open and transparent government. Thank you.
The Honourable Member for Sudbury, Violence and Sports.
I'm pleased to rise today to speak about a growing concern in our society, and that's the amount of violence we're starting to see in sports. And we've all seen the disturbing images of Mark Savard lying on the ice, not moving after a headshot by Matt Cook, and this is at the NHL level. But we've also seen Patrick Cormier and the elbow to Mikkel Tam in the junior levels. And unfortunately, what we're hearing more and more and seeing more and more are incidents at the amateur levels. Just a few weeks ago, a young hockey player in Edmonton was speared and ended up having to have half of his intestines removed. Mr. Speaker, these are examples of what is tarnishing sports in general, but particularly hockey right now. Mr. Speaker, it's high time this issue of violence in sport is taken seriously. League authorities need help to end the violence. They're doing what they can with the tools that they have. But why? Why does a savage assault, which would result in charges of aggravated assault anywhere else, warrant nothing but a few game suspensions? That is why we're calling on this government to establish a Royal Commission on Violence in Sports. Why a Royal Commission? I'll answer that shortly. But first, let's look at what a Royal Commission into violence in sports would look like. A Royal Commission is a government public inquiry into an issue. They are called to look into matters of great importance. These can be matters such as government structure, the treatment of minorities, events of considerable public concern, such as the growing amount of violence in sport. Royal Commissions usually involve research into an issue, consultations with experts both within and outside of government, and public consultations as well. If the government agreed to call a Royal Commission, a number of stakeholders could participate from all affected areas, from amateur sport leagues to all of the players, so to speak, Mr. Speaker, in the sporting world. But we can also bring in health, talk to organizations like the Brain Injury Association of Canada, bring in sports psychologists to look at how social trends are affecting sport. And of course, members of the legal community to talk about law enforcement. And when an assault happens on the ice or on a soccer pitch or on a football field or wherever it is, we actually know what the laws are that we can implement. But this Royal Commission would also allow us to talk and look into other areas like coaching, officiating, and what the sports equipment manufacturers are making this equipment out of these days. Kevlar, for example. Mr. Speaker, I'm a huge sports fan. I played, I coached, I refereed hockey, lacrosse, and football. A Royal Commission would allow us to work together in a non-partisan fashion for the betterment of all athletes from young to old and from amateur to professional. Mr. Speaker, in closing, I urge the government to do the right thing and answer the call for a Royal Commission so our young players can play our game safely without fear of violence that could end their fun and enjoyment, which is what sport is truly all about. Thank you, Mr. Speaker.
The Honourable Parliamentary Secretary to the Minister of Canadian Heritage.
Thank you very much, Mr. Speaker. Mr. Speaker, first of all, I want to commend this member for his efforts in supporting minor sports, his participation, but also his efforts to work with children in Sudbury and to support them and refereeing the various sports that he's done. These are all things that he has done because he is passionate about sport, and I admire that as a person that's also passionate about sport. Now, Mr. Speaker, on the specific issue that the member raises, I want to assure the member that the government is strongly committed to encouraging safe and a welcoming environment for all sports participants, and we're fundamentally opposed to violence in sport at any level. Now, Mr. Speaker, guided by the True Sport strategy and, frankly, following the True Sport Steering Committee, there was a federal and provincial territorial ministers meeting in 2008, and they collectively acknowledged at that meeting the issue of violence in some sports and paid particular attention to hockey, and agreed to encourage sports to take actions to eliminate violence in sport with a view to creating a healthier and safer sport environment. Ministers directed the officials to monitor the progress on eliminating violence in sport. And as a result of that, Mr. Speaker, the True Sport Steering Committee has established a working group to explore the development of a database to monitor violent incidents in sport. Now, Mr. Speaker, our Conservative government, through Sport Canada, provides $700,000 annually to the Canadian Centre for Ethics in Sports to support the implementation of the True Sports strategy. The CCES promotes the adoption of true sports values and provides information and resources to sports teams, clubs, leagues, organizations, and communities to help them ensure that sport participants, especially children and youth, have a safe and positive experience in sport. This is so critical and so important. Now, Mr. Speaker, we discussed this in question period a couple of weeks ago, I think it was, and I agree with the member. Some of the issues pertain to equipment and the fact that some of this equipment may go a little bit beyond simply protecting a participant from injuring themselves, and we need to look at those things. But I also think that there's a fundamental issue of respect, and we need to encourage respect very broadly in society, not just in sport. I think if we respect each other, then when we enter the playing field, whether that's a hockey arena or a football field or wherever that happens to be, then what we really want to do is go out and compete. But ultimately, there's no intent to injure each other and no malice towards fellow members competing in sport. That's the beauty of sport. We saw that during the Olympics, whether it was the Paralympics or the Winter Olympic Games in Vancouver. We saw the power of sport, how it can ignite the human spirit and unite people. We also see some of the incidents that have occurred that have been alluded to by the member that I think really concern folks. And I think, again, a lot of that comes back to a fundamental issue of respect, and we really need to encourage that throughout society, in all factions of society. If we respect each other, then we simply won't do that to each other.
The honourable member for Sudbury.
Thank you, Mr. Speaker. And in following my honourable member colleague's words and respect, I'd also like to show him respect and congratulate him for his efforts that he did with the Canadian lacrosse team last week. It's great to show our support to that great sport as also a player and a coach and a ref in that league. The things that my honourable colleague has talked about in relation to some of the things that have been happening now are all on the reactive side of violence in sport. We're going to monitor it when it's already happened. And what we're talking about in violence in sport and calling on this Royal Commission, Mr. Speaker, is to look at how we can be proactive, how we can actually nib this in the bud so we don't see the headshots that are happening in hockey or some of the other violence in other sports. Royal Commission allows us to talk with psychologists, look at social trends, and all the things that are bringing violence into sport. And this Royal Commission is a way that we can do this in a nonpartisan fashion where we can respect one another and we will work together to try and end violence in sports. Thank you, Mr. Speaker.
The Honourable Parliamentary Secretary.
Thanks again, Mr. Speaker. Well, we know that the NHL Board of Governors met recently and came out very strongly, or actually the general managers met and put forward a motion to their Board of Governors to crack down on these issues of hits to the head with very significant penalties, and I believe that they will actually do this. I know that this August, Mr. Speaker, the International Ice Hockey Federation, the Canadian Hockey League, they're organizing an open ice summit in Toronto. That's again this August. And they're bringing together constituents and leadership roles responsible for all aspects of the game with the potential to impact hockey at the grassroots level. That's what they're doing to address violence in their sport. They know that they've got some issues there, and we want to support them in that. We want to make sure that people feel that they can participate in sports, and in doing so, that they're not subjecting themselves to violence. Thank you, Mr. Speaker.
The motion to adjourn the House is now deemed to have been adopted. Accordingly, this House stands adjourned until tomorrow at 2 p.m. pursuant to Standing Order 24-1.